Rahman Rahim. Assalamu alaikum. Welcome everyone to the day number two of the SAMS Residency Essentials Bootcamp for 2025. Um, Yesterday we had a successful first day of a lot of unique and extraordinary lectures, and today we will continue with the same thing. Today we will have three sessions. The first one will be about academic growth and career planning. In the second session, we will have navigating wellness and belonging as an IMG. And then the last session will be an open space for sharing experiences. And I think this will be one of the most important sessions of this workshop because we will have people who are already experienced what you will experience. And then they will share their thoughts. They will reflect on what they have accomplished and what they have done. And they will give you all the tips and tricks that they will help you in your residency. So, starting with the first session, academic growth and career planning, we have our first session by Dr. Khaled Harmoush. He is a graduate from Near East University in Cyprus, 2019. He is now an internal medicine chief resident at Wayne State University, Detroit Medical Center, and he will be starting a cardiology fellowship at the University of Miami next month. Um, how are you, Khalid? Please share your slides if you have any and take it away.
Thank you so much, Mohammad, for having me as well. And it's a great honor to be speaking to you guys today at this great workshop. I think I need to send you a request to share some slides here.
Sure.
I already sent the request.
Wissam, I think.
Oh yeah, he just.
Okay.
Let me just go to the presentation here. Hello. Okay. Can you see my slides?
Yes, we can.
Okay.
If you start the slideshow, yep. Now it works. Good.
All right. Okay. So again, thank you, Mohammad, and I really hope you guys benefit from this little talk that I'm gonna do right now. So I'm supposed to talk about study resources and learning strategies in residency, or in another word, how to survive your intern year. I'm sure a lot of you now are happy and excited because you guys are gonna start something new. You worked so hard for this moment. You took years between medical school, USMLEs, clinical experience in the US, even struggling to get the visa if you're coming from overseas, like my case, and now you already made it. So you really should be very, very proud of yourself, and then congratulations on that. Now, the second thing is that I'm sure that most of you are anxious, probably overwhelmed with like, oh, I don't know anything. What am I supposed to do? How am I gonna be navigating this system? How am I gonna be like, um, dealing with residency? I haven't practiced for a couple of years. I've been doing research here or so on or so forth. So hopefully I just want to share with you like a little bit of my, experience, my thoughts, my feelings when I started, and then just kind of walk you through how you kind of navigate the year in the first 6 months, the second 6 months, and then see how things can get better after. So it's normal to feel anxious, overwhelmed, or like I don't know anything. It's not normal actually to feel overconfident because it's a new thing. I'm starting fellowship next month, and I feel like I don't know anything as well because I'm starting from scratch as well, right? So in the first 6 months, I think all you need to do is to focus on learning the hospital system and its logistics. It really takes time to learn everything. And then I don't think any of us will be able to learn everything, but at least most of the things that are really important. So what do I mean by that? The US residency system is a complex one, honestly. And it's not like, patient coming in with a complaint, diagnosing him and discharging. It's way beyond that. There are a lot of other aspects like social work. A lot of these patients come to the hospital, you know, they don't have housing, so you really need to arrange for like a what was it called, like placement. You know, send them to nursing homes. So there are a lot of social work involved in this process, and you really need to know how to kind of you know, navigate these things with the social worker, the case manager, your senior residents to make the workflow faster. So these things take time. During which just try to focus on these things first. You know what I mean? In addition to you learning the system, like learning about the patients, the diseases, the diagnosis, how to order, you know, XYZ testing. These logistics are very, very important. And you, in fact, you guys will be doing most of it during your intern year. A second point here is that a good attitude and professional behavior matter more than knowledge. Don't worry about knowledge at all. Knowledge will come with time. And then what I would say is that nobody would even care about how much you know initially, like for the first 6, 7 months, or even for the first year. All they say, oh, the intern, I need him, I need you to learn the system. So, and then try to kind of be good to everyone. Be a great listener, listen to your seniors, follow the orders. Of course, I mean, I'm not saying that the, you know, just follow a toxic person. No, I'm just saying like if the senior asks you something, if the senior argues with you or has a different point of view, try to be like receptive to feedback. Try to be like, you know, more open to understanding what they're trying to say in this case. And always be nice to the attendings, be on time, come early and leave late. This is really important during the first few months actually, because you know, like the longer you stay in the hospital, the easier or the faster you learn the system. And I'm not saying you know, leave at 8 or 9 or 10 p.m. when you're supposed to leave at 5, but sticking around till 6:30 sometimes could really matters. Like make, you know, make you learn more, take some more time writing your notes, because that will make it way easier for you in the future. And as I said, you'll be judged by your attitude and work ethic, not how much you know. So again, don't try to be sneaky and leave early or come late. It's like you will be really judged so early. I mean, this is a very judging environment, unfortunately. And the first impression matters a lot. Like if you leave, if you come late once or twice, even if you are like, you know, sick or you had like a, you know, an emergency, they don't really get it sometimes, and then oh they would just have that impression in their mind that oh, this guy is just late or this guy is kind of sneaky or so on. So you know, try to kind of maintain a good attitude and behavior, and things will go very smoothly. um this is the point number 4 or 5 is key as well. Ask questions, never leave them for later. Like it's your opportunity to ask a lot of questions, actually, anything. There is no silly questions. If you want to ask about the management of, you know, headache, just ask about it. Ask this if you want to ask the senior about like whatever thing you see in the system that you don't, you know, or the EMR, that doesn't make sense to you, even if it looks silly, just ask it. Ask your attending about everything as well, like from the silliest thing, why are we giving aspirin to a patient who's coming with myocardial infarction? It doesn't, I mean, you know, like even if it's simple, that whenever you have a discussion with an attending or with your colleagues, it will definitely make sense, and it will definitely kind of solidify the facts in your brain. Another thing that I see a lot of us do, especially during the first 6 months, is that we compare ourselves to others. And then we say, oh, my colleague, my co-intern knows more. My co-intern is shining in this rotation. I'm not. I'm still, you know, struggling to learn this, or like kind of trying to adapt. And then we need to understand one thing, that every one of us is coming from different backgrounds and experiences, especially people who have been here for a, you know, longer time, have been doing rotations for, like, I know people who did rotations for 6, 7 months. It's normal for them to know the system more than I do, because I'm starting like brand new, you know what I mean? So, and then sometimes you see someone coming from overseas like you, or and they know better and they are presenting better, just simply because they have had experience in their home countries while you did not. So never compare yourself, and never, because this will do nothing but make you feel down and disappointed. Take your time. It's a learning curve. It's a learning process. You will definitely reach the point that you're thriving to reach, no matter when, later, sooner or later. So comparison is a big no to me, and I think it should be to you as well. And then the last point here is like you really need to learn from nurses, especially those with experience. You will be surprised how much they know. You know, you especially when you are in your ICU rotations and you don't really know what's going on with the vasopressor drips, with the sedatives, with the intubation, with a bunch of stuff that you were not simply exposed to while you were a medical student or even after. So these nurses are so well trained and experienced, and sometimes they do know more than we do. And actually, in fact, a lot of them know more than we do in this specific specialty. And I'm not talking about ICU in itself. I'm talking about everything else, every aspect of medicine, whatever is it, surgery, SICU, MICU, whatever. So be receptive and be nice to them, and then always approach them. If someone gives you a bad attitude, of course, I mean, you have to set boundaries, but try to see what there's behind it. Like, is she trying to teach me here? Is she just trying to be rude? And then if you see that there's a learning opportunity from one of them, take it. Like, say, hey, I would appreciate it if you can walk me through this. Why would you prefer to use for this medication for this patient than the other one? And that would make the learning process very, very easy, actually. So again, like in a nutshell, the first 6 months will be crucial to you. Again, knowledge will not be the priority. Of course, you're gonna be spending time learning things, guys. But the thing is, like maintaining good attitude, trying to learn the system, being nice to everyone, having good work ethic, um, are what matters in this case. The second half of the year, um, you will just enjoy seeing your progress, actually. You just, sit down and say, oh, am I the same person who were like July 1st? I'm so different right now. I feel more confident in myself. I feel more confident in my abilities to manage XYZ cases. So you will feel really, really comfortable and in sync with the system. Of course, there is a huge room for improvement. Of course, there are many things to learn in the future, but at the same time, you're really, really doing a great job and you are progressing, which is what is expected from you during your first year. Take initiatives early, politely offer to help residents with them of their task. You may take some task of your senior residents, ask them, hey, can I present this case and manage it myself? And then you just supervise me. Hey, can I talk to the attending on if there's like a hospitalist rotation, can I just join you and present everything and try to put the management plan by myself and then you just supervise me. These things will definitely help you get well prepared for your second year as a senior resident. And now also you don't need to ignore the studying at this point. So set up just a study schedule. When you come back home, you're tired. I know it's really tiring and overwhelming process just to be a resident itself and an intern in particular. But just aim for 10 practice questions a day. I mean, it does help a lot. Like, come back home at 5, go to the gym, eat, and then from 9 to 10 or from 8 to 9, sit and do some 10 practice questions on a specific topic. Let's say today you saw a case of hyperthyroidism or thyroid storm, or let's say atrial fibrillation. You can read upon it, or you can actually just do some questions related to this topic. And this will really, really solidify these concepts in your brain, and you'll definitely be able to manage things easier and more confidently in the future. Another point here is that I would like to mention is that I won't say at the beginning of the second half, I would say probably by the 8 months into your internship, you really need to think about fellowships, especially if you're planning to apply for a competitive one, like GI, pulm crit, cardiology. Unfortunately, like these fellowships are really competitive to the point that sometimes you really need to know what you want from the beginning. And I'm not saying this is the right approach, but this is how the system is, dealing with people nowadays. So think of like what you like mostly. Oh, am I into GI? If I'm into this XYZ specialty, what am I supposed to do? Am I supposed to start doing research right now? Should I start making like expanding my network or networking at this point? Should I just be, in contact with the fellows to start working on some projects? This is also very important. I won't recommend doing that in the first 6 months or even in the first 7, 8 months, but definitely before the end of your first year. This is something that really that should really be considered by you guys if you're planning to go for like, competitive ones. Study resources, patient charts. As my attending once said, your patient's charts are the best and most effective study resource ever. Like in the residency, like learning in residency is very different from learning in medical school or even while preparing for the USMLEs. There's a lot of passive learning and you learn by volume. You see the case over and over and over, and then you see yourself, oh, I learned it. But at the same time, you need to kind of tailor the plan a little bit to each specific patient. You need to, try to kind of know why we are doing or why we are using this medication for this specific condition. Why not this one? Why that one? So these are things that you really need to kind of know in addition to your practice. And the only way to do this, or I mean, actually, one of the ways is to do or to read, to do questions. The most common question banks that are used in medicine, I don't know why I focused, I said MixUp here. I'm saying, and this is for internal medicine since most of us match there. But of course, I'm sure like whatever specialty you are practicing, there should be a specific question bank for that. But MKSAP or MixUp is for internal medicine. And it's a great tool for building a strong foundation and reinforcing core concepts. I think your hospital will be offering this free of charge. So all you need to do is like to do 10, 20 questions a day or 15 questions a day of this question bank. It's a great tool to build your knowledge. Your world, it's another fantastic. I think all of us are, familiar with it. It's the best learning tool ever. It's usually used for board exam studies for medicine or even for, I think, surgery. But it's a great tool if you want to use it for learning. The questions will definitely teach you a lot and then teach you more than you think. Um, so if you have access to it early on, I would recommend your world over MixUp. But again, I mean, a lot of programs don't give it early on, so just use MixUp as it. Ambus is also another one that's kind of newly emerging and becoming popular. And of course, up to date, well, it's your go-to resources for clinical questions and real learning on the wards. When you are on medical floors, ICUs, you don't know something, you're the senior resident alone, there is no one around you. Go to up to date, say, hey, management of hypercalcemia, management of hypotension, management of atrial fibrillation. So all these things can show up on up to date, and then you'll definitely be able to learn from it. I don't recommend you reading a lot from like everything from up to date because there's a lot of garbage. But again, focus on the clinical summaries, on the tables, on the algorithms, and then this is actually what you really need to know. Thank you so much. I mean, and there's like you will see yourself like going with the flow. It's again a learning curve. It's a marathon, not a sprint. So you take it easy. Don't overwhelm yourself. Learn the system, learn the system, and learn the system. This is all I would say, and this is what would matter in the very beginning of your residency. And then, guys, I mean, take it easy again, and hopefully you will all excel in whatever specialty you're doing. I hope you found this little presentation and little talk helpful, and I'm happy to answer any questions whenever you have one. And thank you.
Thank you so much, Khaled, for this lecture, and I think this is this is a very important topic because most people like they would like to know more about how to study, how to prepare. We prepared for years to come to this point, and coming to rounds and coming to residency without knowing these resources is actually sometimes harmful. But yeah, this is great. I think, Doctor, our next topic will start in few minutes. So in the meantime, I'll be happy to take some questions. Um, if you have any questions, okay. So we have Mohammad Nafi Shaar. Please go ahead.
مرحبا يعطيك العافية دكتور محمد دكتور خالد.
أهلا وسهلا.
دكتور خالد، متى بتحس انه الناس اللي ما اختبروا ستيب 3 متى بتحس افضل وقت يختبروا؟ هل باول 6 اشهر ولا لا يأجلوها شوي؟
Yeah, that's actually, thank you, Nafi, for the question. It's a really important one. Um, my advice, as IMGs, you guys already have your medical degree with you. So the sooner the better. If you are able to get step three before starting your internship, that would be great. I mean, I know now it's a little bit, probably a little bit late, but in general, take it as early as you can before residency, if you can clear it. If you can, then I think probably by the end of your first year or whenever you have a couple of elective rotations, let's say and it's February already, and then you are on, let's say, GI service or endocrine service for a month. I would recommend probably studying here, like, and then trying to squeeze this exam in between and clear it as soon as possible. Never leave it to the second year, never leave it for the third year. Some programs, I had a guy, a friend actually, who kept delaying and postponing his exam until they stopped him. They said, "Hey, you're unable to continue your residency until you do it." So this guy took 3 extra months to clear it, and now his residency is extended by 3 months. So yeah, again, the earlier, the better.
شكرا كثير، يعطيكم العافية.
Uh, you're welcome. So, any other questions? You can type your questions if you want, or you can raise your hand, and then we can take any questions. Um, Let me ask you, Khalid. I think one of the challenges that happen during residency, that most of the time we don't have time. And some people say, well, you need to like if you study for 1 hour a day, or if you study for 2 hours a day, that will be really good, very helpful. But the thing is that you go to work, you come back, you're exhausted from everything, like mentally, physically. You had like maybe a tough day or something. What is your advice that when you are that exhausted, when you are really tired, um, what are the things that helped you as a resident, and made you like open the book or open up to date and start reading?
Absolutely. A great question, Muhammad. So I think one advice I would give to everyone is have that mindset that residency is as your time to learn and grow. I understand that a lot of us come back home at 5, 6, 7, very tired, but again, you need to dedicate some time to yourself as well. So make them, if you are interested in any sport, just do this sport. Go to the gym, for example, even for half an hour, because this will help you decrease the stress, the amount of stress that were like you are having or you're carrying from your work. And once you do that, you come back home with a fresh mind. Yes, you're tired, but it's already 9 p.m., for example. Like 9 to 10 p.m. doing 10 questions, or 9 to 9 to 9:45, like 45 minutes or 50 minutes, doing questions or reading upon a topic. It's really not a big deal. Like, no matter how tired you are. And I'm not trying to be nerdy at all, actually, but because I'm just trying to tell everyone that it's really, really possible. You can, yes, sometimes you really need to stretch yourself to the max to get the most benefit out of the thing. For example, if you are doing research on the side, preparing for fellowship, that becomes really more challenging. But at the same time, you need to have that mindset that you have a goal, a target to achieve. When you have your day off, another advice I would say you may not study anything. Just take the day off to relax, do your household, go out with your friends, chill, travel if you can when you have a vacation, like a week or two vacation. And then this is what will recharge you and keep you going. It's not easy. It's very, I would say it's probably not the typical lifestyle that we all dream of in general, but unfortunately, it's the reality. And I think this is what we have to do in order to be more productive and then taking care of our wellness at the same time.
Absolutely. So talking about this, that reminds me when I was in residency. I did my residency at the University of Miami in West Palm Beach. On my weekends, I used to go to the beach with my friend, and my friend, he was a nephrology fellow, and he's a big nerd. So what he used to do, he's like, okay, we're gonna go to the beach, we're gonna have fun, and then we bring these big chairs and then sit on the beach. And then suddenly I get some papers, and then he says, okay, read these articles while you're on the beach. I was like, why? Like, yeah, I mean, why not? I mean, you're enjoying your time, but in the same time, you can read. This is a journal, you can just start reading. So we
Yeah.
used to do that sometimes. So you can enjoy your time, and at the same time, you can read, you can find something. But yeah, that was one of the things. So another question that came asking about step three again, and specifically about the score. So because most people like they care about step one and step two, and they want to get high scores in step two. Do you think that the score for step three matters? Is it going to help you for fellowship or not? Is it going to help? Maybe it's just if you pass it and that's it, and then you're done. You don't need to worry about it. How would the score affect you for the future?
Yeah, absolutely. I think in general, the score doesn't matter, even for very competitive fellowship. What would they were really, I mean, I applied to fellowship for the last, for this cycle actually, or for the last cycle, and nobody ever mentioned step three. Everyone, like those program who were filtering people based on their scores, they were filtering people out based on their step one and step two mainly. Step one when it was like a three-digit score. So step three in general, in my opinion, doesn't matter. Even again, if you're applying to like very competitive ones, the only case that it may matter a little bit is that if when you have, let's say, decent, like average or below average scores, and you did very well on step three. Let's say you did like you scored 245 or 250 on step three, and you have like below average scores for the first two steps, then probably it would just show them that this guy worked hard enough to improve his knowledge and improve his exam taking skills. So we can trust them in the future. And then know that, oh, we're confident that this guy may pass their board exams or whatever specialty it is. But in general, to be more honest with you, I mean, they don't care much. That at least that's up to my experience and my friends.
Great. Okay. So we're trying to secure for the next lecture. Um, and any other questions? Okay, so I think we're gonna move to our next topic, talking about the fellowship and career planning. And I will. We need to. We need to start. It's just because Dr. Shadi Reyes, he has something he needs to attend to. So we will start with the fellowship and career planning panel discussion. And I think Majid and Abdelkader, they are both with us. So I think it will be good if we can start early. Um, Let me see here. Um, Okay, so now I would like to invite Dr. Abdelkader Chaar and Dr. Majd Jazaerly. Dr. Abdelkader Chaar, he's a graduate of University of Aleppo in 2014, and then he moved to the U.S. He completed internal medicine residency at St. John Hospital in Detroit, Michigan, in 2019. After completing his residency, he worked at Yale School of Medicine as an attending hospitalist and assistant clinical professor. And he stayed there for 5 years. In 2024, he moved to Syracuse in New York, starting a general GI fellowship at SUNY Upstate Medical University. He is one of the stars of the education committee. He is the leader of many projects at the Education Committee as well. He will be the chair of the Education Committee starting next month. And we're happy to have Abdul Qadir. Next, we have also Dr. Majd Jazaerly. who is a graduate of Xavier University School of Medicine in 2017. He did his internal medicine residency and chief resident year at USF Blake Hospital in 2021. And then he did his cardiology fellowship at the University of Miami, JFK Hospital, and he was also the chief fellow. He graduated in 2024, and currently he is an electrophysiology fellow, um, and he is announced as the chief fellow for the next year at the University of Rochester. Dr. Majd Jazaerly, he gave a talk yesterday, and he is also part of the education committee. He is one of the shining stars, and he is actually working in a lot of projects with applicants, Syrian applicants in the education committee. So I would like to welcome both Abdelkader and Majd, and you guys can unmute yourself, and then we can talk for the next 40 minutes about fellowship and career planning. So as you can see, we have two different paths. We have Majd with who graduated from medical school. He went into residency and then fellowship, and now he's doing more fellowship. And on the other hand, we have also Abdelkader, who took a different path. He did residency, and then he worked as an academic hospitalist for 5 years, and then he started his fellowship. So let me start with Majd. Um, First of all, when did you start to think about going into fellowship?
Good morning, guys. Thank you, Mohammad, for the introduction. Actually, I was like during my talk yesterday, I talked briefly about that. I wanted to, since the beginning, even before I started the residency, I knew that I want to do something after internal medicine. I don't want to stop and be hospitalist. I want to do more specialty. I was in between, like I thought about hem-onc. I did hem-onc rotation like the month before I started the residency, and I was like, no, this is not my field. Definitely, I cannot survive this field. And then when I started the residency, I was like, I want to do procedure. So I was thinking, if I want to do procedure, I'm stuck between GI, pulmonary, cardiology mainly. Those are the main fellowships that will give you the opportunity to do procedures. And then I start exploring one by one. I was lucky to have early in my first 6 months of residency GI elective. I had it for 2 weeks only. I did the elective. I was like, I like the Mohammad, you are GI, so I'm not gonna say a lot of stuff about GI and Abdelkader too. But like, I was like, no, I don't like this kind of procedures actually. Then I was like, you know what? Let me explore the others, since I did not explore cardiology, neither the pulmonary. So when I did the ICU rotation, I was like, okay, this is interesting. You're dealing with sick patients, the sickest patient in the hospital. You're doing some life savings procedures at the bedside, but I was like, I want to do more. I want to be more aggressive in terms of procedures. So at that time, it came. I had the cardiology elective, and I did it. I was like, oops, this is what I like. And then I was like, all right, do I want to do interventional or EP? I tried to explore both. EP was way too advanced for me as an internal medicine, even for general cardiology fellows now. That if they go to the EP lab, they're gonna feel like they are lost. So I was like, you know what? I like this kind of procedure, but I was not sure what I want to do exactly. So I went to EP lab more and more and more, and I was like, I start liking, like when the electrophysiologist start explaining to me the procedure, how it goes, what they do. I was like, okay, this is what I like. And then I was like, you know what? I like the cardiology, I like EP, and I like interventional. I will decide later, but I like EP a little bit more. I'm gonna apply for cardiology. I finished like all this thinking before I finished my first year. Why? It's important because I want to do research. I'm gonna apply for a competitive fellowship. I want to do research. I want to expand my network when I apply for a competitive fellowship like cardiology. So that's why before I ended my first year of residency, I was like, okay, let's start now. So I started to participate more in research. I start like attending the conferences, the national conferences and the local conferences too. And that's it. We'll talk about the chief
Yeah.
resident and how you guys think about chief resident. What's the next step? I mean, after residency, we'll talk about that later.
Sure. So, Abdelkader, what do you think about like when was the first time that you start thinking about doing fellowship, and why did you decide to do fellowship after all these years of being a hospitalist?
Yeah, good morning, everyone. Thank you, Mohammad, and congratulations, you guys, on your match. You made it, and this is the most difficult part. Everything after, hopefully will be will come. For me, when I first came after medical school to the US, I was looking into to just do some sort of get a US exposure and try to do some research before I apply to residency. And I was lucky enough to join a program in Florida where all what they did was like GI procedures. And I spent there for like 6 or 8 months or so. That was an eye-opening experience. I really liked what they were doing. And that was kind of the very first time I get exposed to the GI ward in the US. And then I moved on to my residency. I kept that in mind. I always was saying, okay, this is what I want to do. As Majd, as many of the medicine residents, I fell in love with ICU related stuff, and this is something that I really liked. And at some point, I was thinking, oh, should I just do it? But then after getting exposed to more GI and thinking about different career path and career options, and thinking about this as a long-term career, I decided that GI is the path for me. Multiple factors play a role in your decision to choose fellowship versus not, including what do you want to do long term, getting to know what are your options if you don't do fellowship, and what are your options with fellowship. I'm someone who got exposed to both sides. Although when I did my hospitalist work, in the back of my mind, I wanted to do GI. I knew I was going to do it. It was not the time for it, and I waited a little bit, and then I got it done. Hospitalist as a general medicine is also it's a good career. It was just not for me to do it long term. And doing it kind of made my point of applying to fellowship stronger, because although I enjoyed it and I loved it and I never regretted it, and I learned so much from it, but I did not think this is something I would want to do for the rest of my career. You can talk to other people and they will tell you otherwise. We had so many people during my hospitalist work, they were doing hospitals as a career and they were loving it. They were enjoying it. It's a very good lifestyle. So it's a matter of what kind of priorities you want and what kind of things that you enjoy. I chose GI because it's a nice mix between inpatient, outpatient procedures. So it has kind of a flavor of everything. And also, in terms of the acuity of patients and stress level and all sort of different aspects of the patient care, I felt that was the right thing for me. So to simply answer, I got exposed to GI early on. That definitely played a role in my decision. And then down the road, when I did my residency and I also went over to do my general medicine job, I just, the more I get exposed to GI, the more I felt that this is something I wanted to do. And I decided that, okay, it's time to move on to just pursue a subspecialty career, because this is what I wanted to do. I wanted to be more focused on something rather than being, the general person. Again, it was an amazing experience as a general medicine, and there's nothing wrong by doing it. It was just not the thing for me to keep doing it for a long term.
So I think the main message that we would like to deliver to our audience is that um, uh, you're gonna decide about fellowship sometimes before you start residency and sometimes while you are a resident, or could be after residency. So the message is like you can decide to do fellowship anytime you want. However, you need to be prepared and you need to prepare for it. So you need to get the tools and you need to make sure you work hard to get there. So now my question to Mijid is about this kind of preparation. Now we want to prepare to become maybe a fellowship applicant. What are the main things that a resident during residency, like they will start July 1st, they will be on the floor, and in the same time they will be maybe covering nights. They have to go to the ICU, they have to run codes, they have to study, and they have all that pressure. Plus, someone wants to do fellowship. So, what are the main tools that a resident can have in order to secure that fellowship position?
Okay. So, you guys need to think about probably 4 main points. First one, and this is the most important one, is how to become a good resident. Before you like, let's say that since the beginning of your fellowship, you know that you want to do cardiology, okay? Okay, I'm gonna focus on cardiology. I'm gonna read about cardiology only. I'm gonna shine in the cardiology rotations only. I'm gonna pick up cardiology patients on the floor, on ICU. No, this is not the way that you guys can apply for cardiology. First of all, you need to be a good resident, well-rounded resident, being on time, professional, because at the end of the day, the people that you're going to ask to write your letters of recommendation, they don't care if you know a lot about cardiology or not. They care about when they write stuff, when they write letters of recommendations to you, they're going to write it based on your personality, based on your performance, based on the way that you show them that how you are excited to be one of the residents, how you shine as a resident. So be a good internal medicine resident. This is the first point. The second point is, of course, the early you know what fellowship you want to apply to, the better in terms of like organizing your thoughts about research projects, networking with the right people, showing interest, especially if you have your fellowship in your in-house. The third thing is, as I mentioned before, is networking locally and nationally. How? By doing research. So you're going to present those research by now you have social media. Twitter is very like I'm going to talk about cardiology specifically. Twitter and networking through Twitter is very important. I mean X now. It's very important and one of the most powerful tools for networking these days for cardiology. The fourth one is the research. The more research you do,
Yes, you can start.
the stronger.
Yeah, you go a demo start.
The more research you do, the stronger application your application is gonna be to get pulled out for the interview. Those are the four main points that you guys need to focus on. Being a good resident, the earlier the better. The earlier the better. Networking and research.
So, Abdelkader, hearing about these tools, and also at the same time, you had extra time, right? Because you did a residency, you planned to be like an academic hospitalist for a few years. I remember when we talked about that. You wanted to go into that path, so you had extra time. So, because you have an extra time, what did you do different, or what other things that you have done, and made you someone a good fit for the fellowship?
Uh, yeah, so basically, you have to keep in mind when you take extra time, you need to show that you spend that time, doing something. you can't just go and work for a few years and then come back and say, oh, I just decided I want to do fellowship. You need to show them that you're committed to this subspecialty. So for me, I took some time the first year or so to find the right mentor. So I think mentorship is absolutely important. You need to work with someone who you can understand and you can work with on a long-term basis. You need that person to be vouching for you. You need that person to pick up the phone for you. And a good mentor is invaluable, basically. So find the right mentor. When I got extra time, as you mentioned, so I tried to take advantage of that by showing commitment to a specialty that I wanted to apply to, and also take advantage of your time by doing some kind of unique things that maybe not everybody would do. So, I volunteered to round on the consult service as, when I was a medicine attending, I spoke to my mentor and I asked them if they can, if I can rotate with them as like a resident, basically, when I was an attending. So that was taken, as a good sign when I go to interviews and tell them that, okay, this is what I did. I went to all the major conferences in the specialty I wanted, and I made sure that I participate in these conferences every time by submitting, my projects, and I use that also to network and find new people and try to collaborate. I try to improve my skills in terms of doing research, doing some other stuff also by trying your hospital in your position. You also want to succeed, right? So you want to show them that you were a successful internist or whatever career you chose before fellowship. So I joined committees, I took over leadership roles. So I was trying to look for any opportunity that comes up, and I go there to try to participate and add to my portfolio. Extracurriculars are important. So, when you go and become an attending, you'll have a little bit more of a time, so you can try to expand and do other stuff. I worked with SAMS extensively, and that work was brought up as well during my interviews. So anything you do, it doesn't have to be only that subspecialty. You want to show that you basically you are a well-rounded person from the clinical aspect, the professional aspect, leadership, mentorship, and not only find the right mentor, try to volunteer and mentor other people who are kind of junior to you, and try to guide them through different processes. So I feel having that kind of multi-level type of portfolio will be very helpful when you get to that point that, okay, I did not apply immediately and I'm taking some time off, but I wanted to show that I'm still committed to that specialty by trying to fill my time with meaningful work and try to be engaged with other people. And then when you go to conferences, you meet all sort of people, so you need to try to get into the habit of know how to introduce yourself and how to meet people, how to collaborate with them. So that would be an important thing in your career. As a resident, I did not know about this, and this is something I'm just gonna throw out. Most of the subspecialty societies have mentorship programs for trainees. So like, for example, in GI, the American College of Gastroenterology, ACG, has a mentorship program that when they would connect you with other attendings all over the country, and you can work with them, do projects, or just chat with them on one-on-one basis to get some advice. AASLD, the Liver Society, has that. I'm sure other subspecialty societies have that. So look up these things, and then go and talk to people. I used to know all the fellows in the specialty that I wanted to do when I was working as an attending, and I talk to them all the time, try to get ideas from them, get advice, have them share their experience. How did they get there? So take advantage of everything that you could. Don't just use that time to let's say basically just to spend time and make money and whatnot, which is great. It's an important thing, but also if you want to do fellowship, you need to show some sort of commitment to that fellowship. That would be my 2 cents. It's a long 2 cents.
No worries at all. So now I heard about all these tools, but there's one thing we did not talk about: research. Majid, you had excellent experience in research before residency. I know you worked with Harvard University, and I'm sure you did research during your residency and during your cardiology fellowship. So give me some tips. How can I do research? Now I'm starting my residency July 1st, and now I need to think about doing research. What are the things I can focus on? How can I start doing research? If I know how to do it, what should I do? And what if I don't know how to do it? Then what do you advise me to do? Because I have only 2 years left, and then I have to apply for fellowship.
Right. So I'll start with the simple thing. You are rounding, you see a case in cardiology, people that are talking about it. First, you need to do your homework. Go to do literature review. If you see like this is a case that been talking like a lot of articles about it, a lot out there talk about the same topic, it might be not an interesting topic. Yet you need to talk to the right people. Let's say that you are in a community hospital. No one care about research, okay? So how are you gonna tackle this? You're gonna reach out to you need first by the time most of the hospitals, they will choose you a mentor from the beginning of the year. So if you're Dr. Shadi Reyes will talk about mentorship in detail, so I don't want to like spend a lot of time on this. But if you already assign a mentor, just talk to them. It doesn't have to be a long talk, just like 2 minutes. Hey, I had this case on the floor. I thought that it might be an interesting case for cardiology. I did literature review. I found some articles talking about the same topic. Who do you think the right person that I need to talk to? He will like navigate you to talk to this cardiologist or that cardiologist. Probably it's going to be, as a community hospital, it's going to be like 1 or 2 cardiologists might be interested in doing research. You will go and talk to them, showing them that you did your homework by doing the literature review about. So you told them about the case. I did literature review. I found these. What do you think? Is this a good case to write? You will always find some local conferences to present your case. Even though in a lot of the hospitals, they do a research day, and you can present this case during a research day. So you can write it up, you can add it to your CV, and you can present it. This is the simplest thing that you can do. Of course, if you're gonna do more complicated, more advanced stuff, you still can do that based on, are you in a community hospital or academic or semi-academic hospitals. Next thing you can think about is doing like some retrospective studies, some meta-analysis or systematic reviews. All of these depends on the hospital that you are in, your interest in cardiology, and if you find the right mentor to help you doing this. Now, if you want to do more research and you don't find any of these, you can always reach out to the cardiologist either around your area, like in academic places, or by networking and find a cardiologist that they are interested in doing research. Show them that you have interest in doing research in cardiology. You are willing to do whatever it takes you to write a research paper. I remember we had a guy, he was in a community hospital during my cardiology fellowship. He was in a community hospital. They had zero research. He had the opportunity to have away rotation with us in 1 month. After that, he introduced himself to my program director, and he showed him that I am really interested in doing research. So by the time he finished his month, he kept in contact with the program director, with me, and with a couple of other fellows. And whatever idea we think that it might be a good idea to do research, we send it to him. He will do literature review. He will write the whole thing and he will submit it. He will put the name, all of us names on it, because he showed interest and he showed that he can get the job done. So he published, I think, 5 or 6 papers even before he finished his second year of internal medicine residency. So if you are in an academic place, it's going to be much easier. If you're in a community hospital, if you find the right mentor, and if you have a cardiologist a little bit interested in doing some research, that's fine. If not, then you need to reach out to people outside of your hospital.
Ahmed, if I can expand on this a little bit. So, my advice is to start from the basics as well. So build your skills. Your skill set is very important in research. When you go and talk to people and offer to help, you need to also show what kind of skills you have. The basic thing is to know how to do medical writing, you have to kind of learn how to do this. If you've never done it, then it's important to learn how to do these things. A good start would be, SAMS academic writing course. You can look that up on YouTube. But there are a lot of resources out there nowadays. It's not that of a rare thing to find compared to our days. So there are a lot of resources. So you need to know how to build your skill set, whether you enjoy writing, so learn more about academic writing, whether you are someone who likes, computers and statistics and things like that. So learn how to do statistics. When you go to someone and tell them, hey, I know how to do certain statistics, I know how to do systematic review, I know how to do meta-analysis, you are a very valuable person to that, other person that you're talking to, because everybody will come and say, oh, I want to work with you. But when you tell me specifics that, hey, I am willing to do this, I'm willing to do this, I had experience with this, these are the things that will make you stand out, and you will become a more valuable person to work with. And reach out to, if you have fellows in-house, reach out to them. Fellows are very busy, and they are always, they will always appreciate someone to help them out, whether they have a nice case and they just don't have the time to write it, and they can give it away to you. I mean, I just this past week, we had, multiple residents help out in writing cases to submit for one of our national conferences. And, you can help them out. They will help you out, hopefully, and they mentor you through the process, and you will do the main thing, and you will learn from it. As I mentioned, the society mentorship programs are important if you do not have the right mentorship in your program. Yes, and then talk to other people, talk to your seniors, your second, your third years. If you decide that you want to do a certain specialty, you need to know every single person in your program that is interested in that specialty, and try to make it a collaborative relationship rather than, oh, you're competing with them. That's very important. So, if you guys help each other on your projects, you will get credit on that project. Your name will be on it. In the same time, they will help you out, and basically everybody will get the benefit and the experience, and will become better, and you have a better portfolio. And then same thing for the attendings. If you want to do certain specialty, reach out and make yourself known to them that, hey, I'm interested and I'm willing to do something. And the most important thing is under promise and over deliver, right? Is that how we say it? So do not overcommit to something that you cannot do. This will look very bad. If you go to 5 different people and say, I want to work with you and give me stuff, and then everybody sends you stuff, and then you end up not doing anything, that looks bad. It's okay to say no if you don't have time, or say, hey, I would really love to work with you on this project, but right now I'm on a very busy rotation. I don't think I will have the appropriate time to do this well. So if you think we have time, I would be willing to do this, within whatever timeline. If not, then, I would love to get more opportunities in the future when I have more time. It's completely I'll get it done, and then you disappear. That will look much worse. So know how to say no, and know how to organize your time to know when you are able to do things and when not. And then start looking at cases. Whenever someone says, oh, this case is very interesting, I've never seen this, or I've seen one case of this in my entire career, that is a very specific, highly specific sign that this case will go accepted into at least a conference. So whenever someone says that, just take advantage of this, and keep that case in the back of your mind. Doesn't have, oh yeah, so that would be one. And then learn how to get consents for case reports. Many journals nowadays ask for patient's approval to publish the case. So if you meet the patient in the hospital and you realize that this case is interesting and worth publishing, have a consent form ready, and we can share examples with you guys and put it in your file. Whenever you get to writing the case, you already have that signed consent and ready to go. So all these things, you don't have to be an expert in research. You just need to learn how to build your skill set and how to take advantage of the system and collaborate with the people around you.
Yeah, that's very helpful. I would like to add a few points about research. First of all, if you want to do case reports, you can actually save your interesting cases on Epic. So you can create your own list, and we can call it interesting cases. And then whenever any case show up that's interesting, you can just add that patient to the list. And then whenever you have the time, maybe a weekend off or some time off, you can actually go through it, and then you can write that case. The second point I would like to talk about is uh, you need to know your limits. If you don't know your limits, you're not going to know what you need to learn, right? So if you know that, okay, I don't know how to do statistical analysis. I don't know how to do literature review. I don't know how to do this specific thing. Okay, good. So now we know that the things that you don't know. Next step is you start to learn them. And you're going to start to learn them by taking courses, by talking to mentors, and also by working on that. So basically, if there is a research study that's ongoing, you start actually talking to people, and then you start to learn. There is something called IRB. IRB is something maybe you never heard of before residency. But now this is the time you start to learn, okay, I have to submit an IRB application. You can get approval. And then after that, after you get approval, you can start your research. So this is going to take a long time. So you need to learn all these steps, and then you're going to start to learn them by doing them. And then my last advice is if you want to have more time after residency before starting fellowship, like working as a hospitalist or primary care physician, this is your time. You can do an MPH, a Master's of Public Health, or you can do Masters of Science that will actually improve your research skills. And once you get those skills, you can start working on projects by yourself, and also in addition to other people. So you will be actually in charge, and you will be leading these projects if you know all these skills. I think we will allow some time for. Are there any things that we need to cover, Majid and Abdelkader, that we did not cover? Otherwise, we can allow some questions.
Just the visa thing. What's the decision of the, like, after residency, if you need a visa or not? Do I need to do chief resident? Do I want to go to do a research year, hospitalist, academic place versus nocturnist in the community hospitals? All these matters. I would say probably doing if you wanna boost your chances of getting a cardiology fellowship. Let's say cardiology, since I'm a cardiologist, so I talk about cardiology. If you wanna do a competitive fellowship, I would say from my experience during the interview season for cardiology fellowship when I was chief resident, at the end of the day, if you get selected to do an interview, you get invited for an interview, the most important thing is if this applicant been in continuous training, like did not have any gaps, or did he do hospitalist, why he or she did hospitalist. They want elaboration for that. So that's during the interview season. Of course, you guys are going to elaborate. But if not, just blindly, if the program director wants to choose, the program director will choose first for the applicant that the residency plus minus chief year. Chief year it's the critical year. Like it's very important, because this guy, it means that this guy was chosen as chief resident. He had some he's professional, he's a hard worker, and all these things. If not, then probably I would say a hospitalist in academic place, like what Abdelkader did. He went to Yale, and he was hospitalist there. That will expand your networking, increase your chances to do research during your hospitalist year, and at the same time, you're securing the visa issue. Of course, last thing is a hospitalist in a community hospital. Yeah.
If I may add, I just want to re-emphasize, I think Khaled mentioned this. Your job as a resident is to become a successful intern. So, an internist, I mean, successful internist. That's what you're getting trained for. Especially in your first 6 months, it's absolutely important to focus on residency training. You want to excel in that part in order for you to excel in, any other career path in the future. Fellowship is not guaranteed, and at the end of the day, you are being trained as an internist. So this is very, very important. So do not get distracted from the beginning. The first few months, learn the system, know how to be efficient, learn how to do things right. And then with time, it doesn't hurt to start thinking from the beginning, but you should not prioritize this over, being an excellent intern in your first year. Now, if you're someone who came in with an experience in the past, maybe you did a residency at an ACGME accredited program outside the US. I know we have some people from AUB or Ahmad in Qatar. Okay, you guys have done residency, have done 5 years of residency. You know the system very well. It doesn't hurt to start early in terms of your fellowship, because you've gone through all this, and most of the stuff you're seeing in your first year are things that you're aware of. But otherwise, if you're not someone who's very comfortable with the system, make sure you do this well, because this is what matters at the end of the day.
Yeah. So one more thing. So if you apply for a fellowship after residency and you don't match, your options, as Majid said, one is to do a chief resident. And number two, you can work as a hospitalist in an academic place, or be close to an academia. The other option is actually to apply for sub-fellowships. So for example, like if you want to do GI, and then you apply for GI, you don't get into GI, then you can do actually hepatology fellowship, which is non-accredited fellowship. You can do it after residency, and there are limited spots. But if you are a really good resident and someone who did a lot of work in that field, then you can actually get into that. And then after doing that hepatology fellowship, maybe your CV will be ready, and then you can apply again for fellowship. For example, in cardiology, they have heart failure, for example, and heart failure, and then in other specialties, they have other things. We call them non-accredited ACGME fellowships.
Yeah, Mohammad, I would just want to add one more thing about this. Guys, we have extensive talks about how to get into fellowships on SAMS Educational Committee page on YouTube. We had a talk about how to get into cardiology fellowship, how to get into GI fellowship, how to get into pulmocrit, and how to get into hematology oncology. We had guests with experience, and we had extensive talk about the route and what should you do during residency, and if you did not match, or if you're going to do something for the visa meanwhile you're applying for residency. So we have extensive talk about this. It's on YouTube, right, Mohammad? It's on our YouTube page.
Yes. It's actually available, and you can
Yeah.
actually listen to these sessions. So another question asking about, do you recommend doing online masters during second and third year of
Yeah.
residency?
Uh,
So yeah, go ahead, Majid.
I
You
was reading the
wanna?
question. I mean,
Okay.
be my guest if you can do master online master during your residency. You're gonna be extremely busy. You don't have
Yeah,
time to do a master. It's gonna take time from you. I would say spend this time impressing your program director and your faculty to write you a good letters of recommendation rather than spending this time doing a master. I mean, I don't like to. The thing is, when I was applying for cardiology fellowship, when I was interviewing, this came in every single interview. I was thinking about the master, but I was like, I don't have time to do this. They named me as the nickname was hard worker. So in every single interview, they were asking me like, why did they call you in your program the hardworking residents? I mean, this I was not planning to do this, but like I did hard, like I was a hardworking guy. I show up at the first, I leave the last. I was a professional, professional ties and everything. So that made the impression that this guy is a hard worker. He deserved the best. So all of them, like most of my letter of recommendation, they mentioned this in my in the letters. So I would say the most important thing for you guys in the first 6 months or the first year is the first impression. It's critical, and I cannot emphasize enough on this. The first impression is the most important thing. Be professional, show hard work, and everything will come after that. So the most important thing for you now is to impress your faculty, to impress your program director, and be a team player. Don't show that you're the hardworking guy and throw everyone else under the bus, or don't try to shine while everyone is failing. Just be a team player and a hard worker.
yeah. Yeah, definitely. I mean, doing masters during residency, it's really tough, and also it's going to make you spend more time doing the masters than actually focusing on the main work that you need to do, like during the residency, which is working really hard to become a good internist. Um, I think we have almost at the end of this talk. Any final thoughts, Abdelkader or Majid? Any other things you want to mention in 30 seconds?
No, I think, just it's doable. I can say, no matter how hard the fellowship is to get in, I can tell you countless number of examples of people who wanted to do something and they ended up getting it, whether they chose the long route or the short route. As long as you are committed to doing something, and you ask and you learn how to get things done, you will get it done. There are ups and downs, but I think, if you're committed to something in this country, inshallah, you'll get it. Like you guys got into residency, fellowship will come if you decide to do it. And fellowship is not a must, so make sure that you really want to do it. And good luck, inshallah. Feel free to reach out to us. We're happy to help with any questions down the road. And thanks I want to actually put a plug to Hussam and Yassine for organizing this. Thank you, guys. We look forward to working with you in the future. Thank you so much for putting all this together.
Thank you, Mohammad, for having us, and good luck to everyone. You guys, congratulations, you've made it, and now you're going to listen to the master, Dr. Shadi Reyes. Go ahead, Mohammad. Thank you so much.
Master, thank you.
Thank you, guys. I'm really I think talking about fellowship, it takes like long hours because each specialty is different. I try to get the most competitive fellowships like cardiology, GI to talk about. I wanted to explore like other fellowships also, like hemonc and other specialties like pulmonary critical care, other things, endocrinology, but we don't have the time to go over all these specialties. But I think maybe that will give you like a jump start on knowing what fellowship is and how you can deal with it. Our next talk will be about mentorship during residency. I'm honored actually to introduce Dr. Shadi Alraies, who is the Medical Director of the Cardiac Catheterization Lab, Interventional Cardiology Research and Cardiac Rehab at Detroit Medical Center in Detroit, Michigan. He also serves as the Clinical Associate Professor of Medicine at Wayne State University and Associate Program Director of the Interventional Cardiology Fellowship. He performed more than 600 coronary and structural heart procedures annually. That includes also complex PCI and advanced structural interventions like TAVR, MitraClip, PFO, ASD closures. He is recognized nationally for his procedural expertise and commitment to innovation and patient care. He authored over 420 manuscripts in major peer-reviewed journals. He contributed to several book chapters focused on outcomes in coronary endovascular interventions. And Dr. Alraies is a dedicated educator and mentor. He has received multiple honors for his contributions to medicine, including Top Doctors Awards in Detroit for 2022, 2023, and 2024. In a nutshell, Dr. Shadi Alraies, he's a celebrity in cardiology. Just like we have celebrities in Hollywood. I know Dr. Shadi Alraies for many years, and he gave a lot of talks with the education committee. And I'm really happy to have him here and take him from his family today to talk about mentorship during residency. Thank you so much, Shadi. Please go ahead if you have any slides, you can share them.
Thank you, Mohammed, for the invitation. You can hear me okay and see the slides?
Yes. Yes,
Okay,
it's all good.
perfect. Thank you. Thank you. Sorry again for the confusion. The email went to spam, so again, I apologize. It was supposed to be an hour ago, so we got it done. I was rounding, so I had to drive back home because the laptop was at home. Thank you again for having me. And sorry, but the bio should be way shorter. I thought this is for CME purposes, so it should have been like one line. I'm really privileged to be with everybody. I'm assuming the audience is all people who match in residency are going to residency in July 1st. Is that correct?
Yes,
Okay,
all of
perfect.
them matched into residency.
Congratulations. You should be proud of yourself. This is a great achievement. Excitement yet to come. And I'm just going to touch base on mentorship topic. I was listening for the last 25 minutes on the conversation from the committee and the panel. Great questions, great discussion. I'm going to just maybe on the mentorship topic, just summarize it a little bit for you, just to help you, guide you more. But I think you already got 90% of the topic nailed by the committee. All right. So this is a question comes all the time. And where do you see yourself in 5 years? This is a question comes in interviews for medical school, for residency, for fellowship. And this is a question eventually is what do you see yourself in 5 years? You have to sit with yourself and decide, write on a piece of paper or on your phone or a note or somewhere, where do you see yourself 5 years? Now you are July 1st, you are starting new. Are you going to be a fellow? Are you going to be attending? Do you want to be a great physician? Do you want to be a father? Do you want to be a mother? Do you want to be a great, a proud son, daughter? Whatever you decide to do, just write it on a piece of paper and try to visit that goal every week, minimum, to see if you are on the right trajectory. I do that, try it, practice it. I'll show you some things about the timeline. So this is your timeline during residency. You're going to move to a new city, a new environment, cold, hot. You like cold, you like hot, but the weather is different. New system, Epic, Cerner, whatever AMR you have. There's a lot of adjustment happening. And you'll be separated from your family. Maybe you're separated from your spouse. You're maybe traveling 1,000 miles away from your family. You have to cook. I never learned how to cook, so I have to go and rely on pre-made meals and canned food and stuff like that. So yeah, there's a lot of changes happening to you. So, so this is going to be a challenging time. Second thing, that's going to be the first 6 months of your time. You're going to be spending adjustment, acclimation with the system, learning the flow of the rotations. You're going to go through 1 through 6 months of different rotation till you adjust to the residency, see the pace of the residency and which rotation going to be light and which rotation going to be heavy and which rotation going to be helping you to kind of build on the next phase in your career. Bottom line, your job is to look for opportunity, not to overwhelm yourself, as Shabab mentioned earlier, that don't over promise. just look for, study the situation. Your first 6 months, just listening and observing how the residency is behaving. What time is good? Is it elective for infectious disease, or is it going to be a busy ICU? Which is realistic? I mean, obviously, when you are lighter rotation on elective, then you start looking for fellowship application. This in the second phase, the second half of your first year. This is when you start to have your hand on the pulse, start to understand, okay, I want to do GI, I want to do cardiology, hemonc, whatever it is, and start reaching out to the mentor. Because the beginning of, end of first year, beginning of second year, this is where you have to, خلاص يعني you learn the stuff. الشباب mainly عربي صح؟ الشباب the audience Arab. So
Yes,
يعني
yeah,
Okay.
كل عرب.
Yes,
إذا
yes.
بتحكي عربي
كان
no
ترسم
problem.
عربي words perfect. So يعني خلاص you mastered the year. هلا now تبغى خلاص شد المئزر وده خلاص you have to, you are the mentor for the first year intern who you were before, but yet now you have to start a new task, which is the research and papers and stuff, if you want to do it, or maybe a master in public health, maybe a master in business. You want to be, whatever you want to do, but this is your opportunity to do. And then eventually, when you match, you're going to move to another state and start preparing for the board, because you're going to be starting a fellowship in August and July. Your board is going to be in August. So again, you are constantly busy. You think the match was a tough a process, absolutely, but when you go, this is going to be your life. So the bottom line, you need to adjust to the changes. You are very dynamic. You already reached this phase. Now you go from 3 stars to 4 stars or 5 stars. Maybe majority of you already 5 stars, but this is where the time you master the skill. So I'm going to tell you a little bit about my journey quickly. I'm humbled to share it. Nothing too shy. It's my CV written it all over the place. I did 3 years residency at a community program that now they shut it down a year ago and they demolished the building. So this place does not exist on earth anymore. It's gone. So a community program, I imagine a J1 visa. If you know, some of you are already on it. So I didn't know what's the difference between J and H. I didn't do my homework. I don't know what, I wanted to go to university. SubhanAllah, didn't work. So I went to a community program. And community program is just put you to work. Admission, discharge, rounding, this, that, ICU, rotation. So it was purely clinical work. Zero interest in research. I did 1 poster on a case report the final month in my last year before I left. And I was proud of myself. And I will show you a picture of it. So after that, so I need to apply for fellowship. Surprisingly, I didn't match. I mean, no surprise. And then, but I already back in my head, I want to fix that J1 because it was bothering me. It was early on, before the revolution, before the war. So it was, I want to fix it. So I went to do a job in a hospitalist, but Abdelkader, he did. I think I met Abdelkader at that time when I was a hospitalist. And then I worked for 5 years. I did. Then I started to learn research. And this is where the problem is. I'm doing a heavy clinical work as a hospitalist, and yet I want to start learning new research skills. That was a challenging. And I don't recommend this route to anybody, Saraha. If you can match right away from residency, please go ahead. So I'm trying to tell you now what you have to avoid in order to avoid going through what I went, and use this as a last backup. One of the questions came, what should I do if I didn't match? Is this? Yes, do it, but don't rely on it, because you shouldn't have any plan B, because it distracts you from plan A. Your plan A to match into fellowship, to go to a job that you want, to build a family. And then I went to 3 years fellowship. At that time, I was through a grant, so I got an MPH, and then I went to advanced training after the cardiology, and then eventually got a job / career. And we'll talk about this in a minute, because most of us go through this, and then we kind of slow down, or we get to routine the job that everybody has. So this is my abstract. So St. Vincent was my program. Dr. Alraies on the left and Dr. Christie on the right, program director and super director. Look at my poster, horrible. And look at my hair, it's amazing. So the poster is like congested, a lot of text, complete disaster, right? So, but I was proud of myself because that's first one. That's my first poster I have done. It's a case report, nothing crazy. Somebody ingested cocaine, induced Brugada, big deal. But it's written before, but I got it accepted in a local meeting. So I was proud of myself. And after that meeting, I shaved my head. I'm just kidding. A few years later. Then I went to the hospitalist job, and I met Frank Mishora, but unfortunately he passed at age 43 with a colon cancer. But he is the one, I'm talking about mentors, right? Mentors. He is the one who taught me how to do medical writing. And if I tell you what I was doing with him, I was doing case report, and they said, Shadi, stop doing case report. This is complete. It's good to have it, use it, do it, but also try to learn to do scientific writing. So, and I told him, okay, can you show me? So I usually type it, write whatever I want to do, whatever is paper or something. I throw it under his desk and under his door at the end of the day. His office was few steps from me. And then next day, everything scratched and red, wrong, spelling, grammar, slaughter. No ChatGPT, no Grammarly, everything complete, like raw. So he literally, and he was very harsh person with criticism. So I took the punches. I said, okay, I mean, you give me the feedback, I would fix. Eventually got a first paper. It took me 15 months to publish a first paper with him. Again, unfortunately passed away with colon cancer 2 years later after I met him. Then I met Dr. Alan Klein. This is where I moved to a cardiology research, started to work with a cardiologist after emailing 17 cardiologists. The 18th was Alan Klein to tell me, okay, please, you can come and join my lab. Give me a raw number, not raw data. I was literally just collecting data. Didn't write single word or abstract for 1 whole year. He gave me 3,500 patients, just billing data. I have to go and collect 250 field for each patient. That's, if you do the math, it's going to be in the range of 25,000 field I have to fill. So it took me almost 6 to 7 months to finish, cleaning up for 2-3 months, and then we start publishing from this with Dr. Alan Klein and become like a foundation for a bigger database. And eventually we got funds and stuff like that. But and then I departed the Cleveland and for fellowship. Again, what I'm telling you this, importance of mentorship, importance of communication, importance of not giving up. And I owe these people, I owe them, like, for putting me on the right track. And I'm sure everybody on the call has a mentor who give him a glimpse or a direction where he or she changed your life where you are, because he gave you something that really wasn't in the back of your head till they kind of got this bulb in your head. So again, we moved on. We started to work with other people. I know if you're in Shabab here, Mohammad, Saud, and then other fellows, all of them now graduated. They were fellows, resident doing research, first year, second year, whether they are in St. Vincent or Case Western or Southern Illinois. There's some people in MedStar, Washington Hospital Center, and eventually all graduated. All of them have jobs now. All these guys you're seeing here have jobs. They're done. They're graduated. They're grown up. They're doing, and they're mentoring other people. So here's the thing. So you have to learn what is the difference between a job and career. So usually this is more interactive, but I will summarize it for you. July 1st, you're going to do a job. They give you a contract, show up at this time for a morning report, lunch at noon, 1 you go back to rounding, 5 sign out, go home, come back, repeat. They give you income, they give you insurance, it pays the bill. Maybe you like the program you're in, maybe you hate it. The career on the other side is something you have to make. You have to create that time for. So you have to make sure that you have the right tools and the right mentality to make sure you carve out time when you are down, when you have time down, and during your training on your day. This is where I'm gonna okay, this is time to switch to flip the switch and go to do my research, or to flip and go to do something that will put me on the right path for my career. One of them is mentorship. But again, what is it? Doesn't bring you money, doesn't give you any reward, but it definitely going to help you achieve the goal that we just talked about. Where do you see yourself in 5 years? So keep that in mind as we go forward. The pathway, the guys, I mean, on the panel and other SAMS leadership, I mean, people can be a great clinician, can be great educator, program directors, research and funds, and all administration, or go to MBA or become CEO or CMO, or even like a chair of a committee or organization. So you have to have the drive, but you have to have dedication and networking and teamwork. And we'll come on that in a second, but also you have to have the passion. The first person, when he or she emailed me, I'm interested to do research, you can, from the first conversation, from first one line of conversation, you know if he or she really want to do it or not. or if this person is committed or not. You build that, and then sometimes you give him a chance, and maybe it's going to work. Sometimes you surprise you, but really the passion, the drive inside you, this is what should come across when you communicate with your mentor. So to kind of summarize it in a quick 10 slides, I was asked to do what are the challenges of early career, people who graduated from interventional cardiology, what are the challenges of building a career after training. So this is exact same tools you can use, what you do exact same thing after you match into residency, or what are the barriers for you, how you can be a successful after residency, why you don't talk about it now. Why we should wait till we finish residency and say, okay, what I should have done. No, let's talk about it now, what I should have, or should I do now to avoid these mistakes. 10 bullets, 5 years goals. Again, I cannot emphasize on this. They use it in business school and medicals and marketing school. You have to have a 5 years goal. These goals are clear, crystal clear, and this is exactly what you want. Exactly. You want to buy a Tesla, put it on the list. You want to get married, go put it on the list. If you want to match into whatever program for fellowship, put it on the list. Why? Because every week you go back and say, okay, in the last 5 days on a weekend, the last 5 days, did I work on these objectives? Yes or no? Did I meet with the mentor that I need to talk to put me on the right side? Yes or no? Why didn't it work? Oh, I didn't have time. Okay, everybody doesn't have time. I don't have time. I have 2 kids, my wife, I have activities, I have to spend time with them and work, clinical work, as well as research, as well as mentorship. So we have to make sure, adjust goals based on the time. And I mentioned that earlier. When you start your residency, don't stress out about research in the first 6 months. Please don't. Don't stress out, because if you are a great researcher and a lousy clinician, your letter of recommendation gonna be bad. And if it's your letter of recommendation from PD, program director, is bad, done. Done. One mistake, one letter, done. So you have to be the superstar clinician. I'm not saying the smartest guy who answer all the questions from textbooks, but the guy who show up on time, the guy who take care of the patient, the guy. So I'll give you an example, a great resident. Rounding today, before I rounded, she texted me, Mrs. X is doing well, groin is great, hemoglobin is stable, lactate is 1. I think we can switch her to this medication. I will see you at 9 o'clock. What do you think I rate this resident? 5 stars. She gave me the sign out, told me exactly what happened in the last 12 hours, and yet she's ready to meet me at 9 o'clock for rounding. So this is the best. This is, for me, if she asked me for a little recommendation, this is a great attestation for hard work. Great attestation for being on top of the patient care. Because if the patient die and you give 3 papers, I really don't care. You have to be a good doctor, right? And that's what you give your impression, your PD, associate PD, and all the faculty, that you are a great resident. So that's why I told you first 6 months, don't worry about it. Look for a new opportunity in the next 6 months. Now you ask questions. I'm not saying be completely silent. Ask questions for the people who are doing research, who's the right person, but your focus is to master the clinical skills. So mentorship, who's a good mentor is very, very rare, but what their job is, the mentor who gives you new ideas, the person who gives you new opportunity. Like Shabab mentioned earlier about the panel, like I am good at meta-analysis, but I need somebody to guide me with ideas, okay? So if you come with a skill, right, that help that mentor put you in the right spot, perfect. Think of it literally, you are an assembly line, مصنع سيارات. واحد بركب باب، واحد بركب شباك، واحد بركب داشبورد، واحد بركب دواليب. You have to be the master of something. You cannot put the car all together. بس إذا بتقول لي أنا والله أنا ركبت شي 1000 باب من قبل. 1000 wheels before. Oh, great. This is a great skill. I'll put you on this. I'm going to put you on every paper that requires this skill going forward. Guess what? By the end of 1 year, 12, 13, 20 papers coming out at the end of the year. Tremendous amount of abstract. Why? Because you showed the mentor what you are good at. And this Abdelkader mentioned that. Come up with a skill that will show the mentor that you're good at, so they can exactly fit you where you deserve. Clear? And then try to build your network, because when I work with Alan Klein, my dedication for 1 year is I did not mention to him, or I didn't give him the impression I'm going to work with another person, because my paper wasn't coming. I was collecting data. I thought it was a waste of time. I said, give it a chance, be patient. You already didn't have a zero chance before. He opened the door. Don't screw it up. And that's exactly what happened. Till he asked me, hey, Chadi, by the way, Deborah Kwan needed help with the MRI project for pericarditis. Would you mind helping her? Boom, done. I go right away. And let's open a door for me. That's the opportunity that the good mentor will give you. The mentor that will not just like jail you in their cell and just you are mine and ownership and loyalty. No, you are loyal to the mentor, but let the mentor guide you. But if the mentor, you feel like he's so much controlling or she is so much controlling and you are not achieving what you want, then maybe it's time to move on with a different one. But the bottom line, mentor help you bypassing a lot of obstacles. Give you idea, stimulate thinking, give you opportunity. Hey, Chadi, there's an application for abstract. Deadline coming up July 7th. What idea do you have? Do you have ideas? No. Let me write you a couple of ideas, see, and then run the numbers. Maybe that will be a good opportunity for abstract. Help you stay on track. And that's very important. Like when you are, like, let's say your father or mother send you to bring bread, right? There's a task assigned to you. روح جيب خبز. And then you have to come back, right? إذا طولت شوي, what happened? They call you. وينك؟ عم نستناك. بدنا ناكل. Where is الخبز? Where is the الفطاير? Whatever it is you are assigned for. So the mentor keep you on track. Now إذا بجوز إذا رجعت تأخرت بجوز تاكل قتلة وتكون صغير يعني بس that's a different talk. But this is the mentor mentality. He want to or she want to keep you on track so you don't go and derail from the mainstream وتروح بالdirt وبالwilderness والطريق السات قدامك هون. So that's what they help you with. And that's very important mentor skill that they should help you with. So again, mentor give you ideas. What are the skill set that, or the things that should you show the mentor for the mentor to give you everything? Be enthusiastic, energetic, organized, focused, and behave with integrity. And the last one is very important. You have to have some integrity. المصداقية, الصدق بالعمل. You cannot play around. These guys are really smart. Wallahi, يعني from the first behavior, you show يعني أنت والله. Give you example. We assigned data collection for 30 residents, for each of them to collect 150 patients for the database. Everybody on track, 2 or 3 people lacking. I am sick. Okay. My wife in town. Okay. أمي إجت. Okay. أنا المطر كويس. عواصف نقطة كهرباء. Okay. خلصنا. يعني okay. I قلت له يعني قعدت معه بعد after 2 weeks like okay. You give me every excuse under the sun. يعني are you interested or not? Are you in or out? I'm in. Give me a chance, please. What do you show? قلت له okay. One more week. Nothing happened. Guess what? Out. Integrity is very important. I'm not saying that it's a military service, but it's at least you show somebody opened the door for you. You should do the same thing. I was the first one to come with a client, the last one to leave. He told me, can you finish in 6 months? I finished the data in 5 months. I said, yeah, I'll do my best. I don't promise you 6 months. I have full-time job. Same thing. Time management is very important. We have a different talk about time management. I gave it like territory early May for a different society, but time management is very important. I'm بحكي على time management. I didn't show up at 10:15. يعني I should practice what I preach. But time management is very important. You have, if you assign tasks to you, finish it on time. Be efficient. هلا يعني you are a day and age. All of you are millennial, or all of you are kind of Gen Z or Gen X or Gen Alpha. But everybody has a phone. You can do things on your phone. You can check your email. You can log into the journal. Just check your websites, deadline, application, ChatGPT, draft a proposal for a grant. Everything is at your fingertips. There's no excuse not to do work. بدل ما تروح على الانستغرام وعلى الفيسبوك وتتفرج على هذا عم يطبخ وهذا عم يقشط شعره وهذا وهي اللي عم تلبس يعني خلصنا. Don't waste time. 5 minutes, okay, debrief, and then go back to work. Okay. Avoid taking work home لأنه يعني especially if you're married, have kids, start to spend time with them, and use the protected time if you have time. And what I mean by this, during residency, they're going to give you research month. Guess what happened research month? I'm talking about myself. كنت أنا شرف على الشغل الساعة 9 قهوة بإيدي بتفتل بروح على المورنينج ريبورت بعدين بروح على النون كونفرنس بعدين بروح على المكتبة بحكي مع الشباب بعدين بطلع على البيت. It was a complete waste of time. ليش؟ I didn't have a target. I did not have a focus. I didn't have a 5 years vision. I didn't have a mentor. Again, I'm speaking my experience. It was such a waste of time. حرام كل وقت انكب. I should have used it differently. When you meet with a mentor, you have to be prepared. Yani you have to push as he's pushing you, as she is pushing you, you should push back. Be prepared. Okay, so I did what you asked me to. I finished the task. What's next? Wallah, I'm waiting for you to review the paper. Okay, please, when can you send back the paper for me to submit? I'll get back to you next week. Next week, ask them, what's next? Can I submit to this journal? Yani you have to push on the mentor with the agenda. Respect the time. have realistic expectation. يعني don't expect انه هو راح يكون مثل يعني صاحبك بيطلع عليه بالقهوه وكذا انه he texts you back. Give him some time. If they respect and would like to communicate via email, use the email. If they give you the cell number, don't abuse it. Don't burn yourself. I think you are way far from this, but I'm telling you before يعني from personal experience, make family a priority دائما يعني kids, family, mom, dad, brother. You are growing up in your career, but also remember you are growing up in age. And remember, your mom and dad are growing up in age. صح؟ عم يكبروا, they need somebody to take care of them. So keep that in mind. انت عم تكبر. انت دكتور صرت بامريكا وبورد سيرتيفايد على عين راسي. But هدول ابوه وامك, you have to take care of them. Okay? Don't have arrogance وانت ما بتعرف انجليزي وما بتعرف السوق. Please keep this on the side. You're worth nothing. Your mom and dad brought you here. You take care of them. Period. Revisit your goals. دائما انت ركز whatever you are doing. Make sure that you did the last 5 days. It matches the 5 years plan. And if you want to dissect that 5 years plan to yearly plan, monthly plan, weekly plan, be my guest. And even this is even the best thing. But if you want to use the Eisenhower grid, you know what's Eisenhower? Eisenhower, let's go important and urgent, بعدين important but not urgent, بعدين not important, not urgent, or not important but not important but urgent. So these things put it together. يعني إذا بتحط التاسك هدول بهالجدول هذا اسمه Eisenhower. You can Google it, Eisenhower complex, and that can help you with organizing your time. I'm going to pause here on collaboration because there's no way for you to flourish without collaboration. 2, ego, stay on the side. In research and clinical practice and work, keep your ego on the side. Wallah, أنا متشت ببreak program, I'm attached to great program, I'm not going to look at the guys below. Ego on the side. Collaboration come across as a humble, it's a mental game and shows your enthusiasm to work and build your network. And the more you are advanced in your training, خلصت medicine, let's say you went to oncology, your circle of trust gets smaller and everybody knows everybody. So if you do something good, your name will come up more. You get nominated for committees, you get nominated for societies, you get nominated to get awards. But on the other side, if your network is small and your reputation is not good, also can reflect on you bad. يعني مثل انت بين اهلك, واحد مثلا عمل مشكله بين اهله, خلاص معروف بالعائله انه هذا مش كلجي. او واحد صيته كويس وكريم وبيصدق وكذا وبيساعد الفقير, هذا صيته كويس. The same thing with the societies and community. The more you are going in fellowship, the more. So collaboration is very important. So what is required? Networking. Go to conferences. Please go to conferences. You have CME money. They gave you $2,500, I think, on average every program, every year to go to conferences. Use it. أحسن من هيك, submit abstract and go present and use it. Go travel. Sometimes most of conferences happen in Chicago. It's amazing. Go to DC, Orlando, San Diego. When كمان Denver. بيعملوا conferences يعني Phoenix يعني explore the world. It's a free trip and you collaborate and build up on your skills, because when you go and see other people what they're doing and what they are presenting about and give you ideas, access to database, and then become more experienced, you go back to home, that's what gives you more collaboration. This is for the question. This is very important slide for the people who asked how I start, where I start for research. I have zero response. Collaborate and tag along with your senior resident. Yeah, collaborate can be within your institution. يعني هلا انت first year resident, work with the second year resident who is known, and for sure every resident there is that superstar research guy or girl who has access to data and they know what they're doing. So tag along with them. راح يعطوك شوي pushback, or you are slowing me down, or you don't know يعني much of research. You can وفي just wait arrogance وشوفة حال. يا أخي swallow this ego وبلع الموس get in. Don't have that push. ما حكاني وشبه هي شايفه حالها وما عم تحكينا وعنده abstract. طب لا. If there's an opportunity, I'm not saying يعني هي نفسك to go work with somebody. I'm not saying this, but I'm saying it might come across because they see I know more. Got my point. هي Abdelkader ذكرها under promise and over deliver. It's very important. يعني be enthusiastic, energetic, but not commit to too many people and then don't deliver on all of them, or commit to 3 people and deliver to 1. طب هدول تاني 2 letter of recommendation time, you have to write your recommendation with second or third person name is better on letter of recommendation than the first one. We didn't deliver. Even worse, اشتغلت مع الأول بعدين كبيت ورحت مع الثالث لأن الثالث اسمه كبير وهذا الأولاني كان junior guy. Guess what? If senior guy gonna talk to the junior guy لا شلون شغله معك بقول لك ترى هذا الزلمة شو إيدك منه. I gave him a project. I thought he's interested. He didn't deliver. Guess what the senior guy gonna say? He's gonna give you a letter. It's gonna be very average. Guess what you did? You destroyed everything. A 6 or 12 months of work completely destroyed. Don't do that. Don't do that. Let your mentor lead you to the next one. And remember, there is politics in each department. يعني مو كل الناس حابة بعضها بالdepartment, by the way. يعني it is in GI department or oncology or cardiology. Let's say there is 20 faculty. ما تحسبون هدول يعني they're happy family وهذا كله بيكره بعض كله يعني عم بيغرموا بعض. ف when you work with X, Z بجوز يتضايق منك انه ليش عم تشتغل مع A مع A تشتغل مع A B بيتضايق او تشتغل مع B ال A بيتضايق. ف all what you have to do if these guys are mature enough, work with one and don't jump to the next one. لانه اذا كان هذا مو صاحبه او مو صاحبته انتهى وضعك. اوكي فانتبه من الموضوع هذا. take appropriate risk. What I mean by this يعني احيانا انه المنتور تبعك he doesn't deliver, it doesn't give you يعني or he deliver with some people but not with you, it doesn't give you what you are looking for but with the other he does or she does. Maybe there is some misunderstanding between each other. Sit together, understand it. احيانا بيكون harsh عليك. احيانا harsh feedback I think the best feedback. يعني أنا don't get me wrong, I was talked to in a very harsh way. يعني بعد ما طلعت الأوضة يعني إنه ليش هذا بهدلني؟ يعني طلعت إنه why I feel like, but then you know what was the best life lesson? Was the best life lesson I did. Until now I don't do the same mistake. شو كانت المشكلة؟ إنه when I submitted the paper I flipped names. حطيت واحد قبل الثاني. I didn't pay attention. There was an email coming. I flipped names. مو إنه أول وثاني. كان ثالث ورابع وخامس. فيعني I flipped the names. يا لطيف قنبلة ذرية بالديبارتمنت. ليش ومدري شو ليش زحيتني لهون وبعدتني لهون. فعهدوني أنا what's your intentions؟ قلت له والله there's no intentions. It's a mistake. I didn't see the email and to change the order of the authors. Can you communicate with the journal? Make sure before it goes on PubMed index we have to make طب خلاص عملنا. مهم. And they didn't fix it. I tried, didn't fix it. كرهني اللي حولت له اسمه للخامس وانتهى الموضوع. What I learned from it? Don't do it again. Get involved is very important. One of them is doing like what Shabab is doing. يعني Dr. Sayyid will volunteering for SAMS societies, send proposals. There's a lot of conferences happening now in SAMS back in Syria ولا هون ولا get involved as much as you can and volunteer. This helps you build your network. بصير they tap on you because you become visible. So they will tap on you to do the same thing next year. And as you're progressing, هلا انتوا نفسكم انتوا هلا you are a mentor for a medical student or mentor for somebody trying to come to the United States. So be humble and send the elevator down. يعني they call send the elevator down شو يعني؟ يعني انه وصلت لفوق يعني ما تخلي الاسانسير فوق، نزله تحت، خلي حدا somebody else picks up. يعني don't have that mentality انه I did it the hard way, you have to do it the hard way. Why؟ يعني خير. It's fine to help somebody else. That's the mentality of mentor. As a matter of fact, if you start with this mentality, you're gonna struggle as a mentee, as a mentor. So an investment medical student, they are really can help you. I have medical students right now who are way better than resident in writing. And the resident now relying on them to write their papers and help them in collecting data. So you never know where is the click going to happen and where is the access. And guess what? Medical student, they get discount for database purchases. So بحط بأسماء الميديكال student, I get discount. Instead of buying $5,000 for a database, I pay $1,200. ليش؟ لأن حطيتها باسم جورج ولا حطيتها باسم أنتوني. Got my point? Be realistic in your expectation. Send time to the mentee to teach, and have access to tools and help them. So best mentor, productive, have a track records, respect the time, minimize unnecessary delays, communicate openly. ماشي? And open feedback and criticize your performance. Expect to fail. We're all going to fail. You're going to fail. It's going to happen. You're going to have rejections. You're going to submit abstract. You're going to be rejected. You're going to submit paper. You're going to be rejected. The problem here, you try and fail better than not doing anything. يعني أنا وقت بقعد بحس حالي إنه there's something, everything going fine. لحظة شوي, there's something wrong here. Why everything going fine? It sounds crazy, right? But that means I'm not improving. معناته I am got يعني فرضا إذا أنا عم برقد ماراثون 10 miles and always the first. طب لأشوف مين الأودينس. طلعوا الأودينس كلها crippled و nursing home. طبعا I'm going to be the first. So what you do, you pull yourself from that, put yourself with the people who are trained for a marathon, and see if you are the first. And good luck. So that's a problem you have to do. You have to take yourself from a very comfortable environment, put yourself in very uncomfortable environment to branch out and grow. All our work on research on WhatsApp, Google Sheet, Google Doc, I don't do anything on the cloud. So nothing. So you are everybody savvy. You are all have smartphones. So have that skill. It helps your mentor. And believe me or not, the generation of mentors right now, they're not familiar with these tools. So if you are the one who's going to introduce them to these tools, bingo. Don't be cheap. Buy a good laptop. The hospital or the residency give you money for it. Good laptop, speed, ما في مشاكل. والله أنا بدي آخذ CD ولا بنزل version مضروبة وعطاني الشفرة. But يا حبيبي خلاص. It's time now to have good, certified, licensed software on your laptop. Why? Because when the time to run, you're ready to run. Google product we spoke about. Ultimately, you're going to have as many PubMed papers as possible. Quantity or quality. Quality, absolutely important, but you have to have some number before you apply for a fellowship. Think of scientific writing. Always search in the Google, call for science, deadline for abstract, whatever specialty you're looking for. There's a lot of meeting happening all the time. Some of them are low-hanging fruit. You can hit and get your name on multiple abstract. Some of them are harder, like TCT, American Heart Association, ACC, harder. Acceptance rates from 20 to 30%. So keep that in mind. Abstract mentality. We call the abstractologist. This is when the residents start. خلاص كله متحمس بده هلا مطبعة abstract. When you get one in, 10 صاروا بعدها. But it's fine. It's okay. I'll tell you about that, my take on that. When you have a deadline, have an idea, go to your mentor, pull the data, analyze the data, ask somebody to help you with analysis if you don't have the skill set, and then somebody to help you writing or you write. But that teams يسموه core team. That's your core team. That's you built. Okay. بعرف أحمد ومديحة وفؤاد وفاطمة وجورج وأنتوني, right? This is my team. واحد بيكتب abstract, put everybody's name on it. واحد بيكتب abstract, put every names on it. So imagine if you do 2 abstract, you're 5 of you, 2 times 5, 10. That's 10 abstract if you do 1. If you do 1 only. You got the point, right? Use your candor. أنا هوني يعني في عندك هوني.
عفوا يا
You done?
Shadi, I think yeah, if you can wrap up like maybe in 1 minute so we can
خلاص.
allow
Yeah.
a few minutes
I
before we
think I have
start
2 more
our
slides,
next
but
session.
خلاص, yeah. Let
Yeah.
me
No, go
finish this.
ahead.
So also try new things. You never know what happened. Social media, perfect, but use it for your benefit. Update your profile. Have a good presentable picture. يعني okay, I showed you a picture with hair. يعني خلاص يعني if you have no hair, no hair. If you have وما تحط صورتك مع الشباب كلها أو مع الصبايا كلها بعرس. يعني show who you are on Twitter. Who you are, accreditation, where do you work? You go to Doximity, I think. Same thing, right? You go to Instagram, same thing. If you have use personal stuff for Instagram, it's fine. But if you're using it professionally, same thing. People see you. LinkedIn, very important. Have at least, if you get out of this talk, have at least a LinkedIn, ResearchGate, and Doximity account, because that will give you visibility. I try two things. What I mean by this, if you are good with social media, let's say you have a skill set that you are the best in social media. I'm not saying I'm the best social media, but if you think you can push your skill set into producing videos, interviewing people. Up top right here, I started in 2016 interviewing with my phone. Literally iPhone and a lariat phone and a microphone. Eventually start to build up video studios and take it with me and go to conferences and tell them I'm going to be doing it there. And then they ask you for it. Last thing, stay hungry, stay foolish. What I mean by foolish, humble too, right? Things might not work the way you want. Be ready to difficulties, obstacles, and rejections or politics. Stay focused, believe in yourself, work hard, have patience, and keep watching your dream. Last thing, lately we built up that website just to have help people like yourself to have a connection for research, connection for, I'm not saying I'm going to be the one doing it, but at least we help you network with people who can help you with that research. Because all these guys, since I started residency till now, all of them graduated and moved on, and they are mentoring other people. This is our research team at ACC last year. This is our mission a month ago. And this is our team in Chicago just in March. Who are these people? Half of them, Saraha, I never met them in my life. It was a text message, WhatsApp, but they showed exactly what Abdelkader said. They showed a skill set that was valuable to help everybody else here. They range from people in high school, second year college, all the way to fellows. And we have fun sometimes. Sometimes we have fun. That's in DC. I'll stop there. If there's any question, please let me know.
Thank you so much, Dr. Alraies, for your amazing and wonderful speech. I wish we have more time actually to talk more about mentorship. I had a long journey with mentorship. I had a lot of mentors who helped me into getting my goals, and there are some of them they actually made it more difficult for me. And that's how we learn. I mean, we learn from them, and then we try to be good mentors for other residents and fellows. I think the one thing that helped me the most during my career is one is show up, always show up. That's one. And number two is be persistent. Persistence makes a big difference. As long as you are persistent to get to your goals, you will get there. Thank you so much, Dr. Reyes, for this talk. And I will take maybe questions for 5 minutes, and then we will start our next session. So if you have any questions, please raise your hand.
It was,
Let me
I hope
see
it
if
wasn't
we
too
have
fast.
any. No, it was. I think it was great. Okay, so one question: how do you approach a mentor to ask if they would be willing to be your mentor?
Just send an email. Usually the email has to be short. Harmoush email, very long, short email. My name is this. I'm a resident in the department. I have written abstract 1 or 2 or 3, a paper 1, 2 or 3, and I'm good at this skill set. Is there a way I can communicate with your assistant to schedule a meeting with you? Done. 1. And wait, usually you wait for 1 to 2 days. If there is no response, go to the next one. but don't have a long email or short email. Or if you see him in the hallway, if you see him in his office, walk to his office. If he's going in the cafeteria, if somebody local.
I have a question for you. During my career, I found it that some mentors they're expecting that I will come with a project. Some of them they don't. Some of them
Yeah.
they already have the database. They just want someone with the skills, and if I provide them with the skills, then they will work with me. But some of them they want me to come up with a project. How do you
Yeah.
approach these two different mentors?
Yeah. But that's what go with the track record. I think usually when he asks you for what's your project, I think he's testing you to see if you read about his work or if you have an angle that he is interested in. So usually what I would do is I will study the person, pull him on PubMed or ResearchGate, Google Scholar, see what his or her, let's say they are interested in IBD, and focus on an idea related to IBD. And when you meet with him, so like I met with you, but there's a new database that we can answer similar question using different database. What do you think? I would like to schedule a meeting with you. That's one thing. It might tell you, you know what, you're a great idea, or might tell you, you know what, this is nothing. I have a different idea for you. At least you show that mentor that you did some homework and you filled his kind of satisfaction in terms of what his interest area is. Most of the mentors, they have a big drawer full of abstract that never made it to papers. Your job, and that was my job, is I want to get to that drawer. عارفان في درج مليان abstract, and I know people match or moved on. So what I usually do is my job is to get to that drawer and trying to transition this abstract to papers. And sure enough, from 15 abstract, we fix 5 or 6 papers.
Yeah, that's great. Majid, you
Yeah.
have something?
Salam Shadi, thank you so much. That was an
Ahmed.
amazing talk. I have a question and kind of like a point that I want to bring up. What do you think about having more than one mentor? Like personally, during my cardiology fellowship, I had two mentors. The heart failure program director, that was my real mentor, and the electrophysiology guy that I approached him for, like when I was applying for EP, and before that when I was working on research applying for EP, that was the guy that my go-to if anything related to EP. Otherwise, that I have the program director of heart failure. That I felt like we had a great connection, and that he was my real mentor. So what's your advice about having more than one mentor for the
Absolutely.
future?
It's encouraged actually, because I skipped a few slides, but there's nobody's jack of all trades. Nobody can know it all. Like what's your passion, what you're looking for. Like I started with Alan Klein, he's completely imaging, completely pericarditis inflammation, but I want to do interventional. You want to do EP, but basically your first mentor what heart failure, but this is what you got. So you work with him or her till you get what you want, and eventually you branch out, or when you feel you're mature, you jump to the next one, and you have a life coach, like somebody who like, okay, I have the first baby, how can I manage my time? So I call somebody else. I call, you know what I mean? Like you have multiple mentors that guide you for different phases in your career simultaneously or overlapping with each other. It's encouraged.
Excellent.
يعني
So,
النصيحة اللي حطيتها انه لا تبلش، يعني عم تبلش مع واحد تشتغل ريسيرش مظبوط doing research with him or her, and you get frustrated not getting anything done quickly and jump to the next one and start to overwhelm yourself. That was my comment about not having too many at the same time.
absolutely. Thank you so much for the talk again, Dr. Shadi Reyes. I would like to move on to the next session for today. I will have Dr. Yassin Hamish. He's going to be the moderator for the next session. Dr. Yassin Hamish, he graduated from Hama University 2022, and he will be starting his internal medicine residency at Advent Health in Tampa, Florida. Please, Yassine, take it away. I will stop sharing my screen.
Hi everyone, can you hear me?
Yes.
تمام، الله يعطيكم العافية جميعا. Just 1 second until I check the speaker and the video. I'll start sharing screen. Can you see the screen?
Yes, it's all good.
Okay, hi everyone. I'm gonna be your host for this session. The fourth session will be about navigating wellness and belonging as an IMG. We will have 3 presentations here. Each one will last around like 20 minutes with 3 speakers. And for the first session, it will be about Money 101 for new doctors, what every intern should know. من دكتور Ahmad Awwad. Just one second. Okay. Let me just introduce Dr. Ahmad Al-Awwad. I don't know if Dr. Ahmad is here with us.
Yes, I'm here.
Okay, just one second. Dr. Ahmad Al-Awwad is a board-certified neurologist, completed his medical school at Damascus University, did his residency at University of Oklahoma. He's heavily involved in education and supervision of medical students and neurology residents during their inpatient neurology training. This is a really interesting presentation for me personally. لأنه نحن بسوريا بشكل عام نتعامل كنا بالكاش، كل الكونسبت جديد علينا، موضوع الكريدت سكور، كريدت كارد وهالقصص كلياتها. يعني بتذكر بسوريا كنا إذا بنروح على محل شاورما كنا ناخذ شنطاية مصاري. بقى please start Dr. Ahmad, and it's a very interesting presentation.
Yeah, absolutely. Thank you for having me. Can I share my screen?
Yeah, let me just make you co-host. Hussam, could you make Dr. Ahmad co-host?
He can share his screen.
Okay.
Okay, awesome. Can you guys see my screen?
Yes, we can see it.
You can see the slides, right?
Mm-hmm.
Okay, awesome. So good afternoon, everyone. Thank you so much for having me. So as you mentioned, I mean, we came from a different culture, different system, and there's a lot of things to cover, but I'm just going to try to focus on the main things that I believe every intern, or actually anyone who started a new job in the US, that they need to be aware of. So let's keep going. Brief disclosure, I'm not a financial advisor and I don't get any official training in finances. However, I'm very passionate about this topic. And the major purpose for this presentation is to have a general understanding of major principles of finances, especially in this country. A lot of these topics, I mean, unfortunately, we did not get any good coverage for it like early on in our career, and we start discovering about that late in our life. So I think the earlier that you have a start for it, like the better. So just a brief vocabulary for things that we're going to talk about. You have like a balance between your income and your expenses. And expenses, generally speaking, they go into 2 major categories. One is called needs and what is called wants. So needs are things that they are necessary for a human, right? So that's include your shelter, like renting, or your mortgage, clothing, food, medication, health insurance. And you have the wants, or like expenses that you choose to buy but can comfortably live without. So these are like, dining in a restaurant, or going into vacations, or hobbies. And on the other hand, you have like 2 major categories, something called asset. And these are things that appreciate in value with time. And on the other hand, you have liabilities, and these are things that, go down with value with time. So some examples for assets, your house, because generally speaking, real estate in this country in general, over the long term, they appreciate. Or if you have like a stocks or bonds or businesses. On the other hand, liabilities, the major liability that, everyone almost like gonna end up having is cars, because vast majority of cars, they depreciate with value with time. Now, there's like a famous book called Rich Dad, Poor Dad. I highly recommend to go with. But like if you want to take like a big glance on how finances, like how everyone like should be budgeting. So you have these 2 major categories. You have either income, it's like where the money is coming in, and you have the expenses where the money is going out. And as we said, they go into either needs or wants. Now, on the other hand, vast majority of people, unfortunately, they live what we call paycheck to paycheck. So whatever come in through their income, they're gonna spend it through their expenses, and that's actually where like almost 2/3 of the US people live in this cycle. Now, the challenge with this cycle, I mean, you cannot sustain it on the long run, because as we all know, you will have like emergencies in life. And I mean, at some point, you need to have like some good cushion, like in case something happen. Now, so that's how poor dad react, according to the author of Rich Dad, Poor Dad. On the other hand, you have a rich dad, which is like who's someone who's like trying to, you know, like divert some of that extra income that he's getting to get it into assets. Because what happened with assets with time, they will start regenerating some of that income, and then you will have this positive loop. And this is how you will end up being quote unquote rich dad. So let's talk about income in this country. Generally speaking, you have two major types of income. You have either active income, and that's something that you like, you have to do something actively for, or you have a passive income, and that's, you know, that's something that more like scalable, and that's something that like you can generate money passively while you're sleeping. So active income, generally speaking, you have two major types. You have the W-2, and that's the employer. And all of you, when you're going to be employed during your residency, you'll be a W-2 employer. And you have another type of active income, so that's 1099, or that's self-employed or independent contractor. The most common scenario for physicians to be in 1099 if there are people who are doing moonlighting, or they are doing extra shifts in other hospitals. A lot of time with these, they will end up getting paid by 1099. But both type, like if you are doing like active work, you will pay on it like an income tax, and I will discuss tax in the next few slides. Now, on the other hand, if you have passive income or capital assets, so these are things that, you know, appreciate with value by time. Whenever you capture like a capital gain, you have to pay capital gain tax on it. And the capital gain tax, generally speaking, it could be either short term in case you hold this capital asset for less than a year, or long term in case you hold this capital asset for more than a year. So, and keep in mind, I mean, that does not only go, for instance, to stocks or bonds, like theoretically anything. Like let's say you bought a car for like $5,000, and then you hold it, and then later on, for whatever reason, you were very lucky, you were able to sell it for $7,000. Theoretically, these $2,000 is considered capital gain, and you need to pay on it capital gain tax. And it's going to be either short term in case you sold that car in less than a year, or long term in case you sold it in more than a year. So as I said, all of you will be W-2 employer. So what you will see in your orientation day, you will be asked to fill a form called W-4. So that form is going to be collected by your HR in your hospital. And in the W-4, I mean, that your employer, the hospital, will use this form, the W-4, to estimate how much tax they have to collect on your behalf. And at the very end of the year, they will give you a W-2 form to summarize whatever they pay you during that year and how much tax they hold already on it. And you will use this W-2 form to, use it for applying for the taxes for that year. Now, on the other hand, if you are working 1099, and that happened in case you end up picking some extra shifts or doing moonlighting and then pay you 1099 form, the HR with this situation, they will collect from you W-9 form. Now, the major thing that you need to keep in mind, if you are a W-2, you don't need to worry about paying the IRS during the year, because your hospital will be automatically getting some of your money and holding it. Versus if you are 1099, majority of the time the hospital wouldn't, which means that if you are getting paid on 1099 basis, you have to withhold some of that money to be ready for it. I mean, you don't want to end up in a situation, and I know some people who were in that situation. Let's say they did some moonlighting, they made some $10,000, let's say, over that year, but then they realize they did not pay tax on it, and then whenever they have to pay tax, they realize they owe the IRS $3,000. And the challenge is not only you're going to pay them what they owe you, but what you owe them, but you will also end up paying penalty and interest on it if you if you did not pay like at least 90% of your estimated taxes in that year. So that's something to remember. I mean, I'll be like, majority of you will not gonna be moonlighting during your intern year, but I mean, second, third year, you may end up doing moonlighting. So just remember that if you're getting paid with 1099, to make sure to withhold some of your taxes. And by the way, once you withhold it, you can pay it to the IRS directly through their website, and you can just put it like an estimate. And the best way to do it, every single time you get a check with 1099, to pay roughly 30% of that money directly to the IRS and just get rid of it and get done from it. Okay, so now let's talk about taxes. So there are like a lot of different type of taxes here. These are the three major things that you need to have like a good understanding of. So the first one is federal income tax. So that's taxes collected by the federal government, which means every single one in any states, they will pay the same. Now, the second type of tax is called FICA tax. So that's Federal Insurance Contributions Act. And that's consistent of the Social Security tax and the Medicare tax. And these tax get taxed for anyone who's working. So these are kind of some type of work tax. And the last type of tax is the state and local tax. And these are deferred by different states. So the first two types, they are standard. Everyone will go same thing, versus the last one will be different depending on the state. So let's talk about the first one, which is the federal tax. So you have like an IRS filing status that everyone, whenever like you want to file for your taxes, you're going to be under one of these categories, either single or married filing jointly. That's if in case you were married and you decided to file you and your wife at the same time, like same bulk, or if each one of you wanted to file separately, that's going to be the category. Now, vast majority of cases, married filing jointly would make more sense, as you will save way more taxes on it. So that's usually the category to go. Head of household, like that happen in case someone who's divorced, for instance, and have kids, or if you have in a rare situation, let's say you live with your parents and you are spending on your parents, you can claim them as dependent if they are meet certain criteria. The last one is qualified widower, which is technically similar to married filed jointly, but I mean that's happened for the first 2 years after a spouse died. So now this is the tax bracket for 2025. So this is for the federal income tax. And as you can see, it's a progressive model, which means the more you make, the more taxes you pay. So here, for instance, if you filing as single, the first $11,925, you will pay 10% on it. And then after that, you'll pay 12%. And after that, you'll be in the 22% category. And now you can see why, generally speaking, married filed jointly, in case you're married, it will make more sense. Because, I mean, you can see, for instance, for the 10% category, you will be taxed 10% only on the almost 24,000 versus if you were filing like as a single, like whatever money between this amount and this amount, you're going to be paid on the next bracket. So this slide that I just showed, that's the income tax. So these are what you're going to pay on your W-2 or on your 1099 in general. Now, if you have like a capital gain tax, so if it's a short-term capital gain tax, which means that you sold this asset in less than a year, you're going to be taxed similar to your ordinary income tax. Versus if you hold for longer term, you will have like a different category. So, I mean, you can see for the long-term capital gain tax, the first $47,000, if you're filing as single, you're not going to pay any tax on it. And now you understand why it would make more sense if anyone like hold any kind of asset and they have a capital gain on it, they need to wait at least 1 year, because it will make way more difference. Because obviously the long-term capital gain tax will be like way less than the short-term capital gain tax. Okay, so that's the federal tax. Now, whenever you file your taxes, you will have two major categories whenever you file your federal tax. So the first one is the standard deduction, which is like what I would believe vast majority of you will end up being. So if you are filing single, the first $15,000 will be exempt from paying tax. So let's say you make $70,000 as a resident. So that means $15,000, you're not going to pay any tax on it. So you will end up having $55,000 making on that year. That's $55,000. The first almost $12,000 you're going to be in the 10% category. And probably like that means that your highest rate tax will be 22% if you're making 70. Now, there are another type of deduction, which is the itemized deduction. So, and you go with this route in case you were able to collect multiple itemized deduction and the sum of it was more than the standard deduction. And that's why majority of you will end up going with the standard deduction. But I mean, let's say someone who has a house and they have, let's say, $10,000 of mortgage interest, and they donate it to charity, let's say another 10,000. And at the same time, they have like, let's say they have like another like $20,000 like in medical expenses. I mean, if you add all these things together, they will end up way more than their standardized deduction. And that's the situation where they're going to go with the itemized deduction. Okay, next type of tax is the Social Security tax. So this tax is 6.2% that you will notice going to get deducted from your paycheck. And you're going to pay to the Social Security tax 6.2, and your hospital will pay another 6.2. So it's going to be total of 12.4% that's going to get paid for this tax. But your portion will be 6.2. Now, the maximum wage is $176,000, which, I mean, obviously no resident will reach this limit, but that's something to keep in mind. I mean, you have, let's say you have an attending with a $300,000 salary. That means they're going to pay this 6.2 only on the first $176,000. And after that, this tax will go away. Now, why do we pay this tax? Because you will have a Social Security benefit. You will have a retirement benefit. And the retirement benefit, you can claim it as early as 60-year-old. But you can hold to it to claim it until as late as 70. I mean, obviously, the earlier you start claiming the benefit, the least amount of benefit that you will collect from your Social Security. And the other thing to keep in mind, I mean, the more you will pay during your career life for the Social Security, the higher your retirement benefit will be. Average Social Security right now is around 2,000, and the max is 5,000. So that's the first benefit of the Social Security. The second benefit is the disability benefit. So in case, God forbid, you became disabled, you can apply for disability. And generally speaking, disability, the application will take around 5 months, and then you start collecting your disability benefit in month number 6. But I mean, obviously, you have a strict rule to apply for disability. And just to have an idea, the average disability is roughly 1,600, and the max is 4,000. And the last benefit of the Social Security is the survivor benefit. And that's in case, God forbid, you passed away and you have like a qualified survivor, like a spouse or a child, you know, unmarried child, or if you have like a dependent parent, they will also collect this benefit. Now, the next type of tax is Medicare tax. So Medicare tax, it's usually you pay these taxes. So once you retire at age 65 or older, you will have a health insurance for the rest of your life, and that's going to be the Medicare. So the tax is 1.45% that you're going to pay, and your employer or your hospital will pay another 1.45%. So 2.9% total. Now, if you make too much money, like above this limit, like $250 for married and filing jointly, you will pay extra 0.9%. So now if you do the math, so both taxes, like between like Social Security and the Medicare, will be roughly like around 15%. Now, the last type of tax is the state tax. So the first two taxes that we talked about, they are standardized on everyone, versus the state tax. It will depend on the state that you're living at. And generally speaking, you have 9 states that you don't have any income tax on it. So these are Alaska, Florida, Nevada, New Hampshire, South Dakota, Tennessee, Texas, Washington, and Wyoming. So all these states, you don't pay any income tax on it. And you have 12 states where you have a flat rate tax, which means that you pay, let's say, 3%, regardless how much money you're making. And the rest of the states, you will pay a progressive income tax similar to what we saw in the federal system, where, let's say, for the first 10,000, you pay 0.5%. For the 10,000 to 40,000, for instance, you pay 1%, and so on. And every state is different. So you just want to make sure, you know, to look up your state to understand exactly how much they are supposed to collect, so you can have an idea how much is going to get away from your paycheck. So these are some examples, and I see like the gray state, they don't collect any tax, and you can see like the highest is California, 13.3%, Hawaii 11%, and New York almost 11%. Now, if you look up on any states, I mean, sure, there are states you don't collect any tax, but you have another type of tax that you are paying, right? I mean, you're paying tax when you pay for the gas, when you're paying tax for if you own a house, for instance. So there is something called total tax burden. It's kind of like to try to make an estimate for like all taxes that somebody's paying, depending on the state. And it's just kind of helpful to have an idea, what's are like the highest total tax burden states. So, I mean, not surprisingly that you see like New York, Hawaii, and on the other hand, like these are the lowest kind of states with the tax burden. And I think it's kind of important so you can have an idea, like, are you considered to be living in a very high cost of living area or low cost of living area regarding taxes? Now, pay stub. So pay stub is going to be a document that you will summarize how your total earning during a specific pay period. Majority of hospitals, they pay every 2 weeks. So you will receive like a paycheck every 2 weeks, and you will have a certain system with your hospital that you can be able to access your pay stub. Some hospitals, they may pay every month. But you need to understand how to look up your pay stub. So generally speaking, there are 3 categories in every pay stub. The first one is gross pay. So this is the amount of money that you earn before any deduction or any taxes. This amount should be fixed throughout the year. Now, the second part will be the tax withheld, and they will show you how much they withheld for the federal, for the FICA, and for the state. And the last one will be other deduction. So these are going to be like health insurance, for instance, or disability insurance, or retirement contribution. And these deductible could be either withdraw pre-tax or post-tax. Now, once you take away the tax withheld and the other deduction from the gross pay, you will end up what we call net pay or take-home pay, and this is the amount of money that you will see in your bank account. So this is an example where I work at university. Yes.
Just 3 minutes to go. Just a reminder.
Oh, okay. Thank you. So, let me skip this. Now, where to start? Generally speaking, this is a very good rule to consider. 50% on your needs, 30% on your wants, and 20% on your saving. Okay. Now, once you save, I mean, that's kind of like a good way to think about. These are like Dave Ramsey's baby steps that you can look up. So you have like a $1,000 as a starter for emergency fund. And then baby step 2, you will pay off all debt. And then baby step 3, you try to get your emergency fund to 3 to 6 living a month. Now, I want to talk briefly about retirement. So what you need to know, look up your retirement benefit in your hospital. I mean, I know a lot of places, they don't have retirement benefit for resident, but some are. So some of them, they may have a match for their retirement. So let's say they have a 5% match. So that means if you put 5% of your salary into a retirement account, the hospital will pay you another 5%. So that's literally like a free money. So just make sure to ask about, like, communicate with your HR, and if they have any retirement benefit, I mean, make sure to reach out to them to see, how you can get advantage of it, and at least try to get the match, at least, because it's technically free money. So once you ask them to do that, they will automatically deduct from your pay stub, and it will go into your retirement account, and the hospital will match. These are different type of health insurance plan. Some hospitals have all, some hospitals have few. What you need to know, generally speaking, you have either high deductible plan or low deductible plan. So what does that mean? High deductible plan, you will end up paying a very least amount of money, let's say $50 or $60 a month. But in case you end up using any healthcare benefit, you will end up paying more. Versus low deductible plan, so that's PPO or HMO, is going to be vice versa. So you're going to pay way more for this plan, so maybe like $200 or $300. However, in case you end up using like healthcare benefit, you will end up paying less. So how would you balance between these two? Generally speaking, if you're healthy and you don't anticipate having any expenses, it would be better to go with the high deductible plan. And the main reason for it is, A, you're not going to end up paying a lot of money every month for the high deductible plan, especially with the fact you're most likely not going to use it since you're healthy. And B, which is more important, if you are on high deductible healthcare plan, you can qualify into something called HSA. So that's the health saving account. And that account, once you are on high deductible plan, you can contribute up to $4,300 a year if you are alone to get into that plan. And once you have the money in that plan, you can use it to invest, and that money it's yours. It's gonna roll over years, and you can use it for any health expense, any health related expense. Now, if you are on one of these low deductible plan, you cannot qualify for the HSA. However, there is something called FSA, or flex spending account, that you can use. And the max for it is $3,300 a year for the year 2025. However, this amount of money you cannot invest it. It's technically the hospital's money, and you can use it during this year only for healthcare expenses. So you can use it for buying, for instance, medical classes, or like technically like multivitamins or any medication, or if you go to a doctor and you pay. So technically any healthcare related expenses during that year. The challenge of it, like once the year end, you cannot roll most of the money. You can roll only 660. So you use this account in case, let's say, God forbid, you have a chronic illness and you're anticipating that you're gonna require a lot of healthcare. So it will be make more sense to use a low deductible plan, and maybe loading some money in the FSA, let's say $1,000 or $2,000 that you know that you're going to use during that year. So these are some general advices. You need to be conscious with your money. You need to understand why you're getting this much, why they're deducting this much, and you need to have a budget. And the 50, 30, 20 rule that I mentioned, it's a good start. Have your spouse on board is very important. Pay yourself first, because try to save first 20% of what you're making. Have it like in a different account, because otherwise you're not going to end up saving. There's a nice rule called 72-hour rule. If you want something, just wait for 72 hours before you buy it. That will help with the impulse buying. And most important thing is to be on board and do it. Yeah, I will stop here. These are some good resources. I like this guy, Dave Ramsey. He had like a host show, and he has like a YouTube channel. He's very helpful to learn from. And White Code Investor is also like another great resource that you guys can do. Okay, that's it.
All right, thank you very much, Dr. Awad. That was a great talk, and I also follow Dave Ramsey, and I think his plan is good. If you can stop sharing the screen to start sharing from my side, okay, that will be great. Just 1 second. All right. Our next presenter will be Dr. Wissam Kiwan. The title will be Navigating Language and Cultural Differences as an IMG. Just a second. Dr. Hussam, are you with us? Sorry, Dr. Wissam.
I'm right here. Are you guys able to hear me well?
Okay, yeah. Just want to do the introduction. Dr. Wissam Kiwan, he's a gastroenterologist and the Advanced Endoscopy Program Director at St. Louis University. Dr. Wissam, thank you for being there with us today, and the audience is all yours.
Thank you very much. I'm excited to see you guys, especially to see the new generation taking over the education committee and helping with these projects. Just 10 years ago, I was in your spot organizing these residency preparedness workshops and all that. Really very helpful. Great presentation, Abu Hamid. That was really fantastic. Just a quick comment, if I may, on the retirement accounts and also the flexible saving account and all that. For those of us who are interested in ethically sound investment, you do want to make sure that you're aware where you're putting your money. That's also for the halal, for some folks who are also interested in knowing about that. So I'm not saying that it is, you shut the door entirely about the retirement account or all that, but you have to be mindful of that perspective. With that, I'm going to shift gears to my talk. راح أخلط بين العربي والإنجليزي, and that's especially the heart of at the heart of what I'm doing.
Please feel free to share your screen if you want.
تمام. I thought that I'm sharing it now. It does say I'm sharing the screen. Are you guys not able to see a page with the introduction?
We can see it.
Perfect.
Okay.
Right. Sweet. تمام. دائما لما الواحد يفكر بالاختصاص بيفكر بالمعلومات الطبية، بيفكر الكلينيكال اسبكت اوف ات، بس بننسى احيانا انه في لغه وفي كلتشر وفي تاقلم بيجي معه. عموما من خلال هي المحاضره راح استعمل لفظ الاي ام جي انترناشونال ميديكال جراجويت، بالذات بعني شخص بينطبق عليه صفتين، هو انه الانجليزيه هي لغته الثانيه حتى لو كان فلوينت، والشغله الثانيه هو انه اجى على اليونايتد ستيتس از ان ادلت. الموضوع اللغه طبعا موضوع غني عن الذكر، انه موضوع كثير مهم. كل ما كانت لغه الشخص اوسع واكبر ومصطلحاته وقدرته على استعمال المصطلحات افضل واعمق واعقد، كل ما كان حسن يعبر عن نفسه بشكل افضل، وبالتالي يظهر نفسه للجمهور اللي عم يحكي معه، الاشخاص اللي عم تواصل معاها بشكل احسن وافضل، وبيرسم صوره افضل عن اللي جواته. وهذا طبعا ما تاسك مهمه لما نكون نحن كل مثل معظمنا اجى من خلفيه مختلفه والانجليزيه ما كانت لغتنا الاساسيه، فهذا موضوع لازم نخليه بالبال. لما نحكي عن اللغه طبعا نتذكر انه في 4 مجالات الى اللغه المحكيه: فهم اللغه المكتوبه والمقروءه. وما ببالغ اذا بقول انه في بكل مجال من هالمجالات اثناء سنوات الاختصاص، اللي هي بمعظم الاحيان سنوات التاقلم مع الانتقال للولايات المتحده، نحن بحاجه لانه نشتغل بشكل اكتف، بشكل مو بس منفعل، انه بشكل فاعل، لحتى نحسن ونطور نفسنا من كل هاي المجالات. نحكي شويه ملاحظات هون وهون، يعني 20 دقيقه يا دوب الواحد يكفي يحكي، يا دوب يعني يلمس الموضوع من بعيد، بس بنحاول على الاقل نفتح العيون على عده اشياء ضروريه. بعض النصائح المتفرقه بموضوع اللغه اللي انا على الاقل لقيتها مفيد، هو انك انت تعمل براكتس للكيس برزنتيشن للمرضى اللي عندك. انت ثاني يوم عارف انه عندك مريض بدك تعمل له برزنتيشن، ممكن تبلش تتدرب على الكيس برزنتيشن تبعه لحتى تصير الفلوينسي تبعك افضل وافضل، وممكن تعمل هيك مع اصحابك. في ناس بيلاقوا انه يسجلوا نفسهم ويسمعوا المسجل حتى تحسن المحتوى اللغوي، وكمان تحسن النطق والمصطلحات. بيصير كثير احيانا مع الواحد، وما زال بيصير معي، انه في نفس الكلمه بتستعملها ودائما ما بيفهموا عليك، او بتسمعها انت من شخص ثاني وما عم تفهم شو عم يحكوا. لما ترجع حاول انه لوك ات اب، شوف السبيلنج اذا دائما عم تخربط بنفس السبيلنج او المعنى، وخاصه اذا كان فريز البرونونسيشن تبعها، مشان تصلح البرونونسيشن مع الزمن، لان كل ما صلحت اكثر كل ما تعلمت اسرع. هلا انا مني وعلي، انا كثير استفدت من بودكاست. الراديو لاب كثير استفدت منه، اللي هو ساينتفك بودكاست، وخاصه الحلقات القديمه. بس اي محتوى ممتع وانجيجنج انت بتحسه بالانجليزي حاول تسمع، لانه بيحسن من قدرتك على الاستيعاب، الانجليش كومبريهنشن. هذا موضوع كثير مهم. وطبعا الفريزز خاصه بالافري داي لانجويج هي نوعا ما بيكون حاجز نحن عندنا بشكل عام. واحيانا بتصير مع الشخص انه بيستعمل الفريز وبيحط الفريز الغلط، وبيكون قلب الموضوع pass away and pass out. فرق كبير بين شخص توفى الله يرحمه وشخص غاب عن الوعي. فهذا مجرد مثال، لكن ممكن تقيس على ذلك. فاستعمال الفريزز وتعلم الفريزز بشكل باكر اثناء تاقلمك موضوع ضروري. انتبه لفكره احيانا بعض الاي ام جيز ما بينتبهوا عليها، هي انه اللغه المحكيه بالشارع، اللي هي عموما اللغه اللي حيستعملها المريض لما يجي عندك والعائله تبعه، غير اللغه اللي انت حتستعملها لما انت تقدم المريض. يعني اذا المريض عم يقول انه I've been peeing or pooping، ما حتستعمل انت هالمصطلحات. راح لما تعمل presentation بتقول patient is vomiting, urinating and defecating. فبدك تنتبه انت، يعني احيانا it could sound a little bit silly لما تستعمل نفس الالفاظ، او حتى ممكن يكون بالنسبه للي عم بيختصوا اطفال، ممكن في تندنسي ان الواحد يستعمل المصطلحات تبعون الاطفال. بذكر قصه لطيفه على السريع. في واحد من زملائنا، بس shift of culture a little bit different، راح الصين، فكان يدرس هنيك انجليزي. فالمصطلحات اللي بالصين تعلمها من الاطفال، فكان يستعمل نفس المصطلحات لما يحكي مع الادلتس، وحطته بمواقف. يعني طبعا هلا نحكي عن موضوع التطور اللغوي، ومريح وطبيعي ان الواحد بيمر بمراحل فيها embarrassment، بس بتحسن مع الزمن. وفي سلايد ديفرنس بين الكيس برزنتيشن والنوت دوكيومنتيشن، بس بشكل عام هن اقرب لبعض من اللغه اللي رح تستعملها مع البيشنت فاميلي. خليك بس مايندفول انه في شويه فروق. مثل ما ذكرت من ثواني، انه لغتك حتتطور مع الزمن وراح توسع مداركك، بس هذا الموضوع بده يكون proactive، كل ما كنت engaged اكثر و cognitive about it، كل ما كان التطور تبعك احسن. ولما تنتبه على انت كيف انت حالك عم تحس حالك انه صرت احسن، بتحس بالفرق. انا اول ما جيت على امريكا بال 2014 كنت افهم على المرضى بشكل لا باس فيه، بس كان عندي مشكله حقيقيه بالتواصل مع الاطباء، بيحكوا بسرعه و يعني مرينا بمراحل كثير صعبه. بس مع الزمن شوي شوي صار الواحد نفسه يلاحظ انه أو في تحسن، وصار يبني عليه ويشوف شو ساعده اكثر شيء مشان يحسن من لغته اكثر واكثر. وتذكر دائما خليك فخور بنفسك. انت already above the curve، انت already انجزت اكثر من اقرانك بين قوسين الامريكان اللي هن اصلا انخلقوا هون، ولدوا هون، عاشوا نفس الكالتشر، بيعرفوا نفس الكالتشرال ريفرنسز، اللغه هي لغتهم تماما. انت عملت هيك واكثر، انت عملت التعلم الطبي وكمان عم تتعلم انجليزي. فهذا ما نو ويكنس، يعني خليه ببالك، انما هذا لا يعني انه ما الواحد يشتغل على انه يطور نفسه. I will argue انه بشكل عام عموما الفلوينسي اهم من الاكسنت. كل ما كانت الاكسنت تبع الشخص افضل كل ما كان احسن. مع الزمن ممكن تحسنها شوي شوي اذا كنت proactive about it. بتلاحظ انه في ناس فعلا تحسنت الاكسنت تبعهم over years، وبتحس انه في ناس ضلت الاكسنت مثل ما هي. That's not a big deal. The more important thing is fluency in speech. بياخذ وقت وطبيعي، وكل ما تدربت بالبيت اكثر شوي، خاصه اذا حسيت في مواضيع معينه او جوانب معينه، سواء كان بالحكي مع المرضى او العائله او عائله المريض او مع الزملاء او مع الاتندنج تبعونك، كل ما حاولت تستعمل، يعني انت الجمله نفسها اللي عصلجت فيها حاول بس ترجع البيت تحكيها بشكل فلوينت، مثل الطفل. واخر شيء مع الزمن بتتحسن اكثر واكثر. خلي بالك انه في حيجيك مرضى احيانا من باك جراوند مختلفين، واحيانا لهجاتهم هن مختلفين. لما يكون لهجاتهم مختلفين قد حتى الامريكان نفسهم ممكن يكونوا يلاقوا صعوبه. فهذا ما تنحبط لما تنحط بهيك موقف. احيانا بيكون الكونفرزيشن على التليفون اصعب شوي، فهي كمان فكره خليها ببالك. اللي ممكن يصير ويحس فيه بعض الاشخاص انه خاصه في البدايه انه بحسوا حالهم شوي معزولين. هلا هذا الشعور طبيعي في البدايه، لكن هذا لا يعني انه لازم انت تحاول تعزل حالك. في فرق انك تنتبه انك انت ما تبلش كونفرزيشن مانك حسنان اصلا تخلصه، هذا شيء، وانك تنعزل شيء ثاني. لانه كل ما اختلطت افضل بيعرفوا اكثر مين انت كشخص جيد وكويس وانسان محترم وكمان انسان شاطر. اذا ما عم تتواصل مع الناس وما عم تاخذ تعطي، الناس ما بتعرف انك انت helpful وبروفيشنال ونايس وبولايت. ف بس لو انه بالبدايه تحس حالك انك شوي ايسوليت، عم بيحكوا عن الفوتبول وعم بيحكوا عن ما بعرف شو يعني الاشياء اللي بيحكوا فيها بالكالتشر تبعهم، وانت حاسس حالك يعني ولا هون، ممكن انت تصير تدور على نقاط مشتركه بدها تكون غالبا لها علاقه بالتريننج او الميديكال براكتس or it could be the news or something like that، ولو انه في عندي تحفظات على هذا الموضوع. وخلي كلامك والفاظك واضحه علشان يفهموا عليك احسن واحسن، وشوي شوي بتحس انه قدراتك بالتواصل اللغوي صارت احسن واحسن. حكينا عن موضوع البودكاست. هلا عموما الناس بيمروا بعده نماذج من التطور اللغوي لما يجوا على لغه ثانيه ويمارسوها. وكيف هذا حقارنه مع السنس اوف ايسوليشن. بشكل عام نحن بنبلش بدرجات متباينه، في ناس بلش هون، في ناس بلش هون. خلينا نحاول نشوف نستعمل الليزر. في ناس بتبلش احسن من ناس بتبلش اقل من ناس. اول شيء بيكون التطور بطيء، بس بعدين ببلش يصير تطور متسارع، ودائما حنتعلم، دائما حتتحسن لغتنا اذا ضلينا نشتغل عليها بشكل فاعل. السنس اوف ايسوليشن بيتناقص مع الزمن، لانه صار الانسان حسنان يعبر عن نفسه اكثر، وبالتالي حسنان يفهم اكثر الكلتشر تبعه. هلا لما يكون في تطور بطيء باللغه، السنس اوف ايسوليشن للاسف تراجعه بيكون اقل، لا بل وفي بعض الاحيان انه بيزيد. وهذا I will argue انه واحد من اهم الاسباب للسيناريو النادر اللي بيخلي الاي ام جيز ما يكفوا. في نسبه منيحه من الاي ام جيز، نسبه منيحه يعني less than 5%، بس this is thousands across the United States ما بيكملوا التريننج تبعهم. فهذا بيصير بسبب انه جزء منه culture shock وجزء منه تباطؤ التطور اللغوي. هذا بالذات الكالتشر شوك كيرف. الشخص اللي يعني ما شاء الله كلكم حضرانين ومهتمين بدل ما تكونوا يعني بهالويكند هاي عم تحضروا حالكم للنقل او عم تاخذوا شويه راحه، عم تحضروا محاضرات كل النهار، فهذا بحد ذاته بيثبت انه قديش انتم مهتمين. لكن عموما في اشخاص ما عندهم فكره اصلا، مو مفكرين، مو ماخذين بالهم انه في موضوع الكالتشرال ديفرنسز، فهذا بيولد انه اول شيء بيكون اصلا ما في سنس اوف ايسوليشن، فاكرين حالهم انه الامور باللوز، بعدين بصير في شوك. فالسنس اوف ايسوليشن goes quite high over a short period of time. This could be problematic. Culture shock, a slight degree of it is not a big deal, but we want to make sure that it doesn't last, also doesn't impact your functionality well-being تبعك. نحكي شوي عن الفروق الثقافية. الكالتشر موضوع كتير مهم، والاتيكيت اللي هو مجرد الذوق العام. طبعا اكيد في اوجه تشابه من حيث الاتيكيت بين الباك جراوند تبعنا وبين هون، لكن بدون ادنى شك في بعض الفروق، في اشياء مركز عليها ومهمه اكثر من اشياء ثانيه. على سبيل المثال موضوع احترام التوقيت واحترام المواعيد، هذا موضوع جدا مهم. ما في شيء اسمه توصل متاخر، يعني اذا وصلت متاخر معناته صار عندك عاصفه، يعني او انقطع السير على نص المدينه. وخلينا نكون صريحين مع بعض، يعني معظم الاحيان اللي نتاخر فيها على مواعيد بنكون نحن اصلا مو مخططين منيح كفايه، يعني لو حاسبين وقت كفايه اكثر بيوصل الواحد على الموعد اكثر. هذا موضوع جدا مهم. وموضوع الثاني موضوع ارتكاب الاخطاء. بشكل عام ارتكاب الاخطاء ببلادنا قد يكون ينتقد، اما هون يواجه عموما بنصح، وفي culture of openness، وكيف نتعلم من الخطأ مشان ما يصير ثاني مرة. عموما ال way people approach things. بدي منك انه اكيد تكون مع الزمن تبني ثقتك بنفسك و speak up and be strong، بس at the same time be respectful. حتى لو كنت سواء كنت طالب او intern، ومع مين ما كنت عم تحكي خليك محترم. الشغله الثانيه هو مراعاة الذكاء العاطفي، وتنتبه على الموقف اللي انت فيه. هذا موضوع بيلعب دور كثير كبير بالطريقه اللي بتحكي فيها والسياق اللي بتحكي فيه. الاي كونتاكت موضوع مهم. انا ما بحب اكتب، بجوز في بعض الناس بيختلفوا معي، لما اكون مع المريض سواء كان at the bedside بالمشفى او بالكلينيك، ما بحب اعمل تايبنج للنوتس. فيس تو فيس، فيسنج ذا بيشنت رايت اواي. الشغله الثانيه ضروري ما تفتح تطلع التليفون قدام المريض وانت بالبيشنت انكاونتر، لانه المريض بيفترض بجوز تكون انت عم تعمل شيء له علاقه بالمريض نفسه، بس المريض بيفترض انه انت you are being distracted from the time that you're supposed to be spending with them. فهذا this is important with a few exceptions. خلينا نقول let me see. هلا في كثير من الاي ام ارز فيهم اكسس على التليفون، ففيك تقول let's look up your blood work for today وتطلع التليفون، او المريض قال لك انه عم باخذ الدواء الفلاني، I'm not sure about what this medication is, let me look it up for you, let's try to find that out، وتطلع التليفون وتشوف. That's fine. Other than that, you shouldn't be using your own devices in front of the patient when you're supposed to be having a conversation with the patient. الشغله الثانيه اللي انا بركز عليها انه التاقلم مع الثقافه لا يعني الذوبان وانك تكون خجلان بالباك جراوند تبعك. بالعكس، كلياتهم عندي بالقسم بيعرفوا اني ما باكل غير حلال، كلياتهم بالقسم بيعرفوا ان انا بصوم بوقت معين، بيعرفوا انه في عندي وقت معين بيروح فيه على صلاه الجمعه. That's totally fine. It has context and there are ways to explain and express that. But at the same time, this is something of value you have to keep in mind. وأمريكا you will be surprised قديش بينحكى عن إنه في تمييز عنصري وكذا، وأكيد في مواقف هون وهنيك وأصلا بتسلط عليها الضوء شوي أكثر، لأنها استثناء. معظم الناس عن جد flexible و open يعني open for diversity and all that. قد تنسأل وخاصة إذا سيدة ولابسة حجاب بشكل متكرر روتيني انه دكتور where are you from if I may ask that. صراحه حسب المرأة انا بجاوب هذا السؤال بطريقه مختلفه. احيانا بقلب الطاوله على المريض بقول له بتعرف شو رايك، هات لشوف what do you think, how about you make a guess. انا من باب الفضول بدي اشوف انه وين الكاتيجوري اللي حاطني هذا المريض. طبعا الاجابات بتتفاجأ، بتتراوح من all the way from Africa to Asia to every once in a while they pick a place in the Middle East. بس انه this makes it a little bit more of a بتخلي الconversation احلى والطف مع المريض. بس nonetheless this is something that you're going to be asked and I don't think that's a problem. يعني don't take it personal. بشكل عام عموما نادي المرضى بالمستر او مس كذا، الا اذا كانوا قدك او اصغر و after another encounter or so they are your own clinic patient, you see them over and over again, I do call them by their first name. If you have already had you already know about their family, you know what their hobbies are, and they really become patient of yours, for the lack of a better word. طبعا لما الوالكين انتو روم اتيكيت كمان موضوع مهم ينحكى. الباب الواحد بيفوت ضروري يدق الباب، لانه كثير من الاحيان بيكون المريض نحن بالاندوسكوبي مثلا بيكون عم بيغير ثيابه، او انه بالمشفى بيكون walking out of the bathroom or something like that. فبتدق الباب وتفوت شوي شوي، تعرف عن نفسك اذا اول مره بتشوف المريض، واذا ثاني مره بس ممكن يكون المريض اصلا كان مخلط قبل بيوم، ترجع تعرف عن حالك كمان مره. واذا في فاميلي تسأل، لا تفترض مين اللي عنده، دائما اسأل who do you have with you here. انه قد يكون a partner, girlfriend, family, mother, so you want to make sure that you know who is coming with the patient. And دائما احكي ب respectful tone. There are challenging situations. I don't have time to deal with challenging situations. Maybe we can have another special session for that. بس عموما
Dr. Wissam, just 5 minutes to go, just a reminder. Thank you.
Oh, sounds good. Thanks. And also, don't interrupt the speakers unless it is necessary, and then there is context to that. There are words that you can say, sorry for interruption, but I'm going to have to tell you that XYZ. And when you come to talk to a senior to you, as an attending, a senior resident, always ask if it's a good time to have a conversation, especially if you're coming out of Southern to talk about something completely unexpected by the person to whom you're speaking. Like you're coming to talk to them about the new project that you have, or about the morning report, or about a feedback that you received, or so something that the speaker don't know, or the person you're talking to don't know, that you're coming to talk to them about. Just make sure that you ask about the appropriateness of that time. Generally speaking, there is certainly some degree of hierarchy الهرمية بالتعامل، بس خاصة بالنسبة للأشخاص اللي عملوا تريننج ببلادنا، الهرمية مختلفة تماما وأقل حدة بمراحل من الهرمية هون. طبعا في الكل everyone is showing respect. Things that you have to know تقريبا by default almost every single place. الاتندنج تبعك حتناديه doctor last name. الفيلوز والريزيدنتس حتناديهم باسمهم الأول. والستودنت is not expected to call you doctor كذا. أحيانا بيكون الستودنتس بينادوك وفيك تقول لهم feel free to call me Wissam or whatever you want. Every once in a while you'll have attendings, and I have seen that several times, who ask you, please call me by my first name. I've seen that. It becomes disrespectful if you keep calling them by their last name. So if they tell you call me by first name, if it's one of the few who does that, then please do so. And then التمريض هون مهم، والتمريض هون دائما بجولاي عنده they test the water، بيشوفوا شلون الوضع، وأحيانا بيكون عندهم tendency، لأنه هن فعلا صار لهم بالبزنس أكثر منك وبيعرفوا كثير شغلات أكثر منك. أكيد بيعرفوا المشفى بحد ذاته أكثر منك، بيعرفوا مرضاهم أكثر منك. فحاولوا خاصة بالبداية قبل ما تكون صيدامي معهم بكل احترام، أنت إلك دورك وهن إلهم دورهم، بس هن كثير أحيانا بيساعدوك. أخطاء ممكن تكاد تكون ترتكب من قبلنا ممكن ينبهون عليها. دائما احكي مع المريضة مشان تعطيك الريبورت عن إنه كيف عمل المريض بالليل أو قبل بالنهار. work with the nurses, don't work against them, and thank them and be grateful to them. بشكل عام كمان another big difference in culture, especially for those who practiced elsewhere، هو موضوع الautonomy. موضوع كتير مهم. دائما الpractice هون very patient centered, nothing beyond, nothing other than that. Spend time to explain and educate to the patient and family about what to come next. انت هلا بالER حطينا اوردر، هلا حنستنى ليصير في سرير. بالعاده بالسرير الهوسبيتال bed is going to be available within 10 minutes, 20 minutes, 3 hours. 4 hours. Just tell them what is to come. In addition to, needless to say, educating them about their condition every day and treatment options and your role. So it's not like you just prescribe and turn your head and move on. Last but not least, hopefully I'll remain in time. الامباستر سيندروم موضوع كثير مهم. الترجمة العربية تبعها شوي غريبة، اسمها متلازمة المحتال، بس اللي ما بيعرفوها المتلازمة هي المتلازمة اللي بتصير لما نحس نحن نكون بوسط معين من very accomplished people، فبنحس انه انا شو عم بعمل هون؟ I don't think I belong. شو حطني هالموقف هذا يعني. This is normal, but you have to address it, name it, and deal with it. What you are wrong about is that you're not inferior to them. You're well accomplished. You worked hard. No one is perfect. There will be people better than you. That is totally normal. You just keep pushing hard. Remember to remind yourself of the compliments you received by your attendings. I started, as I'm speaking of myself as an intern, started as below third year medical student. You know, here it is 4 years of medical school. And I think by the time I was done with internship, I was certainly above average. I'm talking about objective feedback in terms of all the interns across the year. So remind yourself of the compliments you received and the positive feedback you've received, and build on it and look for deficiencies and make sure that you don't focus only on the deficiencies. Talk to other IMGs. And remember, this is all your accent background and journey are certainly part of your strength, nothing beyond that. You will be in embarrassing situations. That's totally fine. They will continue to happen, I guarantee you. But don't make them stop you. After they happen, when you go back home, they don't start thinking about what that embarrassing situation that you were in. You would be the only person thinking about that. Stop thinking about that, move on in your life, and they will get better and better. And thank you very much. And I will be happy to join you guys at the end for the question and answer session.
Thank you, Dr. Wissam Kiwan. That was a great presentation. Okay, please, we will have at the end of this session a Q&A session. If anyone have questions, we can share them at that. Our next presenter will be Dr. Bayan and Issa. The presentation will be about balancing faith, identity, belonging in residency. And we're going to talk also about stress, burnout, and work-life balance. Dr. Bayan, are you with us?
Hey, good morning. I hope you can hear me and see me well.
Yeah, good morning. Let me introduce you. Dr. Bayan Issa is a fourth-year pediatrics interventional cardiology fellow at University of California, San Diego Rady Children's Hospital. Please go ahead, Dr. Bayan.
Thank you so much for organizing this amazing talk and webinar. Congratulations to all of you. You made it this far, and this is a great accomplishment. You should be proud about it. After listening to most of this lecture this morning, I feel like my lecture will be like so weak after all this amazing speaker and amazing knowledge they share and their experience. I believe I got to do 2 topics, so I tried to divide them into 2. Let me see if I can share my screen. Share. And you can see my screen, right? Correct?
Yes, we can see it. Thank you.
Awesome. Sounds good. So I will touch base on 2 topics, and I feel I was chosen for this being female with wearing headscarf, which is like sometimes doesn't fit with the American culture. So I believe it is a hard topic to give, but I can share just my own experience, which I feel like it helped for me, but may not work with you. But I'm just sharing what I've done so far. So first of all, I just want to go over. I don't like if sorry for this. Like moving. Here you go. So why does it matter to you? Like, why it matter to have like balance about your face and identity? First of all, because residency is a time, it's extremely intense in your personal and professional growth. So it's like you already have under a lot of stress, and we'll talk about it in the next talk. Second of all is like when you have a lot of like long hours and high intense setting, it's sometimes it's very challenging to like feel protected and feel belonging and feel like identified in this like new group that you are working with. And the other thing is like sometimes the phase and culture you coming from is like a source of strength. It's something you can give you more strengths and should not be another source of stressful on top of the medical residency. As well, it's like sometimes when you feel like belonging to the program, you are fitting well, you feel like high performance, you have like accomplished more, you are fitting more and be more productive. So that's why I want to make sure that it's very important for you to fit well. So faith is like, I believe everyone know his own beliefs, spiritual, religion, whatever you are believe in. However, identity, how you identify yourself. I'm Middle Eastern, I'm like from Africa, I'm like white, I'm like I have Hispanic culture, etc. This is your identity. And belonging is like being good fit, feeling accepted in the culture, feeling accepted in the program, feeling accepted and fit well with your colleague that you are working with. So first of all, the real life challenges in residency, and that's like true that I went through, and I believe most of us went through, regardless of your belief, and as coming from Middle East or like Syria, as most of you. First of all, it's like very sometimes hard to observe your religion practice. Like if you want to do prayers, if you are fasting during Ramadan, having your own holiday, whatever holiday or vacation, that doesn't usually correlate here. The other thing is lack of representation. Sometimes you are the only Muslim or the only Christian or like the only one believed person in this group of people who doesn't know about it. Sometimes people like what they read about the news, what they hear about us, and they have already a misperception about us, and sometimes they have like some microaggression, they come like with some ideas, so they not have accept you from the get-go to start with. The other thing is that you feel like struggle in, and you always try to prove yourself, you always try to like fit in and prove you are like a good fit and with good work with good harmony with other people. The other thing, that feeling you might feel like isolated or silent, especially if there's discussion about something you believe in or something you value to you. So why is it very important? First of all, the face and your identity is very important because first of all, it's like the source of purpose. You want to be the best doctor. You feel like you are rewarded for that. Doing good for a patient is something in our like belief that is a good deed that you are planning to do, help people. So there's something to encourage you and always push you forward. The other thing is like provide you with resilience. You will go through a lot of emotional stress, emotional challenges. You sometimes debrief or pray or feel like this is your get-go to like relax when you on your time off. The other thing is like sometimes ethical decisions. Sometimes you are in between two scenarios and you feel like, you know what, I want to do the best for the patient. That is what my belief is. That is like what the good things to do for the patient. And the other thing is like this is something very important that you always need to integrate it to your practice. You should not feel like hit. You don't feel like you need to hide it. You don't feel like you need to suppress it whenever they are talking about your background. So how we can implement that? And I can share some of my experience. Let me just move this out. I can share some of my experience that how I try to navigate that. First of all, in most institute or most center or most program, they right now they call it, they want diversity, inclusion, and they always try to like support all the minority. And one of them are like the Black, Hispanic, LGBT community, Muslim community. So try to be present when they have like, for example, for me, when in my residency, when they have wellness team and wellness program, I participate in this wellness team. When we have, for example, Ramadan or Eid, I suggested like, hey, this is wellness team. I wanna give a little bit presentation about what Eid al-Adha mean, what Hajj mean, and I wanna provide host a lunch during the noon conference, if that's okay. And the wellness team felt so impressed about this idea. So I give only 10 minutes talk what does this mean? And they support me with the money to bring Middle Eastern food, baklava and food, and they were like so happy about it. So that was like my first presentation on how to introduce myself, what this holiday mean for me, what we do for this, how that represent for us, how that correlate with other religion, etc. So it was good things to be participate in this like what they call them wellness team or DIY group. So if you want to participate in that, represent these people, that would be awesome. Something. The other thing, if you have your peer, your co-resident, your senior resident, if you want to speak with them, like, you know what, I have this month of Ramadan, I will be fasting during this month. I will have my meal at a certain time, so if there's no admission, I might take 10 minutes break to have my first meal of the day. They might support you. They might like just have open conversation with them, like say, hey, I'm a male, we have this, for example, Friday prayer, I will be on a clinic. If you are okay, I can see the patient early and have my lunch break that correlate with the Friday prayer. So I will do the Friday prayer. Just have open conversation with them and be honest about it. Do your work, do the best of your work, and then propose what you are asking for. Third things, as I mentioned, like participate in leadership modeling, especially when you are an inclusive, especially when you are, I was a chief fellow in my cardiology fellowship. So I always like participate in the fellowship curriculum. So I was always like considerate of other people holidays and other people important events. So when it comes to represent my belief or my background, I was able to like propose or advocate for having some wellness event or curriculum or something related to my background or belief. So when you are present, when you take a leadership role and involve everyone else, it will be easy to present yourself as well. As well, it's okay to ask for flexible schedule. For example, for if you have important holiday or important, for example, month. I'm just saying about Ramadan, for example. You can ask in your first year if they ask you about like your schedule preference, and if they propose this, it's okay to say, hey, I would like to be on a clinic schedule during this month, or I know that's like, for example, the Eid coming in this area or Christmas coming in this time, and I have very important holiday I want to spend with my family or spend with something. Can I make it as elective? Can I take elective during this month? Can I take a clinic during this month? So when you take a day off from these days, they will not feel like they are strained and need to fill someone. It's very hard to do that when you are on ICU or on clinical rotation or important rotation. They need to like call the backup, and you are taking days off, making hard on them to like help you with that. So always like propose your to be flexible if that's they ask you for that. Advocate for yourself. However, do your diligence and consider everyone else working with you. As well, ask help with people who were in the same shoes. So for example, if you have like same belief or same background, attending or co-resident or senior resident, ask them how they navigate for asking for these days off, how they manage fasting during Ramadan, how they manage to like do their prayer, how, like whatever you are considering. So ask help, especially if you have someone in your background in the same program. So strategy, again, for me, is be intentional about your boundaries and self-care. Always like try to consider it. I can give another example. For example, right now I'm doing interventional cardiologist, and I need to like have the certain cap, and I'm wearing hijab. So I looked up how I can have a certain surgical caps that can cover my hair. So I have it on my previous program, and when I moved to the other program, after I started them, I have a back of 10. I told them, you know what, I'm using this because it fit well to me, and I can cover my hair, and I can be scrubbed in and sterile, and like, and they were so more than happy, and they provide me a package, like 3 bags of package that can support me for the whole year. So always be intentional, be like speak with them about like what you like to be present, how they can support you, and they are always willing to help with that. The other thing, find community inside or outside the hospital. There must be, for example, some person from the same background. Sometimes in other specialty, for example, when I was in my residency, I believe the infectious disease head was like from the same belief. So he always contact me about event, about things they are planning to do, etc., related to like Eid prayer or Islamic holidays, etc. So he always connect with me. So always find your support from the same background or the same culture. For example, if you have a Syrian friend, Syrian community, even from other specialty, even outside the hospital, sometimes like, you know what, we have this potluck on the weekend, we are gathering with the other people. It's always to connect with this and have them as a support group inside and outside the hospital. And always identify who will be your friend, who will be from the senior resident, who understand your background, who is like more open to hear you, as well as a mentor about your days off, about like your commitment, about like what you like to have. Especially, I want to say as well, for example, in some residencies they host a meal or they bring meals. It's good to say, hey, I eat, for example, vegetarian, I'm gluten-free, I don't eat pork, etc. So it's always okay, and always speak up when it's safe and educate when possible. So for example, one time they host a lunch and they have everything, like have either pork or something else, and I was like, I'm not able to eat anything other than salad. I didn't say anything, I let it go. And then the day after, I thanked them about the lunch, and it was amazing, it was good, but it was hard for me to know which dish have pork because I don't eat pork. So I didn't tell them all food were pork. I told them it was very hard for me to know. And they recognized. I was like, you know what? We are so sorry. We did not recognize that, and we'll make sure that the next time we have something vegetarian or something else for you. So just be educate them like, hey, I don't eat this, I don't do this, I have, for example, health problem, I don't eat gluten, I don't do this. So it's very always nice to like have open conversation with them. Don't feel isolated, don't feel like you are shy, don't feel like, oh, I cannot say this or I cannot mention this. Just find the right place, just find the right time. Understand your environment, understand the group of people you are working with you, understand who are the residents. If you find someone from the same background, same belief, a year ahead of you, or like as a staff, or always speak with them. Hey, I'm starting here, what's your advice, what the culture look like, how can I ask for certain holiday, how can I ask for certain time off, how can I ask for etc. And they will help you always. And then always accept that the balance and having this is dynamic and evolving. They might not know you from the day one, so they need time to know you, what your preference, what you like, what your background, and always be honest about it, and don't feel shy to advocate about it. However, at the same time, try to be supportive for other people. For example, some person need to have a days off to celebrate his kids' holiday or their kids' birthday or the graduating from school, etc. Be willing to volunteer and take their shift. So when you ask for a day off on our holiday, they will feel like, yeah, you know what, he helped me and during these days, during this important event for me. So when you ask for something, they feel they are paying you back, and it's like, sometimes it's a cooperative team and always supportive team. So be supportive to your co-fellow, co-resident, co-team. So when you ask for like your days or your request, it will be always answered with support. And as a summary, I just want to make sure that face and identity, I feel like it is a part of whole person, and that we should not leave it at the hospital door. I know sometimes it's so challenging. You want to fit in the place. You struggle. How I can introduce myself? How can I say it? They might ask you, for example, they always come to me and ask me why you are wearing this headscarf. Why you are dressing this way? Why you are not eating today? Why you are not sharing lunch with us? It's okay to say, you know what? It is part of my faith, and I'm doing it, and that will not change the way I practice medicine. This will not affect my patient care, and that will be like my own preference. And they are always acceptance. They don't judge you. They don't want to just present it in a nice way, and always be present. Do the best of your work, and always show them that you are the best resident, hardworking. You don't miss lecture, you don't miss patient care, because that will contradict with your face. The other thing is, like, when you feel like you are belonging to the program and you are practicing what your background is, you always feel like you are well-being, which I will chat on next, and then you are performing better, because when you feel like you are limited to present yourself, you will not be yourself, you will not present, you will not be productive. So it's very important to balance these things as well, and always know that balance is possible and powerful when you have the good balance about your training. And it's 3 years. It's not 3 days. It's not 3 weeks, not 3 months. It's 3 years of your residency, or maybe longer if you are in another specialty. So you need to feel, you should feel like you are a good fit, you are productive, you are doing your best performance, and you are comfortable with the group of people you are working with. And if I believe I have still time, I believe the other presentation was about stress, burnout, and work-life balance during medical residency. However, I add to it that how we can navigate and thrive, because this is my goal to say, how we can navigate and thrive in this environment, which is full of stress and a lot of work and a lot of hours. And I believe the previous lectures was extremely helpful and extremely amazing about how you can be a hard worker, how you can be productive in research, how you can plan for your fellowship, how you can, but these are a lot of tasks. These are a lot of tasks to like fit in 24 hours. It's a lot. So I want to just go over the other scenario when you feel like extremely stressed. So the stress is like, is like a kind of environment when you feel like physically and mentally and emotionally drained and strained and extremely tired, and which is especially very common in the health system, because with the high pressure environment, the long hours, you feel stress. Some people receive stress as a positive and something they push them to produce more and sometimes to like be more productive. However, sometimes it can affect us in a negative way. We feel like we are not productive. We are extremely stressed. We feel like our hands tied, so we cannot like be more productive. If this to continue, unfortunately, that you will hear a lot during residency, that will turn out to be what's called burnout. What's burnout? Burnout is like the consistent chronic stress. You are always stressed, always on the edge. So you feel like emotionally exhausted. You start to feel depersonalized. You don't care. You feel you are detached from the patient, from your fellow, from your co-worker. You feel like you are just become isolated. At the same time, that will make you like less productive and your accomplishment will be less, and that's what we don't want. We want you to shine in your residency. We want you like to be thriving during residency, not only survive. So why burnout happen in residency? First of all, very, very, very long hours, night shifts, mess up your night and day schedule, very high patient load, especially if you are joining a large program, like they have a lot of inpatient, a lot of admission, emotional cases. You lose a patient who's young, a mom who have kids die, and like it is a lot of emotion, stressful. Limited autonomy. You always need to like run this plan with the attending, run this plan with your senior resident. So you feel like you are not like making autonomy of the decision. And then as well, you always have this performance pressure. I want to do this task. I want to do good in my ITA exam. I want to be have a good score. I want to publish this abstract. I want to do this. And there's always performance pressure. You want to always catch up with your peers. As well, unfortunately, there's when your residency, you don't have the boundaries about your life, your own life. You should be protective of your free time, and sometimes it's very hard to have this like good balance. The other thing is like sometimes some places they have lack of mentorship, people who you can speak with when you are struggling, or you don't have the support when you are struggling. And especially in the first 6 months or 1 year, you need to have someone who holds your hand, walk you through the first step of residency. It's a new program, new place, new city. You always should look into someone who help you with this first few months. So just watch out for sign of burnout, especially first 6 months, first year. It's extremely, extremely hard. You need to put all your effort, all your time to shine and be have the first impression, good impression that you are hardworking. So always feel like, are you extremely fatigued? Are you extremely irritable? Are you feel like detached from everyone else? You don't want to like, you don't care, you don't like, you want to work with them. You are so, this is a sign of burnout. That's mean like you need to take a break. You need to think about yourself. You need to like consider how you need to improve for the rest of your residency. You feel like you are not motivated anymore. You woke up in the morning, you don't feel like the energy to like pursue another work days. Your performance is always on the edge, bare minimum. You are doing the bare minimum. You always feel anxious. You always feel depressed. These are the signs of burnout. I scared you for this the first few slides, but I promise you I have the tricks and tips, hopefully, that can help you to navigate through this. So my focus will be resilience and thriving. And resilience is what they call it in English, that you can adapt and recover after each dilemma. You are running into this problem, you are running into this feeling, but how you can recover from this feeling. You run into this problem, it's not too late. We can recover. The other thing is thriving. We want you to shine and grow and feel fulfillment and feel like rewarded about what you are doing, even during challenging
Excuse me, Dr. Bayan, just 2 minutes to go, please.
Awesome, sounds good. So for these skills, I just want to say these are skills that you can learn and can be adapted. So the skills I want to say, first of all, time management. It's extremely important to prioritize what is most important to do on your timeline. Second of all, always use a planner. I believe everyone spoke about it. Organize your schedule and have a planner and have prioritize what things. The other thing, don't do multitasking. Sometimes you want to accomplish a lot of things at the same time, and at the end of the day, you feel like you didn't do anything. And that's like horrible feeling. So always try to do one task at a time and avoid multitasking, especially in heavy time of your schedule. The strategy too is physical wellness. It's extremely important to have 6 to 8 hours of sleep. I cannot like emphasize on that, especially when you are inpatient, especially if you are in ICU. Go home. If you have 6 to 8 hours of sleep, don't spend it on your phone, scrolling through social media. Turn off your phone and have sleep. That's extremely important. The second thing is regular exercise. I cannot highlight how much important is physical activity. I don't important how much is like being active. Even 15 minutes, even just 15 minutes. In my residency, I was extremely stressed. I was tired. You know what? I not book sport. I start learning tennis. So it was like 1 month every couple weeks, but at least it's like give me outside the hospital, I be active, I become back more refreshed. The other thing is like balance your nutrition and hydration. Limit caffeine. Don't take a lot of caffeine. Don't take a lot of energy drinks. That will make you work and go home and cannot sleep. Have healthy, balanced diet. Try to pack your lunch. Try to have salad. Don't spend it on crackles and fast food. That will make you always like unhealthy and stressed. And take breaks. If you are long shifts, just take 5 minutes break. 5 minutes break. Take the stairs. Move around, walk around. So just a little bit of physical activity can help. Second thing is like emotional and mental wellness. Whatever you practice, whatever you do, have your prayer, your mindfulness, walk, whatever you do, just take it at least 15 minutes a day. Use an app, listen to music, walk outside in your work, to your work, park your car far away and walk 10-15 minutes in the morning and 10-15 minutes in the evening. This is enough just to refresh and feel refresh again. Most program, if you run into problem, have counseling program. They have counseling people. If you're running into struggle, please don't feel alone and you want to shut down or not speak about it. There's a lot of support for you. So always look for counseling if you feel like I exhausted all the options and I'm not able to keep up. Fourth strategy, I would say your network. It's extremely important. I cannot emphasize how important it is. Try to connect with your fellow, your co-resident. They are always share experience. We call it in my residency, we call it venting session. At the end of the inpatient or ICU, we say 10 to 15 minutes, we want to vent. We want to just speak up about what happened our day, how it went, how we can improve it. Always connect with your peers. Second things is seek mentorship. Ask from your attending, especially if they have same background, or your always mentor, like, hey, I want to talk to you. I'm running into struggle. I'm like behind time. I'm having this stressful event coming in. How you can help me? They always open doors and they're always happy to share their experience. Lean on a friend and family. If you have in the same city, friends, family, colleague, whoever, try to spend time with them on your weekends. Try to lean on them. Try make them help you. Like if you don't have time to shop, like, hey, can you bring me this and this? I'm like running out of time. Lean on your friend, lean on your support system. And always, as I mentioned, if you have residency wellness program or interest group, you're playing soccer, just try to find who plays soccer in the city and try to like play soccer with them, play basketball with them over the weekend. My strategy 5 is learn how to say no. Sometimes you have like, you want to publish this and do this and do this. However, like 5 attending at the same time come to you and say, you know what, we have this conference coming up and I want you to do an abstract. You are able to know your time limit to do 1 or 2, but they 5 come to you. You can say in very nice, polite way, I'm so sorry, I'm in busy rotation. My limitation, and be honest about your limitation, my timeline will work to do 1 or 2. Don't make promises. You make promises and you feel like you're responsible and you are not meeting the time, you are not meeting the expectation. They will feel frustrated from you and you will feel down because you didn't meet their expectation. And protect your own personal time. You have take vacation. Please take vacation. You have 1 week of off. Turn your mobile off. Send notification on your email that I will be away and I will respond to my email when I'm back. Take the advantage of your time off. It's absolutely fine. And know your limit. Know what you are working with. My last strategy, and I promise that I believe everyone touch into that we always have value. Whatever we do, you are going to, like, for example, internal medicine to be like the awesome internist. You want to be cardiologist, you want to do etc. You want to help people, you want to go back home, whatever. Write it down, put it on somewhere, and always reflect on it. When you feel like down, when you feel like depressed or mentally drained, always go back, read it, remember why you went through this, why you came here. You want to shine, you want to make your parents proud, you want to make your wife proud, you want to make your kids proud, whatever. Always have something to reflect on and remind yourself why you went through this again. Second, sometimes helpful, like if you want to interest in something in cardiology or GI or hematology, do some research and see how this will affect, how this people build up knowledge, help the future medicine. You can volunteer or do some teaching, sometimes volunteering in underserved area or in school or some community, or do some teaching for medical students. This feel reward. You feel reward. You are giving back. You are not only the learner, the consumer, you are giving back. So that make you feel better about what you are doing. So in summary, I just want to say thriving, growing, shining in residency is possible. And balance is always important, and self-care is extremely essential for you to shine and be successful, and it is absolutely not selfish. And just want to make you sure that you are not here alone. We went all through this journey. It's extremely tough, but we know that you can make it. You successfully match, and hopefully you will hear your good results later on. And I'm so sorry if I went through over time.
No worries. Thank you very much for the great presentation, Dr. Bayan. We usually tend to go all in our career life and forget about our personal life. Thank you very much. We will go now to a Q&A session. So if anyone have a question, please share it. Raise your hand, open your mic, or please share your question within the chat box.
Yes, and if I may just leave a quick comment before we start.
Please
so
go
I
ahead.
will say fantastic presentation, Dr. Issa, mashallah. That was very helpful. So I will suggest that for those of us who are starting, the residents who are starting in July, pick up your phone, set a reminder for yourself on October 1st to come back to that particular presentation by Dr. Issa and revisit the 20 minutes, 25 minutes, and you'll find it extremely helpful again. So in the midst of it, you may forget some of the helpful hints here and there, but I would highly recommend that you go back to it after you start your residency.
And I want to mention the October because this is the most intense time when you feel so much drain and you feel like, why I'm doing this? Why I'm doing this to myself? I'm extremely stressed. I'm extremely burnt out. I want to quit. Just want to say, one of my residents, friend who went through residency, I just kept telling her before she started, please don't quit in the first 6 months or 1 year. Just please push through the first 6 months. It's extremely hard. Extremely hard. I cannot say it more. And she said, no, I'm so excited. I went to residency. Are you insane to tell me don't quit? Like, that will never cross my mind. And believe me or not, in November, she called me and she told me, I was in the break room. I was like, why I'm doing this? I'm not coming to work again, etc. And she said, the only thing I remember that when you say don't quit before the first year. Just let the first year end. And that's absolutely right. It's extremely hard, extremely stressful. And this feeling always comes to you, and everyone went through this, have this feeling. So I know you are like right now excited and happy, but once the 6 months hit, you are moving every month into new rotation, and every time you walk into new rotation, it's extremely new and not related to the previous one, and you feel like you are starting learning from day zero, and you are feeling dumb, and you cannot achieve, and you are not productive. By the end of the month, when you feel like you get hang of the things, they change you to another rotation, and you start from zero, and etc. So this is hopefully will not happen to you, but if that happens, just know that extremely common, and it's okay.
Yeah, we have one question from the chat box from Hussam. What to do when you are not understanding what patients or seniors are actually saying?
I can, yeah. So in a kind way, you can say, could you please say it again? Repeat that again. Rephrase it again. And then if you started to catch on it, but you're still not understanding the full sentence, so you can rephrase whatever little bit that you have understood, and then ask to elaborate more or something like that. And every now and then, it still happens to us who've been in practice for years. They repeat it again. We still don't understand. Do not pretend. The wrong answer is not pretending that you understood. Just don't do that, because you'll be in a worse situation.
And I just want to mention for the one question, you always introduce yourself as doctor with last name. We don't use first name in United States. So always introduce yourself as doctor from day one, because you are a doctor, you graduate from medical school, you have the MD degree. The nurses or the patient might consider you a nurse, or like respiratory therapist, etc. So always don't feel shy to introduce yourself as a doctor, especially with the patient. Otherwise, they will not know that you are a doctor.
Thank you for sharing that. We have another question in the chat box. If not able to get first credit card from a bank, do you recommend using these commercial credit cards like Chime to help building a credit score? I think this is for Dr. Ahmad Awwad, if you are with us.
Yes, hello. So if you were not able to get a credit card because of lack of credit, I think the best way is to try to have a co-assignment. Like if you have like a relative or like someone who can trust, they can add you into their credit. That's what I did, for instance, with my brother whenever he came in, immigrated to this country. Another way, some banks, they may offer like a new type of credit card that's backed with a certain debit. So you need to ask about it. I mean, I know Bank
It's
of
called a
America.
secured credit card, I think.
Yeah, secured credit card. Yeah, thank you so much. Yeah, we're like it's a way like kind of like to start like building up your credit.
Okay. Yeah, I think there's also some companies like Capital One and Discover It that can can give you some credit line without having like a credit score or something. Another question from Basil. I'm at transitional year. What is the best advice for me to do in order to get in a psychiatry program?
I'm not a psychiatrist, but I would say probably a good idea to, ask as many psychiatry residents, especially IMGs, as you can get a hold of. And never be shy of sending emails, asking a friend's friend to try to get them their contact if that is okay with them. Trying, I don't know if that transitional year allows some electives, and it would make sense that you'd want to try to do some psychiatry elective.
Okay, thank you. And please note, this is at the Q&A session for just session 4. We still have a session after this. It will be like a very quick session, each for 3 to 4 speakers. I think each one will talk for 10 minutes will speak of their personal experiences. So if you have any questions regarding the sessions, please. Okay. This is a question from Kinda. Our program invited us for a graduation event for the senior. Is it okay not to go, or it will give a bad impression?
Is the not going as a personal commitment? If you are, for example, you have other commitment, it's okay to send them email, say like, hey, thank you so much for the invite, first of all. And I would love really to join you and meet the fellow and the resident and graduating, but unfortunately I have other commitment that was planned before. Otherwise, for me, if I have no other commitment, I will definitely go, because that's very good, nice way to connect with them. It's very nice setting a seat to see the graduating resident as well, who's like in the program, to socialize with them outside the start of residency.
Bayan, I do have a slightly different perspective, and I think you have a great point, about the importance of socializing and all that. I think the answer probably varies also based on individuals' circumstances, not just the circumstances of a particular event, but also in general, if they have family or not. But also, for those who have concerns about being present in a place where there's alcohol is served and something like that. So it all depends on what exactly the event is. You can also make it as you can make your show up as brief as possible. And remember that reputation about you being engaged within your community at the hospital as much as possible is not a single event indicator. It's the conversations that you have every day. It's then being nice and polite with everyone. So not attending one particular event is not the end of the world. But just what we're trying to say, and is extremely important, is don't isolate yourself entirely. But at the same time, be mindful of your own beliefs and thoughts that you want to follow.
Okay, thank you for that.
Yeah.
We have a
the graduation
question.
event
Yeah,
will be,
please go ahead.
The graduation usually event, if it's like the formal one, usually will be the most conservative one, not the party after.
Right.
So I feel this one, it will be, I feel, the most professional time, because all the staff, all the attending, all the chair will be there. I'm talking about the professional, like the formal one, which usually I feel like this is the best professional event you can attend. But absolutely, that's like your own preference, absolutely. But always thank them for the invite and say, you know what, thank you for inviting me and including me, because you are upcoming residents. So it's good to appreciate their gesture. And then you can apologize for whatever reason you have.
But most importantly, if you decided not to go, let them know as soon as possible.
Yep.
I think that's the most important thing.
Exactly. I agree.
Okay, thank you for sharing your thoughts on this. We have a question, but I think we already covered that. It's from Wissam. It's about going to social event where there is alcohol or drinking and leaving bad impression if we didn't go. I think we already covered that. Yeah, I think if we'll just wait for 1 minute. If there's anyone else have question, please share your question. Otherwise, we will wrap up and move to the next session.
Yeah, well, a question comes as an issue that comes to my mind is the fact that once you are seeing more and more patients, at least that was one reason for my personal burnout at some point, is the fact that you'll have to accept the reality that you cannot help every patient. There are a lot of patients that are going to come. They have chronic problems. They have long-term issues. They have serious issues, or they have a complex mental component of their illnesses that is going to make the management complicated. In the beginning, I felt, I used to feel drained, at the end of the day. But over time, I learned that, what, I'm still doing my best. I'm doing the standards of care. I'm following the guidelines. I'm consulting with my attending. I'm being professional with my patients. I'm not helping them much, but that is what medicine can provide. So don't let that take out of your own emotions and energy.
Yes, that's a very good point. And yeah, if no one else have any questions, I think I'd like to thank all three presenters, Dr. Ahmad Awwad, Dr. Wissam Kiwan, and Dr. Bayan Issa, for having the time to give these great presentations here today. Thank you very much. And
thank you for the invitation.
Yeah, sure. And if we have I don't think we have any other questions. So I'll just hand the mic to Hussam Kiwan. He's my co-host. He's gonna be hosting the next session. Hussam Kiwan is an upcoming internal medicine resident at St. Louis University. And I think you graduated from Gaziantep University, right?
Close enough.
Close enough.
No, that's not what now.
Yeah.
أنا تخرجت من Oldukuzmak University. It's like in the complete northern side of Turkey.
Okay, perfect. So I was still in Turkey. So close enough. Okay, thank you very much. And the mic is all yours now.
All right, thank you so much, Yasin. مرحبا let me just share my screen
Okay.
quick. Be able to see my screen now?
I'm only seeing a black screen.
Oh, okay. Something like this happening. Just give me a second. Sorry for that.
Yeah, no worries.
اوكي هلا شايفين الشاشة؟
Yeah, شايفينها. Perfect.
alright. مرحبا بالسيشن الأخيرة. منيح إنه متحملين لسه لهلا. يعني الساعة صارت 12 واحدة إلا ثلث. شكرا لكم جميعا لصبركم. إن شاء الله تكون هيك جلسات كثير مفيدة. أنا بالنسبة لي هاي الأكثر يعني كل جلسات كانت حلوة وممتعة واستفدت منها يعني، بس هاي أكثر جلسة حاسس حالي هيك متحمس إلها. أنا حاسس راح تكون أخذ وعطاء أكثر. راح تكون هيك مساحة مفتوحة لمشاركة تجارب غير محدودة بأي موضوع. معنا كثير عدة ضيوف قيمين جدا. حتكون الجلسة كالآتي، حتكون مجرد هيك 10 دقائق، كل شخص ممكن يحكي حرفيا أي شيء بيخطر على باله، أي شيء حاب يشاركه. بعدين راح تكون مساحة حرة للجميع اللي بيحب يحكي أو يطرح أي فكرة. حنبلش بمايا. مايا هي Chief Resident بكورويل هيلث إيست ويليامز. هي Pediatric Chief Resident. Maya, please go ahead if you want to start.
Hi everyone, I'm Maya. I'm one of the chiefs at Cornwall Health East in Michigan. I'm very happy that thank you for the invite and thank you for having me. It's truly an honor. I've been kind of affiliated with SAMS since the year and a half, and it feels very good to give back to the community as a Syrian at the end of the day. So here it's I'm here to just talk about maybe reflecting now that I'm graduating in 2 weeks, as an intern, as someone who progresses, and now as a chief resident, looking at the flip side of things. Also being a trainee and going into fellowship in less than a month. So I will start off by in terms of experience, what I would say to interns, especially the A-type perfectionists, I would say you have to give yourself grace to learn. You have to be open that you're gonna be molded to a different person. I was the type of straight A, perfect. I used to enjoy hearing compliments during my US electives. And then I started residency, and my electives were all during COVID. And then the first 6 months were just something different. I was hearing, no, you should be better at this, be better at that, be faster at that. So I felt like it was a shock the first 6 months. What am I wrong? Am I struggling? Is there something wrong with me? But in fact, especially your other interns, not that they're competitive, but nobody shares their struggles with you. Everybody is also feeling as bad. So I just felt it was me. And then so it just take this first 6 months as a period to soak in as much of feedback as possible. Nobody is against you. The seniors are not against you. The faculty is not against you. Everybody wants you to develop your full potential. And trust me now, me as a chief resident dealing with struggling interns, giving feedback is not comfortable for us. So if somebody's giving you feedback, trust me, this is not comfortable for them. They could have just moved on. but they just wanted to take their time for you to make you a better person. So rather than me taking it personal or defensive, especially if like you're the perfectionist type, take and what are they trying to tell me? What are they trying to teach me? Like even ask for more, like what could I have done better? Teach me, you know? And then like when I soaked in this feedback in the first 6 months, I felt the second 6 months till today, things have been easier. I still do get feedback every day, much lesser than I was an intern. I could say I just got a feedback about something 2 days ago. I'm in the ICU right now. That's okay. Like you're learning. So you have to give yourself grace every day that you're an ongoing learner. So like first, I think you're under the impression as an intern, not only like, oh, I have to soak in feedback and get better. And then I would say like I'm trying to summarize my whole 3 years in 10 minutes. So after like you're an intern, you're accepting that, oh, I have to get tons of feedback. That's how I'm becoming better. You come to second year. I feel like each year has its own difficulty. Like they're nice, but you get more used to it as you progress. But each year has its own like touch, I'll say. So I'll say PGY2 was like where I felt I'm not an intern, but I'm not someone who's graduating tomorrow. So I just felt the person in between. And my program later on did better about like making second year like second years and not like as someone like a third year. But like at that time, still before that, like I just felt very overwhelmed. Like I'm not an intern and you're expecting me to supervise others, but I just finished being an intern. So I think you have to understand, like you will just like also at that point, I started giving myself less grace for like, oh, how did I not know that? How do I know less about that? So it's just realizing as a second year, even as a third year, even me as someone who's graduating in less than 2 weeks, is that I am an ongoing learner. I'm never going to reach a point where I'm going to say, I know everything in pediatrics. It's just I know more than yesterday, and I definitely know more than July 1 of my intern year. I know more, but there's so much still I have left to know, even my attendings, and that's okay. We're all learning. Like this one time I was feeling bad about myself in my second year in my NICU rotation, and then I told my attending, like, I feel like I'm a second year, I should know better. And then she was saying, like, even me as an attending, when I round with you, I just make a list in my head of what are the things I need to look up. So it's just like everyone is learning here. So it's just when I give myself like, okay, stop it. You're just an ongoing learner. You know, you're not an attending. And that's when things got a little bit better. And like you have to give yourself grace to learn. And also as a second and third year, and like at any point when you're not an intern, is realizing you have limitations. Like there's so much you can know. And you have to have a point where you say, I do not know. I need someone who's more superior to help me. And that's like you don't have to feel bad. It actually makes you better. People trust you more when you say, I do not know, because if you say something that you know about, people are going to say 100% you know, what is it about? So know your limitations as you advance later in your like residency, if you want to do fellowship later on. And like now looking at it as a third year where like I was a third year chief where like I did my third year things on top of chief things, and we had to be involved if there's a second year who's struggling, if there's an intern who's struggling. Like, I would say from that standpoint, definitely be open to feedback. Like, trust me, like, I wouldn't like take off my time as an in-training chief, doing fellowship interviews, doing boards, and just like spend 30 minutes with an intern telling them feedback. I wouldn't want that unless you want the best for them. So just like don't take anything personal when it comes to feedback. Nobody's trying to set you up for failure. In fact, it's the other way around. They're trying to set you up for success. Everybody's taking their time to help you. This is residency training. It's training for 3 years. If they knew you can do this from July 1, trust me, you wouldn't find the residency training. That's the thing I used to tell myself. It's 3 years for a reason. And now I'm going to fellowship training for another 3 years because there's a reason that I cannot be, like I'm doing pediatric pulmonology. I cannot be an attending tomorrow because there's a reason. So it's just to giving yourself grace, learning every day, asking for feedback every day, even if you're in a better spot in your training. Also, I would say another one, teamwork. I would put this under like in red line. So residency is rough anywhere in any program. But it like sometimes like not everything works out the way we want to. But the key to like make it easier is being flexible. So for example, like now that I'm involved in schedule making, sometimes the schedule is less than ideal, although like we try 5 versions to make it work, but sometimes it just doesn't. And for example, we have to be a little bit creative. For example, pull float, pull people from outpatient to help us. So like if that happens to you, like just like show grace, show flexibility, like sometimes there's some short staff days, there's some rough days, and like sometimes you have to show up for your coworkers, make some switches as needed. Definitely set boundaries. Like if you have something personal that's very important, definitely, like I'm not saying let off your boundaries, but at the same time there should be like some teamwork and like understanding what other colleagues are going through. For example, like if you're in the third year and someone wants to switch a date with you because they have a fellowship interview, truly it means to them a lot. So like maybe trying to help them out, trying to figure something out, making it less stressful on them. So trust me, like be working as a team, not only with the co-residents speaking about it, but also with other staff like nurses, respiratory therapists. Like you're all working as a team. It's not like, oh, doctors against nurses, doctors against respiratory therapists. Like just remember you're all working as a team for the patient. Nobody's against each other, and you shouldn't be against each other. So for example, if like you feel like you're disagreeing with a nurse about a plan, don't do it at the family's bedside or at the patient's bedside. If you really strongly disagree with what if someone else is saying from the team, talk outside. This really fragments your relationship with the patients. So always remember, like, get to know your nurses, say hi to your RTs, to like child life if you're doing pediatrics. So just be friends with everyone. You're all working as a team. Trust me, it makes residency less stressful. Like I don't like my time on the pediatrics floor, but I know the nurses now since day one and have been friends with them. Trust me, it makes the day so much better. I don't know if I exceeded my 10 minutes, but I think that's what I have so far. Looking back on my 3 years of training.
Thank you so much, Maya. It's actually really interesting how most of us actually, when we left our schools back in our home countries, we were like kind of top of our schools. But now when we shifted in here, we literally know nothing, and we started our intern year, and we still like we still like need to learn a lot. I will leave more space for Q&A at the end. Meanwhile, I will introduce Omer Abdrabbuh. Omer رفيقي المقرب يعني لست سبع ثمان سنوات بتركيا. Thank you عمر actually لأنه he's actually بالدوام وبصعوبة لا أوقات حتى ينضم لنا. عمر intern ب UT Southwestern. We graduated from Istanbul University ب 2022. عمر تفضل.
السلام عليكم يا جماعة، سمعانينا؟
أي تمام سامعينك.
والله أنا سبحان الله انضميت لآخر الجلسة الأخيرة، وهلا كنت عم أسمع مايا، يعني أنا استفدت من المحاضرة، فأكيد اليومين يعني كانوا مليئين بالمعلومات، فالله يجزيكم الخير يعني على المبادرة، والله يعطيكم العافية. أنا سبحان الله كثير قريب للأفكار اللي حكيتهم مايا، فأنا بدي أحاول ما أكرر الشغلات اللي ذكرتهم، راح هيك أحكي الشغلات اللي ببالي. رقم واحد، انترن. أنت يعني طبعا أنا انترن، أنا جيت day one from تركيا لهون، ما كنت عايش بأمريكا. جيت 29 شهر 14/6 كنا مبلشين. يعني جو جديد، السيستم في تركيا أيضا مختلف، وأنا متعلم أيضا بالتركي، فأنا ما أنا متعلم إنجليزي، فعندي لسه نقلي من التركي للعربي للإنجليزي. عم احكي هاي الشغلات يعني لانه رح تبلشوا اول شيء رح تحسوا انه وين انا، وين السيستم، شو هو البي تي، شو هو الار تي، شو هو الاو تي. انا اول مره الاتندنج عمل اوردر للبي تي او تي، فانا فكرته هو شيء تيست، فبعدين سالت السينا قلت له شو هذا. فطبيعه تحسوا هذا الشيء. رقم واحد هو your attitude، كيف انت رح تواجه هاي الشغلات. كونه نحن جايين على بلد اخر، فانت ضمنيا تعترف انه انا جاي اتعلم. فرقم واحد هو your attitude. اول شيء ذكرتها مايا هي موضوع الفيدباك. ask for feedback دائما، يعني حتى انت قبل ما يقولوا لك تعال نعمل ميتنج للفيدباك، مثلا انه هيك بنص الروتيشن، ممكن اذا عندك روتيشن مثلا لمده شهر وعندك اتندنج لمده شهر، هيك بعد اسبوع اسبوعين اقول له والله انا بدي فيدباك مشان اطورهم خلال الاسبوعين الجايين. ask your senior، ask احيانا كو انترنز. بشكل عام كو انترنز ما ممكن يعطوا فيدباك لانه هي بتكون يعني علاقه نوعا ما صداقه اكثر، لكن رقم واحد يعني الفيدباك رقم واحد. النقطه الثانيه، ما تخجل من تسال اسئله. قلت الاتندنج اللي عندنا بالاي سي يو، انت الانترن ما راح يقتل المريض غير اذا ما سال. يعني انت ما راح تعمل غلط طبي غير اذا ما سالت. ما تقول والله هذا سؤال غبي وسؤال ذكي ومستحي، لا، يعني انت هون يعني انت مانك موظف من شان تعالج المريض، انت هون متدرب، فانت جزء من تدريبك انك تكون عم تتعلم. فما تخجل من اي سؤال، يعني حتى لو شغله ما فهمتها، انه والله مثلا واحد حكاك شغله ما فهمتها، بصراحه اصعب شيء موضوع الحكي هي موضوع حدا بيحكيك على التليفون. فما مشكله، يعني حاول انه تقول له والله فيك تعيد هاي شوي، فيك مثلا اذا مثلا هو بالمشفى روح حكي، بس يعني اذا شغله ما فهمتها اكيد اسال عنها، يعني ما تمرق والله بشوف، لانه ما رح تعمل غلط غير وقت ما رح تسال. النقطه الثالثه هي ما تحاول حتى انه تفكر انه انا بدي اخبي هذا الشيء او ما بدي اسال. مثلا انه انا احيانا بكون كثير مضغوط بكير وبيجي على الراوند، اول شغله بقولها انه مثلا وقت برزنتيشن انا ما شفت هذا المريض. مثلا سالنا الاتندنج انه والله عملت هاي الفيزيكال اكزام اليوم، عن جد اذا انا ما عاملها بقول له لا والله ما عملتها. ما تقول له والله عملتها كانت نورمال. ما تقول له والله مثلا والله انا شفت المريض اليوم بس وانت ما بتكون شايفه. كون يعني عن جد شو هو اللي صار فورا نحكي، ما يعني ما في داعي انك تخبي او والله انك تحاول انه مثل ما بقولوا تتحربق شوي. ما في داعي بنوب. لانه مثل ما ذكرت مايا انه انت وقت بتسال بصير في ثقه فيك. لما انت شيء مره كنت مخبي شغله ولقوها بعدين بده يقولوا هذا معناته شو كان مخبي علينا من قبل، شو مثلا ممكن يخبي علينا بعدين. وهذا يعني شوي زياده، انه مثلا اذا حدا ما بيعرف سيستم وحدا جاي جديد انك انت تكون عم تورجيهم انا عن جد ما بعرف، بس انا قادر اني اتعلم، قادر اني اطور حالي، قادر اني انا عم اسالكم اسئله. بالعكس يعني هذا بزيد الثقه فيهم. ويعني بالفيدباك الاخيره اللي يعني نحن بنعمل كل 6 اشهر فيدباك مع البروجرام دايركتور، ف يعني معظم التاني كانوا كاتبين انه عمر هو كان يسال على الفيدباك. ما حدا قال والله عمر مثلا ما كان بيعرف هاي الشغله، بس كلياتهم قالوا انه معناتها هذا عمر نحن اذا نصحنا قالوا له شغله رح يكون عم يسمع. النقطة الثالثة أنا شاركت بآخر الجلسة الماضية وعن جد كنت حابب أسمع عليها أكثر، يلي هو إنه موضوع السوشيال انتراكشن كثير أمر حساس في نفس الوقت مهم، لأنه يعني بالأخير كلياتنا نحن جايين من خلفيات مختلفة عن أمريكا. كل حدا ممكن يكون عنده حساسية دينية معينة، حساسية اجتماعية معينة. فبصراحة صعب إنك أنت كيف توازن ما بين إنك أنت تكون على علاقة قوية خاصة بالإيفنتس، السوشيال إيفنتس، بنفس الوقت إنك أنت تكون عم تحافظ على حالك. كتير مهم تحضروا هاي الإيفنتس، لأنه بهاي الإيفنتس بتصير فيها علاقات، ممكن تلاقي حدا، ممكن بحديث معين أنت تتعلم شغلة جديدة، بتشوف مين رفيق مع مين، ما بتطلع أنت خارج الدائرة. وهن أيضا ما بشوفوك إنك أنت غريب عليهم، إنك أنت والله ما عم يشوفوك بنوع. بنفس الوقت يعني الحضور هاي الفعاليات ما هو أمر خاصة إذا كانت بارتيز وهالقصص. يعني كل حدا له برسبكتيف خاص فيه، لكن يعني أنا بشكل عام بالأول ما كنت روح، يعني في فعاليتين تقريبا ما رحتها، بعدين كنت عم أسأل كتير. يعني نوعا ما أنا بسأل الناس القدماء، بسأل الناس ولدانين هون. بصراحة الناس ولدانين هون ممكن يكون عندهم برسبكتيف آخر، بس أيضا تتعلم منه. تسأل الناس اللي صار لهم 10 سنين، تسأل الناس صار لهم 5 سنين، تسأل الناس تكون مثلا من ناحية دينية، يكون عندها معلومات من ناحية دينية العالم اللي عايشين هون. لأنه يعني إحنا مثلا أنا بتركيا بحياتي ما فايت على مكان وكان في مشروع، فما تنعزلوا عن هاي الفعاليات، بنفس الوقت ما تدوبوا فيهم إنه والله يصير عندكم شيء طبيعي. أحد الأمور من فترة كان حكينا أحد الليدرشيب، فهو اللي عمر يعني أنا كتير بكبر إنك بعرفك إنك أنت عندك حساسية، بس أنا بشوفك بتجي 10 دقائق بتسلم على العالم، بتسلم علي وبتروح. فيعني حتى هن لاحظوا انه يعني عارفين انه انا بشكل عام ما بروح، لكن لاحظوا انه انا بجي وعم سلم عليهم. لا انا بالعكس مقدر انك انت مانك مبعد عن البروجرام. بنفس الوقت ما بتكون تعملوها عاديه، يعني الواحد ما بده يألف هذا الشيء انه والله انا عادي اروح اقعد مع الناس ويكونوا عم يشربوا ويكونوا عم يضحكوا. وبصراحه يعني هاي الفعاليات بعدين بصير الاحاديث المستوى فيها شوي قليل. ف يعني بدكم تعملوا هاي الموازنه لحتى ما تنعزلوا عن البروجرام، بنفس الوقت تحافظوا على حالكم. النقطة الثالثة اللي هو إنه السنة الأولى خاصة، أعتقد الرesidency بشكل عام إنه هي مضغوطة جدا. ما راح يكون عندكم وقت، فحاولوا قدر الإمكان إنه يعني أعتقد انحكت شوي موضوع العلاقات الاجتماعية، مين عندكم ناس من نفس الخلفية تبعتكم بالمشفى، مين عندكم في المدينة. إذا في فعاليات دائما، يعني مثلا نحن في دالاس ما شاء الله في جالية سورية مخيفة، دائما بصير في فعاليات، فحتى لو أسبوعين، حتى لو كل 3 أسابيع، حتى لو كل شهر تروح تنضم لهم تتعرف عليهم، بخففوا عليك كتير كتير كتير. وبالأخير يعني be yourself. عم نحكي إنك أنت بدك تكون عم تساير، بدك تكون عم تاخد فيدباك، بدك تكون عم تطور حالك، لكن هذا كلياته ما بتغيير الكور فاليوز الأساسية تبعيتك. حافظ على الكور فاليوز تبعيتك، ما تكون تصير أمريكا أكثر من أمريكان. يعني نحن عم نقول تعلم منهم الشغلات المنيحة، نروح معهم تعلم، لأنه نحن جايين هون كلياتنا يعني بشكل أساسي مشان نتعلم، مشان نطور حالنا. لكن ما تنسى الكور فاليوز تبعيتك. الريزيدنسي ضغط، يعني معظم الوقت بدكم تطلعوا قبل ما تطلع الشمس، بتطلع من المشفى بعد ما تغرب الشمس. فأحيانا أنت ما بتحس الوقت إنه هل صار في صلاة، ما صار في صلاة، هل صار في صلاة جمعة، ما صار في صلاة جمعة، هل إنه مثلا بهاي الفعاليات أنا رح ذوب أكثر. فدائما حاولوا مثل ما قال الدكتور وسام من شوي إنه اعملوا ريفليكشن وين أنا من الناحية العلمية، وين أنا أيضا من الناحية المعنوية وبالناحية الدينية. بعد 6 شهور، بعد سنة، ولهون يعني لهيك هاي نقطة موضوع إنه واحد يكون عنده سوشيال نتورك بالمدينة، أو عنده سوشيال نتورك هون في أمريكا، أو عنده فاميلي هون، هي كتير بتساعد إنه الواحد يرجع. بس هو عم يشوف الحياة كيف عم تمشي برا، لأنه حرفيا أحيانا الواحد بينسى شو عم يصير برات المشفى. إن شاء الله ما أخذت أنا أكثر من الوقت المسموح لي، والله يجزيكم خير يا رب على الجلسة.
الله يعطيك ألف عافية يا رب. خليك معنا عمر إذا فيك، يعني لأن حنترك شوية أسئلة والنقاش
تمام إن شاء الله، أنا هنا.
طيب الله يعطيك العافية. معنا كمان محمد عبد الباقي. محمد عبد الباقي intern PGY1 pathology ب Allegheny. I don't know how to spell it. A General Hospital. وتخرج من حما University 2021. محمد إذا بتحب تتفضل.
يا مرحبا جميعا، تمام الصوت؟
تمام ممتاز.
as he said أنا محمد عبد الباقي، هلا عم أعمل باثولوجي. الباثولوجي شوي بعيدة عن كل الاختصاصات، شوي نحن منعزلين لحالنا أخذين لحالنا. الفرق الأساسي دائما بين الباثولوجي وباقي الانترنال إنه we usually deal with attending and our resident more than other people. So that's why usually like our personality change a lot because we need to have like this flexibility with them. I have some slides if I can share with you. So, slides okay, right? Okay. راح اقلب شوي بين عربي وانجليزي. كلياتنا قبل ما نبلش اختصاص كنا نتفرج على فيديوهات على الانستغرام or whatever about حياة الريزيدنسي او حياة الريزيدنت، شلون بيبي الساعة 6 الصبح، بيروح على الجيم، بيشرب الكافي تبعه، بيروح على الدوام. which is يعني not all the time هي اللي true يعني. حياة الريزيدنت هي لايف يعني 3 years it's a lot. احيانا بتكون هيك احيانا لا. بس كونه كلياتنا جايين من كلتشر ثانيه، غالبا راح اضطر اكرر شويه افكار بالاصل انذكرت. بس في كثير شغلات مهمه بتمنى انه لو كانت عندي اياها من قبل مشان ما يصير هذا الترانزيشن. او قبل ما بلش ريزيدنسي عملت ريسيرش يير هون بامريكا، فساعدتني كثير اني اخذ شوي من الكلتشر الامريكيه او اتعرف عليها اكثر، شو هن الشيء اللي بيهتموا فيه. فمن الشغلات اللي بتهمهم كثير هو الاوفر كوميونيكيشن. قبل ما بلش ريزيدنسي اللي المنتور تبعي قال لي دائما تكون اوفر كوميونيكيت، احسن ما انك تفترض انه الاشخاص اللي معك بيعرفوا هي المعلومه، خاصه نحن بالهيلث سيستم اي خطا او اي مشكله ممكن تسبب يعني غلط بالبيشنت كير. فدائما حاول communicate with people as much as we can. وحتى هن ما بيعتبروها انه نحن يعني مثل ما بيقولوا عم نتغلظ عليهم وخلص تدبر حالك، ولا هن بيعتبروها شيء بروفيشنال منا، انه احنا عارفين شو بدنا وعم نتواصل معهم لنأكد هذا الشيء. فدائما over communicate with like whatever the attendings or residents or nurses. شغلة ثانية هي موضوع الوقت. نحن عندنا موضوع الفلكسبيليتي بالوقت، بيقول لك رفيقك تتقابل الساعة 6 بنتقابل الساعة 10 عادي بدون أي يعني بدون أي مشاكل. حتى بظن بموضوع ريزيدنسي يعني أو الكالتشر تبعنا it's like more flexible between each other. هون الوقت كثير يعني matter for them. الدقيقة الوحدة ممكن تفرق كثير. واحد الاتندنج قال لي انه طالما نحن هون، هو احد الاتندنج كان IMG، فطالما نحن عم نعمل ريزيدنسي هون فنحن بدنا نحترم اكيد الثقافه الامريكيه، بدنا نحترم انه هن بيدقوا كثير على الوقت، وخاصه اول شهر من الريزيدنسي از انترن ما حد بيعرفك، فانك تعطي طابع انك عم تتاخر عن الشغل او مانك مهتم، فهي اكيد مشكله وراح تاثر عليك في المستقبل. فحاول دائما تكون على الوقت، واذا بتكون ايرلي بيكون افضل بكثير مشان ما بعرف شو ممكن يصير معك. بي كونفيدنت. القصدي هون كلياتنا بالبيشنت كير بالهوسبيتال بشكل عام نضطر لانه بريزنت كيسز بنضطر نحكي مع المرضى، نحن الباثولوجي شوي ما بنحكي مع المرضى بس، ولكن نضطر بريزنت فور ذا اتندينج، نحكي مع الريزيدنت. فاذا ما كنت كونفيدنت من الشيء اللي عم تحكي نوعا ما كثير رح ياخذوا حكيك بعين الاعتبار، بغض النظر من ما كان يكون. to be confident لازم تكون محضر منيح المعلومات او الشيء اللي you are going to present. لازم اكيد طبقه صوتك تكون عاليه، ما تكون خايف، ما تكون طبقه صوتك واطيه، لانه حتى لو كنت عم تحكي كلام صحيح ممكن يعتبروا انه انك مانك واثق من حكيك، فممكن هذا الشيء ياثر عليك. فدائما البودي لانجويج حضر منيح للشيء يلي انت you are going to present، وهذا الشيء يعطيك مصداقيه خلال الريزيدنسي. الفيدباك طبعا انذكرت كثير، مو كل الاشخاص بيعطوك الفيدباك بطريقه حلوه، بغض النظر الفيدباك كان ايجابي او سلبي. ممكن بعضهم يكون ممكن رود لك، ممكن يحكيها بطريقه ما تعجبك. بالاخير كل هي الشغلات ما أنا بيرسونال ابدا، هي شغلات عم تقول لك اعملوا لك اياها بس مشان انت تتعلم منها، مشان تستفيد. فجست خذ لايك التيتشنج بوينت او الفيدباك بوينت منهم، او دونت كير اباوت يعني الطريقه اللي هن بيحكوا فيها بشكل عام. كمان عمر I think او Maya also mentioned this. نحن هون كلياتنا اللي نتعلم، اذا سالت هن ما بيعتبروك ما بتعرف، بس بيحترموا انك انت عم تسال لانك تتعلم منهم. ونحن هي شغلتنا بالريزيدنسي. البوينت من الريزيدنسي التعليم، education, not just like I'm working, get money, go back to my house. Take it easy on yourself, protect your mental health. انا اول ما بلشت لحالي جيم واكل صحي وكذا وهيك، يعني لحد الان بعد سنه ما طبقت شيء، بس يعني I would like انه لو منظم وقتي اكثر، مخلي سبيس لحالي، وحاول دائما ما تقول انك انت اوكي اول شهر صعب، اول سنه صعبه هي انترن، بعدين بنتقل على السنه الثانيه ممكن يصير عندي وقت، حاته ما حيصير عندك وقت. بالاصل كلياتنا مرينا بالستبات، انا بقول يلا بس خلص ستيب 2 خلاص انا بدي اتعلم وات ايفر، فما راح يصير هذا الوقت والسنين عم تمر. فبلش ممكن اول شهر اي اندرستاند انه بتكون لسه على البيئه جديده، الانفايرمنت، بس وقت بتشوف حالك مرتاح بالمكان اللي انت فيه اعتني بحالك، خصص وقت دائما لحالك باليوم لتعتني بغذائك، بالرياضه، بتحب الموسيقى وات ايفر، just like do it. المقارنه، بتذكر من الشغلات اللي عملتها اول ما فتت احد الاشخاص الريزيدنت كان معي بالاصل عامل قسم من الريزيدنسي بالباثولوجي من قبل، فاول بدايه كنت دائما قارن حالي مثلا فيهم، وهي اكبر مشكله، فاكتئبت انه انا ما بعرف وكذا وهيك. كلياتنا جايين من اماكن مختلفه، كلياتنا عندنا تجارب مختلفه، فلازم نحاول ما نقارن فيها حالنا فيهم. ممكن بالاخير بنهايه الريزيدنسي، لانه بالاصل نحن كان معنا وقت كبير لنتعلم، بس بالبدايه اتس نوت فير انك تقارن حالك باي حدا. يعني للاسف كلياتنا تعبنا كثير لنوصل لهون، فانه اكيد ريسبكت يور سيلف، وانك بذلت كثير جهد لحتى تمتش ومتشت. I don't know، يعني it's fine always to say I don't know، لأنه أنت هلأ بمرحلة إنك تكون fine to say it. بنضل نحن نتعلم حتى لو صرنا attending أو fellow or whatever، بس it's not يعني هلأ ما حد راح يقول إنه هذا ليش قال ما بعرف أو شيء، بس ولكن بالمستقبل attending you are on the spot، العالم هي اللي عم تسألك لحتى تتعلم منك، فحاول دائما يعني ما بتعرف ولا I don't know but I would like to learn from you، واسألهم مور، يعني مو بس والله I don't know خلص يعني بدك شيء رايح، لا حاول تسأل أكثر عن الشيء اللي كنت عم تتعامل معه. آخر شيء اللي هي إنه حاول دائما تكون نايس مع everybody مما كان يكون بالهوسبيتال attending nurses residents whatever. لأنه الانفايرمنت اللي عم تشتغل فيها هي الشيء اللي ممكن يعمل your residency easier. وشغلة ثانية هي إنه ما بتعرف هدول الأشخاص ممكن يكونوا connection لإلك بأي مرحلة ما ممكن يساعدوك to get a fellowship to get a job بغض النظر من هن. شغله نحن يمكن هي الجولدن كارد تبعنا او هن اي ثينك حتى الامريكان بالمجمل انه بيحترموا وقت شخص بيجيب لهم جيفت او بيجيب لهم شيء لانه هو فعلا بذل جهد وهيك. فنحن عندنا سياسه الاكل فممكن نجيب لهم شيء من ثقافتنا او كذا طبعا من حما فيعني بالعاده بحاول اجيب لهم حلاوه الجبن ليتعرفوا على ثقافتنا اكثر و they really appreciate it يعني وتساوي more خلينا نقول تكون more nice with them. I think that's it يعني بس just شوية أفكار سريعة لبداية الريزيدنسي. شكرا كثير لكم مرة ثانية على الاستضافة والتوفيق. If there's any question maybe later in the Q&A session. Thank you.
الله يجزيك خير يا رب على النصائح، بس آخر شيء هو رأي شخصي ما نصيحة. ها
تفضل أنت حمصي.
أنا
الله
كمان
يجزيك.
حمصية I didn't like
لا
the
ما ذكرت إنه حمصية أبدا خلاف الجبن بس يعني.
الله يعطيك ألف عافية يا رب. والله يعني شكرا كثير أول شيء لحضوركم. وأنا صراحة هيك عم بصفن يعني بعد ما خلصت عم بصفن يعني مش عم بفكر إنه ما كنت مركز يعني بس إنه عم بصفن إنه هيك نحن الحمد لله إنه يعني ما شاء الله هلا بالحضور الموجود عندنا chief residents عندنا interns عندنا different specialties عندنا بالحضور في fellows في attendings فالحمد لله نحن should be very grateful actually للopportunity اللي عندنا إياها هي سواء هلا أو لبعدين يعني ففي عندنا وسط حوالينا نرجع له وما شاء الله الكل يعني offered انه اذا حدا عنده اي سؤال ممكن يتواصل معهم. فشكرا لكم. قبل ما بلش انا عندي سيل من الاسئله. قبل ما بلش اترك المجال للحضور اذا حدا حابب يشارك او يحكي باي شيء او يطرح سؤال على الشات يتفضل.
أنا أول شيء بدي أقول لكم الله يعطيكم العافية جميعا، بس أنا حابب مداخلة مو سؤال، بس حابب أعمل سبورت إنه أنا كمان مع حلاوة جبن من حما بس مو أكثر لأنه أنا من حما.
طبعا ياسين هو رفيقي كمان من 7 سنين. عمر حسام بعثت له هلا لازم كان هو بريزنت مي يعني انتروديوس مي يعني.
طيب في حدا عنده مداخلة سؤال أو كذا قبل ما ممكن هلا مع الأخذ والعطاء يطلع شوية أسئلة. طيب حبلش أنا. يعني أول شيء كثير انحكى موضوع الفيدباك وكون انحكى من كذا شخص، انحكى من تشيف ريزيدنت، انحكى من انترن بلش جديد فالموضوع يبدو فعلا سيريس يعني. سؤالي انه ايمت الواحد يطلب الفيدباك؟ يعني انه اوكي لازم نطلب فيدباك ولازم نتقبل اصلا ناخذ فيدباك، بس انه ايمت نحن نطلبه؟ هل نطلبه بشكل يومي بعد الراوندز ولا بعد الروتيشن ولا بعد البلوك ولا؟ نبلش بالتشيف ريزيدنت اذا بتحبي معي تفضلي.
So الفيدباك يعني الصراحة anytime. هلا في types، في اللي direct feedback اللي مثل عمر mentioned إنه 2 weeks into the block he goes to the side give me feedback. في نوع indirect feedback that we don't notice. I did a course of residents as teachers and that's when I knew that there's indirect feedback. So for example, like let's say I'm the attending who's rounding and then you presented a wrong plan. If I told you, no, this is not the definition of مثلا acute kidney injury. So that's way of me giving you feedback. You know, like indirectly telling you, look up AKI, for example. ففي the direct one that he was mentioning, you know, where like I need a feedback session, all of that. Hello, what I will say, maybe like if you really want to improve like day by day, I would first day like they're getting to know you, but they don't have much to say. Maybe halfway through the rotation, if you really, really want to know ahead of time, maybe a week later, that will be great. Later on, as you progress as a second and third year, you have to have an art of giving feedback. It has إلى أصولها يعني I mean إلى وقتها إلى its place. الفيدباك as private، مو قدام الكل، مو قدام حتى the fourth year math students ولا قدام الثird year، يعني بتصير بهدلة هاي يعني. You have to go privately. وحتى when you ask the person when you give the person feedback, you have to make sure they're on the same page. يعني مو إن بوادي وأنا بوادي. What I start with, يعني as you progress guys to second or third year مثلا, ask your junior, how do you think you are doing? مثلا إذا بيقول لك I'm thinking والله I'm doing very well, then that's a different talk. يعني you have to kind of rewire them that hey, you're not doing great مثلا لأنه XYZ is happening. Let's say if they're really struggling. بس مثلا والله I think إنه you know, you have to see what page are they on مشان يوصلوا على same page and your feedback is successful, ولا يعني حتحس إنه you just wasted time.
طيب شكرا كثير. في حدا حابب يضيف؟ طيب.
بعتقد كمان عندنا ما بعرف اذا اغلب الهدف يعني new innovation we used in our hospital to they provide after every rotation like no they should يعني يعني دائما نحن الكوردينيتور نروح وعبوا الهدف اللي احنا مشان نعبي الانوفيشن، فلازم احيانا بيعطوك فيدباك يعني عن طريقه كمان digital direct feedback.
جميل جدا. طيب أغيد إذا بتحب تتفضل. أغيد رفيق تفضل.
السلام عليكم. يعطيكم العافية جميعا. يعني thanks a million for all of the advices, information you generously provided. I have two questions. أول سؤال إنه what do you think we should document or track during our residency in order to strengthen our fellowship applications and CV in the future? Are there like specific cases أو events أو مواقف حتى إنه we should keep record of that will help us in the future? Second question, إنه على EMR, if some of you, the interns or the residents, if you can share with us some templates you use in the, let's say, progress notes, admission or discharge notes that helped you, and because you are more experienced than us now, if you can share it with us on a Google Drive or something, that would be, I think, very helpful. That's it. Thank you so much.
إذا حدا حابب يحكي عن موضوع الفيلوشيب.
If you guys don't mind, لأنه I'm matched into fellowship, I'm starting in a month, but feel free to jump in like if someone has something else to say. So I would say first 6 months of my intern year, I was just learning how to be an intern. I knew I wanted to do fellowship even when I was applying to residency. It was just not the time to think about fellowship for me in the first 6 months. I was just learning how to be an intern, how to be a doctor, all of that. In the second 6 months and moving forward, even honestly, like even if you know you wanted to do a specialty, my advice is be open about other options. Meaning that when I was applying to pediatric residency, I was a diehard neonatology. Yani I knew, like when I interviewed, when I started residency, I thought I am 100% doing neonatal ICU fellowship. I'm gonna do it. I did the ICU rotation and halfway through my intern year, I liked it. I kept forward with the goal, and then in the end of my second year, 2 months before ERAS for fellowship, I changed my mind and I decided to do pediatric pulmonology. I'm like, NICU lifestyle is not for me long term as a fellow or as an attending. I'm not gonna do it. I switched to Pete's Palm. But that's one thing I regret. Although like Pete's Palm was not competitive and in fellowship programs, they do understand that you change your mind. But either ways, my CV was prepared for any fellowship. But like, I would say, before I start how to you set up your CV for success for fellowship, just be open about other specialties. Don't like if you know you want to do GI now, don't say I'm doing GI for sure. Just say I like GI, sounds like I'm gonna do GI, but I'm open to other specialties. Say this to yourself before you tell others. لأنه you never know what you might come across with that will make you change your mind. So be open about other specialties, like even when you speak to yourself internally. It's not about others as well. Second of all, for like how do you set yourself up? So I would say be involved in research. Start like thinking about a project in your second half of your intern year. Some of them started in their second year. But for me, like مثل ما بيقولوا تعذب هلا وارتاح بعدين, and like you have a longer time to work on things. So I started coming up with my research idea halfway through my intern year. Once I knew I settled as an intern, I'm doing okay as an intern, then I started working on that. Like preferably within the specialty you want to, but again, they understand if it's not within the same specialty that there's a lot of reason, either like your program doesn't have too much opportunity in it, or you changed your mind about a specialty. They just want to know that you're doing something outside of work. And also like doing more rotations of the specialty you think you like. So if you think you want to do GI, do more GI rotations. Do more like if your program allows away rotations, do if you can. It's harder than like when we used to do electives as students. It's way harder because it's like involves GME, it involves medical license, and like you have to figure it out 6 months in advance. So like it's okay if you don't end up doing it, but it's a bonus if your program allows such a thing. Because Aslan GME does not improve it unless the other program has something you do not have. So especially if you're coming from a very strong program, this is likely not going to happen. But like try to like rotate with those higher positions in GI, for example, like the chair and all of that, so you can get a letter from them. Because when you do the LOR on ERAS, there's the section chair letter. For me, like I had the letter from the section chair of pulmonology, and I had one from my PD. You should have one from your PD. And then I had the third one from one of the other attendings I worked with in SAMS. I was doing global health in Jordan. So like, so that's one thing. And then keep updating your CV. Like residency is very busy. Keep updating it as you do stuff. And no, but then if you just sleep on it and then you come to your end of second year, you're doing ERAS, you just don't know what you did. And like many important things can slip through the cracks that might really help boost your CV, but you just forgot that you did it.
Thank you so much, دكتورة مايا. Actually, that was my question. And to be clear, إنه سؤالي كان إحنا بس شو الأشياء المحددة يعني من المواقف أو حتى البيشنتس المرضى أو حتى الستوريز اللي بتصير معنا اللي لازم نحن نسجلها ونحافظ على ريكورد منها لحتى تساعدنا بعدين بالانترفيوز وبالابليكيشنز.
So patient encounters, patient encounters basically, I would say maybe, I hope I can answer this question. So for example, I had an interesting case in the Palm Clinic when I was rotating in my hospital's Palm Clinic about someone who came overseas from Lebanon. She had a very, very bad lung disease. She was a teenager. We didn't know what's going on. The records were not clear. And then like we had to like do the workup all over again. So I talked about the personal statement, not about how interesting she is. No, I can write a case report about her, but more of like I wrote down how like it was a challenge. It was a diagnostic challenge. That we don't know what's wrong with her other than she has ground glass appearance on her CT and we don't know why. And like we had to do CF workup, like, and she had bronchiectasis as well, like CF workup all over again because it was not appropriate overseas. Genetic workup, all of that. She did not have insurance. So like a lot of the things we could not even able to do. We could not even get her a chest vest because simply it's a lot of money. So like I talked about the diagnostic challenge and like I linked it to my hobby of strength training in my personal statement and said like, when I do strength training, it's very uncomfortable, but the results back then they're better. So for example, so I remember the things that stood out for me. In terms of encounters, maybe it was more when I was a chief. So for example, like they used to tell me about a difficult learner you had. What did you do about it? So try to remember those moments that really shaped you to the person who you are today. That's what I will say about documentation. I think there's a question in the chat that I'm happy to answer as well about research background.
I just want to mention one thing. If you are asking about number of patients, it will help you only for procedure. And I believe all programs have a procedure log. For example, whatever specialty you are doing, for example, intubation, suture, etc. Keep a track of this and don't forget patients, log them early as possible. So not forget these. And that can post your CV if you are going, for example, ICU. And you did, for example, 20 intubation. And you say, I spent a lot of ICU. I did all the intubation. I did 20 with numbers. If you are talking about numbers, if I understand correctly. All program residency have track certain program to track your numbers for procedure perspective.
Thank you so much, Dr. Bayan and Dr. Maya. I appreciate it.
Let's try to cover the other part of Aghet's question. He also asked about, using templates for notes that previously used templates or templates that you get from your friends or your colleagues. What's your input on that, guys?
Oh, sorry, I missed this question.
Or we should make our own or develop our own templates, or we think we can get help from our colleagues to get templates just to get going in the beginning of the residency?
Yeah, I would say most programs have their own template and each program have their own, and they usually senior residents share it with you or template from attending, you can share it because like, for example, I'm using Epic, so I can go to Epic and see all the templates that my staff use, and I can borrow or add myself to them. So you don't need to like have something preset, because usually you can put it on the electrical medical record you are using. And you can borrow from your senior resident, your staff. It's so easy and so common to have. So I don't believe you need to prepare it in advance.
Very clear. Thank you so much. Thank you, Wissam.
Yeah, actually, before jumping into the research question, since we're talking about the notes and the templates, how was your first note for new interns that we have in here? How was your first note? How did you write it? كيف كانت تجربتكم فيها؟ أنا كمان عم أسمع إنه كتير عم يستخدموا AI هالأيام سواء from taking the notes from the patients or even editing your notes. Are you familiar with that? Do you recommend it? What's your input on that?
هلا بالنسبة للنوتس يعني كتير بتفرق الواحد إذا هو مثلا كان متعلم بالإنجليزي لما لا قديش هو وصل له. إذا عامل روتيشنز أكيد يعني بتكون فارقة معه. أنا بالنسبة لي يعني كانت أول نوت مكتوبة بالإنجليزي هي أول يوم كنت بالآي سي يو، فالسينيور اللي كتب HNP، فعم طلع فيه إنه شو هاد. بصراحة هي بالأول راح يكون صعبة. هاي مثلا من الأمور يعني كان عم يسأل حسام إنه كل إيمت أنا أسأل على فيدباك. مثلا أنا على النوت حرفيا أول مثلا أسبوع آخر اليوم أقعد أنا والسينيور أقول له مثلا شو ممكن نطور هون بالنوت، ورد أرجع على الاتستيشن تبع الاتندنج شوفوا مثلا شو كاتب أنا ما كنت كاتبه. يعني الشغلات الأساسية يعني إذا واحد مثلا ما كثير بيعرف يكتب نوت، فهو يبلش إنه المريض أول شيء يعرف شو هي أنواع النوت، شو هو الفرق بين HNP بروجرس نوت، أنت لازم تعمل هيك بريف نوت زيادة، وشو هي الشغلات الأساسية لازم تكتبهم. بعدين أنت بتبلش هي تتطور وقت بتقرأ نوت باقي الأشخاص. يعني أنت وقت تقرأ هذا النوت أنا هذا الزلمة شو كاتب، والله معناتها لازم أصير أكتب هيك. هلا بالنسبة للاي اي اعتقد هو لسه تجربة. يعني احنا ما عندنا اياه بالبروجرام at least for resident، عندنا اياها للاتندنج. وفي نقطة انه موضوع الهبة، يعني انت ما فيك تستخدم اي اي يكون مانو متوافق مع الهبة. يعني ممكن يصير لك مشكلة. نحن مش موضوع الهبة انفصل واحد عنا من كم شهر، انفصل من البروجرام على الأخير. فنازل جديد تجربة عم يستخدموا الاتندنج، لكن نحن لا، يعني لازم نكتبه بإيدنا تقريبا كل شيء. لكن إذا كنت مثلا عامل روتيشن من قبل هون فيعني رح تكون هي أسهل بالنسبة لك، بس عاد بدك تكون أنت كل ما رح نطور قسم الأسسمنت تبعيتك. يعني قسم الأسسمنت هو كل ماله بيتطور مع الوقت، كل ماله بيتطور مع نقاش مع الاتنين، نقاش مع السينيور. أعتقد إن شاء الله أكون جاوبت عليه. بالنسبة لشغلات كيف ممكن يتعلمها، بصراحة يعني هي ممارسة. يعني هي ممارسة وفيدباك هيك، يعني شبه خاصة أول فترة يومية إذا أنت مثلا ما كنت بتعرف. بعدين كل فترة ممكن تسأل السينيور بشكل عام. يعني هذا الفيدباك بيجي من السينيور أكثر من الاتندنج، إنه سأل السينيور إنه مثلا شو ممكن أطور بالنوت تبعيته. بتبلش أنت مثلا بصير عندك السمارت فريز تبعيتك، بصير عندك التامبلت تبعيتك، كل مالك بتطورها. يعني أنا مثلا من فترة قعدت فشفت شو أكثر شيء عم بستخدمه، كتبت سمارت فريز مثلا بموضوع بالأوت بيشنت، فصار عندي سمارت فريز للديابيتس، إنه شو لازم طلع، إيمت آخر مرة لازم طلع لي مثلا موضوع واحد معه هايبرتنشن، فمثلا شو شغلات لازم أعملها. فخلص أنا بصير بحط سمارت فريز تبعيتها، خلاص يعني عم تطلع كل الأسسمنت تبعيتها.
بس سؤال هيك مالته، لما قال لك كتاب HNP بالاي سي يو قلت له شو هذا، بعدين شو صار؟
هو النقطة إنه بشكل عام يعني الناس نوعا ما إنه ما دامك شايفين عم تسأل، يعني نوعا ما الناس بتساعدك. والوسط الحمد لله رب العالمين عندنا بالبروجرام يعني كلياتهم حابين يساعدوا، كلياتهم إنه كانوا متعاونين. فما حكي شيء، بالعكس يعني عادي يورجينا إنه مثلا بدك تفوت هلا على الغرفة، شو المريض راح يحكي، تكون أنت عم تحكي. بالأخير نحن قارين نوت، بس أنا ماني قادر إنه أنقلها من إنك تاخذ أنت قصة سريرية من مريض لإنك تنقلها لنوت. فقال لي هيك. بعدين عاد الاسسمنت، بصراحه الاسسمنت اللي هي كانت صعبه، لانه يعني انك انت تكون عم تكتب اسسمنت كامله وبالاي سي يو ما كانت سهله. فكنت نوعا ما اكتب هيك الشغلات اللي ببالي، بس كنت اكتب البلان كلياتها، انه مثلا المريض وعدد الدواء كنت اكتبهم كلياتهم. بس الاسسمنت اعتقد يعني هلا اذا رجعت اكيد يعني كانت الاسسمنت كثير سيئه. لكن مع الوقت يعني هو واحد دائما يشوف شو كاتبين باقي الناس، كيف مثلا باقي الناس عم تكتب، وياخذ فيدباك مثلا فانا شو كنت اعمل اول فتره انه اقعد قسم الاسسمنت اقعد اتناقش انا والسينر، كل شيء حكينا انا والسينر اقعد اكتب، يعني حرفيا ابدا، يعني نحن شو ناقشنا اقعد اكتب، حتى لو مثلا في شغلات انا ماني متاكد منها 100% انه شو هذا وليش هيك عم نعمل، فاكتبها وبعدين يعني الواحد بصير بيفهم شوي شوي.
هل حابب يضيف قبل ما ننتقل لموضوع الريسيرش
I just want to add two quick tips. For AI, it needs to depend on the program. Like for example, our program is like accept doximetry. So our fellow and me, myself, I do it for long procedure. I dictate it and then I can copy paste to my notes. It's like depending on the program. If it's not AI approved, I know for sure most programs have some programs for dictation. So you can say it and can translate to like words. So it's faster than typing. I believe when I'm doing my residency, it was called the Dragon. It just like record your voice and translate it to like word. So if you are not very quick typer, then it will take you forever after your time. So that's the quick things. The other thing, if you are starting something new, most programs do something called orientation or a day before. For example, if you are internal medicine, you are doing on the floor and then you transfer to the ICU next week, for example. I used to go on the weekend, just step by, see how the workflow, how they start, how they round. At least you have the luxury of coming in and leaving at this, like, because you are volunteering to do it. So I use always the weekend before my rotation, go there, especially if an inpatient rotation, I'm new to it, spend Saturday, see how the round look like, how they discuss the patient, how the workload will look like. So when I come as officially as rotating fellow or rotating resident, or not be in shock and just spend an hour just like to try to figure out where is my patient, where's my workstation, where I should do. So that help if you want to do and practice that, and that will reflect very good on you that you are preparing for your rotation.
I want to add something about AI because we use AI in our program for us residents. We have access. So we have an app called Abridge. So basically generates a medical note out of your conversation with the patient, and it's very smart. For example, you said a side joke with the family, it does not document it. But I would say it's a game changer. Definitely, it saved so much time documenting a note, but I would say as like a senior whose job is to look over juniors' notes, as me who's using it in their clinic as well, it's AI at the end. It's not human and it makes errors. So you have to, if you end up using AI in your program, because I think in the next 6 months it's gonna become more widespread, just be careful about it. It's gonna save so much time from your documentation. It's very much appreciated, but look over your note. Don't like just over depend on AI. Look over it. Like sometimes it misses something very important that you reiterated to the patient. Like it can miss it really. So you have to like, or sometimes like it doesn't say it and then way you like it to be said. It's not that coherent when it generates the note. So you kind of have to like fix it. And like sometimes some apps you fix it on the app so it kind of gets feedback based on you. So I will just say like don't heavily rely. It's definitely helpful, saves 80% of your time, but you have to look over your note. It's not as detailed as a note that you will sit and spend time doing. It's just gonna save you time, but you have to also put in the effort with AI.
Great. Great. Thank you so much. Let's go over the research questions. Mariam is asking, if I don't have a research background, how can I learn how to do research during residency?
We all didn't have much background, honestly. Like even my background from med school was like it could have been better. You learn from your mentors, okay? So like just be honest with your mentor what you know, what you don't know about research. Also, like part of ACGME, like it's from ACGME, part of your residency training, they have to kind of teach you some basics. Like they have to teach you basics of how do you do literature review, how do you submit for an IRB, because IRB is very complicated process. And like a single mistake, they'll just tell you like amend again, and then you have to wait again, and all of that, which is normal. So I would say it's part of like ACGME that the program has to train you about research, and when you do your annual ACGME survey, you have to answer with complete honesty if the program is teaching you or not. Also, like other things is like you have to, based on your project that you learn, like, you know, there's so much that can be taught on didactics to everyone for research. So when you meet your PI, your mentor, for example, like you know, you want to figure out a way to data analyze. So it's something you and the PI will discuss, or like how will you collect data. So you will learn from your mentor. So you're not alone, you're gonna be handheld, and it gets better once you do more research. You become more experienced. You can ask your seniors as well, especially if you're doing another project with like that's ongoing with a senior.
That's very good, but I would say it's good to see you have a 1 month, I believe, to start, and it's good to break the ice and read about, like, I believe SAMS has very awesome workshops about how to conduct research, how to start. And I feel if you just listen to some of the videos while you are driving or having break, so you break the ice, you will not go absolutely know nothing, especially if the other resident who was trained in American grad, they have multiple publications before going to residency. So I just hate for you to come as like so much behind them. They will teach you during residency, but your productivity will be faster if you just watch some videos or attend a course before.
Great. Let's jump into other question from Mohammad. Let's say I'm not interested in research and would like to apply for a fellowship, which is not competitive, like endocrine. Can I match into it without chief residency or without doing research?
Sorry, with chief residency, but without research.
Without research?
I would say not competitive fellowships you will match, but I just want to give you a heads up about fellowship in general. Especially me, I'm not a big fan of research, but this is a hard pill to swallow if you want to say that. But fellowship is more research heavy than clinical heavy, especially in pediatric subspecialty. Like for me, the structure for me is my first year, upcoming first year in Pete's Palm Fellowship is heavily clinical, and my second and third year, like out of, like I have 4 months in my second year, 4 months in my third year clinical, let alone each month clinic, but the rest is all research. So I would say just prepare mentally that fellowship is a lot of research. Definitely have, I mean, it's an ACGME requirement. You're not going to graduate from residency if you don't have a research project that's ongoing. It doesn't have to be published. It just has to be at least IRB approved. So this is something that's either was automatically should be on your fellowship application, an IRB approved project. So I would recommend you have one that's IRB approved by the time you submit for your fellowship ERAS. And I hate to say, like, you kind of have to like show them you like research. So maybe like I'm not saying do 5 publications. I don't have 5 publications for my when I interviewed for fellowship, but I had at least like I had 2 research involvements. Like I had 2 IRB approved projects going on. So you have to kind of show, and you kind of have to have the mindset that my clinical real life clinical things is not going to advance without research, because even in fellowship, like research is so advanced that your fellowship project could be either basic in a bench or clinical or translational. So you kind of have to say, I kind of like research. So I'm just going to be very honest.
Thank you for the honesty. Any other inputs from the other?
أنا الله يجزيكم خير، ما عندي إضافة، بس إضافة صغيرة إنه بشكل عام البروجرامز يعني في كتير شغلات تعليمية بكونوا عندهم مثلا اشتراك مع هذا الموقع، فيديوهات هون، شي كورسات مسجلة. فحاولوا إنه تسألوا دائما التشيف أو تسألوا البروجرام دايركتور إنه مثلا شو في عندنا ريسورسز. ولحد الآن يعني أنا كل ما سألت على شغلة بكون في ريسورسز أنا ما بكون حتى عندي خبرها. فدائما يعني اسألوا على هذا الموضوع، لأنه دوما البروجرامز بكون عندها كتير اشتراكات، والاشتراكات تساعدكم.
جميل جدا. طيب ننتقل للسؤال اللي بعده. Yeah, here. من بتول, has anyone experienced, or do you guys know if anyone experienced delay in starting residency due to visa restrictions? How did you deal with it, especially in terms of minimizing the gap between you and your peers? I don't know if you guys familiar with any.
During my third year of residency, we have 2 of the intern. Was one coming from Jordan, one was coming, I believe, from Mexico or something, and they have delay in their paper. They put them on admin, which will be not patient encounter. I believe you are not allowed until you have all your paper. So it was like more as like doing some modules, it was like with the coordinator office, so it was more like self-learning stuff until they got their visa in August. They let their program early, no, because I believe both of them were on clinical rotation. One of them was on ER, the other one was inpatient. So they tried to switch the other fellow with the program. So let your program know as early as possible, because need a lot of arrangement for that, and they will try to support you. So if you have any visa issue, please contact your program and let your coordinator as early as possible.
Okay. And we also have a very important question from Kinda. She's asking, how can I feel more confident doing the physical exam for my patient starting from the beginning of my intern year?
That's a very good question. I'm from the old age when we used to do something called clinical exam, which was like examining mock exam when you do 10 patient encounter exam and write question as a part of CPMG certification. So I used to, honest, that was like the early things that how to use a learning, but I believe it's good to like examine your family, whoever you have, friends, etc. Heart exam, auscultation to be long with the exam, and there's a lot of like I believe PowerPoint or videos about clinical exams. So it's good to watch and just to know what's the cardiovascular exam look like, what the skin exam look like, what the, for example, like what endocrine exam look like, how to palpate, etc. What the hematology exam look like, what are the positive markers that you need to document on each system that you examine and present or not present, and then practice with whoever is around with you, like family, friend, etc. And if you don't know, that's fine, that they will teach you.
الله يجزيكم خير يا دكتورة. أنا إضافة سريعة يعني هو إضافة للشغلة اللي ذكرتها الدكتورة، ممكن يكون هو الواحد بالتغذية الراجع. يعني مثلا أنا اليوم شو عم أشوف، ارجع رد اقرا على هاي فيزيكال إكزام إنه أنت رح ترد تنعاد معك. يعني أنا مثلا في شغلات يعني كنت شوفها وأقراها، بس يعني أنت قليل لحتى تشوفها على أرض الواقع. فلكن لما أرجع أقرأ عليها، فلما مرة تانية أنا أشوفها خلاص أنا عرفت شو يعني ثبت المعلومة بشكل كتير كبير. فحاولوا إنه أنتوا الإكزام اللي عم تعملوه اليوم تروحوا تقروا عليه، فلما بتعملوه مرة تانية كتير بيثبت معكم. النقطة الثانية هي موضوع حكينا عن موضوع الاتيتيود تبعيتك. نحن عندنا بالمشفى عندنا ميديكال ستودنتس، فبشكل عام معظم الاتندنجز هن نحن بخلوهم نشتغل على النوت، وبياخذوا الميديكال ستودنتس بياخذوهم هيك راوند على كل المرضى وبخلوهم يعملوا فيزيكال اكزام عليهم. فانا اول 6 اشهر دائما اروح مع الاتندنج، اقول للاتندنج يعني ما في داعي تيجي، اقول له لا انا حابب اشوف المرضى. فانا اروح شوفهم هن يعني كثير، يعني تقريبا الميديكال ستودنتس هو الفرق بين التعليم هون وعنا. يعني الميديكال ستودنتس ما شاء الله بكون السكيلز يعني هن كثير بيركزوا على السكيلز، ما بيركزوا على المعلومات. ميديكال ستودنتس حرفيا ما عندهم معلومات، لكن كثير بيركزوا على السكيلز. فانا دائما كنت انه ايمتى يروحوا يعملوا راوند مع الميديكال ستودنتس روح معهم، وتقريبا يعني بيعملوا فول اكزام. بكون مثلا خاصه يعني انا مثل النورولوجيك اكزام، انا هيك ما تعلمتها مزبوط لوقت عملت عنا اسبوع النورولوجي. تعلمتها مزبوط، لكن من قبل يعني انه انت بتقول له سكويز ماي هاند امورك بخير. فاذا عندكم مثلا ميديكال ستودنتس واذا عندكم شيء سؤال حاولوا تروحوا مع السينيور، يعني خاصه وقت بيجي مثلا مريض جديد رايحين تشوفوا انت وياه، فقولوا للسينيور انه انا راح اعمل فيزيكال اكزام بس شوفي لسه شغلات لازم اعملها، او مثلا انت سمعت شيء شغله والله قولوا للسينيور قولوا شو برايك انا سمعان هون شيء لما لا. فاعتقد يعني هاي الشغلات بتساعدكم بالفتره الاولى انه يعني تكونوا عن جد عم تتقنوا هذا الامر. والسنه الاولى هي يعني لحتى الواحد يتقن هالشغلات، لانه بالسنه الثانيه انتم راح تكونوا المرجع للميديكال ستودنتس وللانترنز.
جميل كتير. طيب كونه building up on this question before Aghet's question, talking about preparation and physical exams, we are now in June 1st. We're still 1 month away. Would you guys recommend just chilling in this coming time, or maybe نشوف شوية فيديوهات عن physical exams, maybe to review, especially like for a person like me, you know, صلي برا I'm doing basic science research, so I'm kind of away from the clinical stuff for like 2 years, and I really feel that إنه في فرق، يعني في فجوة كبيرة. Would you recommend studying, reviewing, or revising anything, or just show up on first day like this?
I will advocate for preparing, to be honest, and reading and see videos. You don't need to stress about it and make it as like curriculum. It's just at least, I feel in my perspective, you should read about the most common disease coming to the ER or the inpatient, like fever, for example, abdominal pain complaint, forever. What are your differential and what the exam should be done? Chest pain, what are your differential and what the exam would be look like or what the investigation. I believe just read about these like 3 or 4 extremely common topic like fever, chest pain, abdominal pain, limb pain, for example, and what to do for physical exam. Watch a video and see something. I feel like the more you are prepared, it will be easier for you. You don't need to stress a lot about it, but I feel like some preparation and some reading, I believe most other do. And as well, like just have vacation, see family, etc. Just get ready to start your residency.
For reading during residency, like I echo her very strongly. So like yeah, like try to 80% of your time just soak in the time remaining because you're never gonna have it again. But read over basics just to make you stand out a little bit. And then the things as you go on training. So for example, like let's say you were on Heme Onc and you got about ALL. Let's say you're starting in August on Hemont. Maybe read about ALL a little bit. You're in the middle of training, but like some diseases, like random diseases, for example, like I am in the ICU and we have a really, really bad diabetes insipidus. I mean, I remember it from step 1. Maybe it came a little bit on my board questions, but it kind of slips through the cracks until you see it in real life. So, for example, also reading during your like in real time. So, for example, like when we got the diabetes insipidus patient with sodium of 180, I started reading more about it and like what are the updates in peds? Like, should we use DDAVP for central? Is it oral, nasal, stuff like that? What do we do for nephrogenic and all of that? So also reading in real time when you see the cases, you retain it like you'll never forget it.
يعني أعتقد إنه يعني مثل ما ذكروا أنا يعني ما الواحد هلا خلص يقعد يحط إنه أنا هلا بدي أخلص العلم كلياته وبدي أخلص كتاب الفيزيكال إكزام. في كتاب الفيزيكال إكزام 300 صفحة، أنا لأنه قعدت كنت بدي أخلصه بس ما خلص. ف آه لأنه يعني نحن بالأخير صرنا 6 سنين، يعني بواحد خلال شهر ما رح يقدر يخلص كل شيء. أنا أعتقد إنه مع الشغلات الأساسية اللي ذكروها، وأعتقد حسب شو الروتيشن الأول بدك تبلش فيه. يعني مثلا إذا والله أنت رح تبلش عندك اوت بيشنت، فحاول تركز هيك انه مثلا انت معظم المرضى هون رح يجيك دايابيتس، رح يجيك هايبرتنشن، فانا كيف شو هي الاسسمنت لازم اعمل لهم اياها. مثلا انا رح بلش اي سي يو، فاكيد بدك تقرا على الشخص، بدك تقرا على الميكانيكال فنتيليشن. بدك مثلا تكون انت الفيزيكال اكزام الاساسي، الفيزيكال اكزام تبعيت الرئات، الفيزيكال اكزام تبع القلب، يعني هاي الامور الاساسيه تكون عارفها. فحاول تقرا يعني انت شو راح تبلش اول شيء مشان يعني تكون انت عارف المعلومات الاساسيه. شو هي الشغلات لازم تقراهم. حاول تسال مثلا الموجودين بالبروجرام انه مثلا انا رح بلش هلا اي شيء، شو هي اهم الشغلات رح اشوفها. مثلا اذا رح تبلش على كونسلت مثلا جي اي كونسلت، اكيد روح اقرا على الجي اي بليدنج، شو نحن رح نطلب، كيف تعمل اسسمنت للجي اي بليدنج. بس ما تروح مثلا تقرا ميكانيكال فنتيليشن وانت بدك تبلش جي اي كونسلتس، بتيجي تقول لهم جي على كونسلت تقول لهم والله انا درست ميكانيكال فنتيليشن ما بيمشي حاله. فحاول يعني تقرا بما يتناسب مع شو بدك تبلش اول شيء. بالاخير هاي الشغلات الاساسيه، فيفا، تشيست بين، هدول يعني وين ما كان انت لازم تكون عارفهم.
Great, thank you so much. سؤال from Aghyad. He's asking, would research projects completed outside the US be considered and helpful?
Research project is very high value wherever you started. And especially if it come within to publication into like a journal, it's absolutely in your CV. It's extremely important, no matter where you did it.
Okay. ما عندنا لسه كمان أسئلة. في حدا حابب هيك يعمل إضافة أخيرة قبل ما نختم؟ طيب تمام. أنا يعني هو كان اليوم طويل كتير، أو في كتير ناس كانوا مشغولين ومو متاحين اليوم، فمتأكد إنه حيرجعوا يشوفوا، رح يرجعوا يشوفوا فيديوهات من اليوتيوب. إن شاء الله حتنبعث على اليوتيوب، ترفع على اليوتيوب مشاركة معكم. Thank you so much for the speakers. And I personally enjoyed it a lot. I learned a lot. I was thinking I was just gonna chill for the next month, but now I have to do stuff to طلع عليها بما بلش residency. Thank you so much for the really nice insights and inputs. Thank you for the attendees actually for being with us. في أبطال لسه صامدين صلوا من الصبح، فالله يعطيكم العافية. And we will send you guys the إن شاء الله بعد ما يرفعوا الفيديوهات على اليوتيوب. We'll send you the links. We'll also send you feedback. And that's it. Thank you so much and have a good rest of the day. Bye.
Thank you everyone for arranging and for the one who stuck around, and please reach out if you have any questions or concern. We are here around and we are happy to help.
Thank you, Dr. Bayan.